we can do quickly. And that's what we're focusing on right today. We are starting to turn our attention to the larger, more long-term issues of rebuilding demand in this state. And if you heard me talking yesterday, I firmly believe that the nation increased demand to build our economy again, to build our infrastructure in many, many ways. We can't just rely on what you think of as transfer payments. Unemployment compensation, its expansion, crucial at this moment. I'm glad we're doing it. Small business loans to help these companies survive, crucial at this moment. I'm glad we're doing it. But we do need, in the not too distant future, a plan to build this state, to create demand for these companies to get out there and start rebuilding our state and our nation. And that would require a special session.
Next question comes from Essex with Kara.
Yes, Governor, you mentioned $5 million for small business grants, but that sounds like such a small number considering the need. Is there any thought to expanding the amount of money that would be available for such grants? And for Director Brown, if a business applies for one of those grants, how long is it going to take for them to get the money?
Lisa, do you want to answer that?
Yes, Essex. The money should be able to be turned around really quickly. The partners that we're working with across the state are the chambers of commerce, the economic development entities that each county has. So there is already a familiarity with the businesses in their communities. So the funds will be, we're already have set up the contracts with those ADO organizations and hope to move through that process very quickly for these, as you said, relatively small grants, but $10,000 for a small business can help them with fixed costs, utilities, the kinds of things that they can't turn off right now. And we hope that in some ways this is a bridge. Those same companies may be eligible for the Small Business Administration loans offered by the federal government, but those processes are still being developed, and the smallest businesses with 10 or fewer employees are the ones that have the fewest resources to fall back on. So this will be available all across the state, and the application process begins today at the coronavirus.wa.gov website.
Yeah, I just want to agree with Essex that these are small numbers, but to a small business, a mom and pop restaurant that can keep in business when they get this benefit, it won't be small to them. It could be life-changing. So I'm glad we're able to do this, but we are going to require much larger infusions and investment in our state to really get our economy going. We certainly recognize that.
Hello, Governor. Thanks for answering my question. I actually was going to ask about construction, but that was already asked, so I'm going to ask a different question. I'm wondering, as you mentioned earlier, you were able to return 400 ventilators to the stockpile, and in that stockpile was included 20 ventilators that came to Yakima and then we gave back. So I just wanted to see if you could comment about possibly more ventilators coming to Central Washington.
Yes, well, we did a very extensive analysis of this and became very confident that we will have adequate ventilators across the state of Washington, including Central Washington, including Yakima, to suit our needs. Now, that's in part because we have another 950 ventilators which we are purchasing ourselves that are coming in the next days and weeks. So when we originally ordered those 400 from the federal government, our modeling showed that we would have a much more rapid increase in the number of people that were in critical care that needed ventilators. Fortunately, because what people are doing in Washington, we have been able to reduce the number of the people who will need that, particularly early in this event. And so it turns out that the need was not there. So we did what Washingtonians always do. We acted responsibly to help everyone, and those are going to go to places where they have critical shortages today in their ICUs, and there's a number of them, obviously, including New York and soon Louisiana. So I think we made the right decision. We were teamed up with Oregon and California in this regard, and I think we're in good shape on ventilators. But I do want to make this point, and forgive me if I've said this before. there is going to be a very human temptation in the next several weeks that if our fatality rate starts to go down, and we hope it does, that is not a certainty, but if it does, there's going to be a human inclinations to let up, to take it easy a little bit, thinking that we're on top of this. That could be a fatal mistake. So yes, we have returned ventilators, but we are not free of the threat of losing hundreds of other Washingtonians as we continue to improve. And the way I think of this is, you know, my dad was an old track coach, and he always taught runners, you got to run through the tape. You don't stop 5 yards before you hit the tape. You got to run through it. We got to wrestle this to the ground. We got to get it so low that it's not going to come back and bite us again. And to do that, all of us are going to have to really concentrate on the task before us. And fortunately, people are. We're continuing to see huge, massive commitment of Washingtonians to being safe and helping each other.
Next we go to Drew in the back.
Good afternoon, Governor. There appears to be a building group in Idaho encouraging folks to ignore the orders. The sheriff has endorsed that move. There's talk of public Easter services. Any concerns for you along the eastern Washington border that some of those folks may, as they do, come into the state of Washington? And do you see any need to increase enforcement in that part of the state or anywhere with the Easter weekend coming up?
Well, to my knowledge, we have not seen that in the state of Washington, which is a good thing. Look, we know how important faith is in many, many lives in our state. We know that it provides comfort and hope and the benefits of faith. We understand that very deeply. But we also understand that it can be a fatal communion. And that's just too dangerous right now. So we have had enormous cooperation of our faith community in Washington State who have abided by this because they recognize the power of love, and the first power of love is not to infect your congregant. And we built into our order the ability for churches to have a number of people in their churches to run their social networking, so you can have virtual services, and I think those are being quite successful. So we hope that will continue to be the case. So at the moment, we've just had, like I said, the vast majority of Washingtonians are trying to take care of their loved ones and the state, and we have not seen that problem in our state.
Next we have Jim Hampton with the spokesman review.
Thank you, Governor. A couple of numbers type questions. You mentioned the 300 beds that the state is returning. I'm wondering if you're confident that you can get those beds back if you need them, if at some point things do not continue on this progress. And on the $5 million worth of grants, are those going to be divided up across the state based on population, some other metric, or is it first come, first served?
Lisa, do you want to comment on that?
Sure. We're putting in place a way to have some regional equity. So yes, people should apply right away because there will not be enough funds for all that would like those funds for every business. But we will be evaluating them according to each county's applications that they send in so that we can make sure we have a distribution across the state. So I'm here in Spokane right now. Greater Spokane Incorporated will be the partner organization that we work with here.
Does that answer? Jim, you had another question that escaped me. What is you had another question there?
About the 300 beds, are you confident that if you need those beds in the future, if things don't continue to go in the positive direction that we're seeing, can you get them back?
Yes, and I think you're finding governors who are sharing this responsibility. As I've indicated, Washington, California, Oregon all acted responsibly in this regard, and I think you're going to find a common sense of that across the country. We have had very open communications with FEMA, with the U.S. Army, with the Navy, with Vice President Pence, who I speak to probably every other day. So we have very good communications with our federal partners to try to talk about these prioritization issues. And we've been appreciative of the federal government who has helped us in any number of ways. So I feel confident about that. Look, if I did not feel confident of that, we would not have made these decisions to release some of these assets. Obviously, this is my home, this is my state, and this is where my heart and responsibility are, but I feel good about where we are right now in that regard. But as I have said now, we can only be confident if we maintain and to some degree increase our commitment to the social distancing. We can only be confident if our citizens over the age of 65 don't go to the grocery store when they don't have to. Ask somebody else to help them. Only if we have business leaders maintain social distancing if they are still open. Only if we can keep our young people from congregating in beaches and parks. All of those things need to continue if we're going to succeed on this. You may have seen some modeling done by the Institute for Health Metrics here in Seattle, and it had some good news for us that suggested our predicted fatalities is going down from what was earlier predicted rather significantly. That's really good news, but people need to understand in that model, it is modeled on the assumption that we will continue to keep our nose to the ground here and our shoulder to the wheel. If we let up, that number's going back up again on fatalities. So this is a moment of sustained effort to keep this all the way until the end of the game here. We are in a very unsatisfactory position. And this has been my greatest frustrations where the federal government has not acted with as much intensity of leadership that we need. We have hundreds of people that we would like to test today, including some in our long-term care facilities that have had people infected in their facility that cannot get tested. And the reason is that there simply are not enough tests. We are in a very unsatisfactory position. And this has been my greatest frustrations where the federal government has not acted with as much intensity of leadership that we need. We have hundreds of people that we would like to test today, including some in our long-term care facilities that have had people infected in their facility that cannot get tested. And the reason is that there simply are not enough test kits. A swab, a vial with what's called transport medium in it, where you take the sample and you put it in and it keeps the virus in a position to be sampled. Those kits are simply not available to us, and this is massively frustrating. We are searching the world to acquire them. I spoke this morning to a company that makes these swabs. And so as governor, I'm actually trying to procure them everywhere in the world right now. And I think we're going to succeed, by the way, to accelerate a procurement on that because of that conversation. So we are doing everything humanly possible, but there is a world shortage of these. And that is why I have been trying to urge the administration, with all the power I possess, to use their ability to order the production of these kits. The President of the United States does have legal authority under the Defense Production Act to order companies to manufacture swabs and vials and transport medium to get this job done so that we can distribute these kits to the people who need them in the state of Washington. And so far, by and large, the President has not been willing to exercise that authority. Our delegation has urged the president. I was on a call this morning with our congressional delegation, and they have been very vigorous in this regard. Adam Smith, who's obviously a leader in the armed services community in the House, has urged the administration to move in this direction, largely to no avail. Now, we're doing everything we can. We're contacting companies or looking for companies that might be able to manufacture these kits as well. But the federal government has much more ability to move the manufacturing base, and we wish that they would use that opportunity. Now, the kits are not the only issue. We also have to dramatically increase the ability to analyze these samples, meaning the analytic capacity of the whole system has to increase several-fold. And this is something I don't believe yet the federal government has come to terms with, of how much we have to increase testing capability. Because we're going to have to increase it dramatically as we come through this epidemic to allow people to safely return to work. So I can't overstate the need for increased capacity, the need for federal help on this, and the need for us to be as vigorous as possible to obtain this equipment. Now, as a result, we've had to make triage decisions, where if you have two places where you need the kit, you've got to make a really hard decision about the way to save the most life. And we're making those decisions every day, and they're very, very difficult. So we're doing everything we can to improve that capacity, but we need a lot more federal help. Keith, are you with us? Are you muted? Hello.
Talking about the shortage of test kits. A week or so ago, time was still meetings. Sometime recently, you asked Washington state companies to come forward to volunteer their services. Have you been able to locate anyone in the state of Washington who's able to help us with test kit materials?
I don't believe so as of this moment, but I'm going to be having a conversation with leaders in the life sciences industries in our state in the near future, in the hope that we can identify some additional assistance. And if anybody who's listening to this production has any ideas, please let us know. These are critical, and we need help throughout the supply chain to make this happen. So we'll be diligent. If you have an idea, send it to me. We're going to keep up this work. Final remarks, just want to thank everyone for what you're doing. Winning an effort like this is a collection of thousands of small acts. And I want to thank everyone for their small acts that are adding up. The people who are shopping for a grandparent, the people who are finding a way to help a student right now in these difficult times when they're not in school, helping with childcare, with hardworking parents that are telecommuting. All of these small acts are what actually wins a war. That's how you win wars. There are millions of small, heroic actions. I want to thank everybody for what you're doing in this regard, and we're going to get through this together. Wash your hands. Thank you.
Hi everyone, thanks for coming. My name is Jonathan Modai. I'm Lead Communications Officer here at the Oregon Health Authority. We're here to provide you an update on the state's novel coronavirus COVID-19 situation. And we have Governor Kate Brown, we have Pat Allen, Director of the Oregon Health Authority. We have Jennifer Vines, Dr. Jennifer Vines, Tri-County Health Officer, and Dr. Dean Seidlinger, who is Health Officer and State Epidemiologist. Governor?
Thank you.
Yep.
Good afternoon, everyone. Thank you for being here this evening. This afternoon, we learned that we have Oregon's first case of the COVID-19 coronavirus. Earlier this week, federal health officials advised Americans that new cases of the COVID-19 coronavirus were likely to occur. That is why I directed my agencies to continue more active preparations. And that's why today I stood up a coronavirus response team to coordinate these efforts statewide. I understand that this news is concerning. However, I want to reassure you that our state and local authorities are responding quickly to the case. They are professionally trained to handle this situation. Oregonians should know that we are taking this very seriously. Officials will provide immediate updates as we have them. With that, I'll invite Oregon Health Authority Director Pat Allen to give more specifics and what next steps our health professionals are taking. Thank you very much.
Thank you, Governor. First, I want to acknowledge that there has been a great deal of concern around the world and here in Oregon about the COVID-19 coronavirus, and that concern is real and reasonable. As the Governor indicated, we've had our first presumptive case of COVID-19 in Oregon. What does that mean? That means that the individual who was under investigation had a test done, and that test was returned positive. That test was done by the Public Health Laboratory here in Hillsborough. Earlier today, we were doing a variety of briefings about our preparedness, and at that time, that capability wasn't yet online. It actually came online during the day today, and so it was able to be deployed and provide that test. We'll do a confirmation test through the Centers for Disease Control and Prevention in Atlanta, and so the case will be considered presumptive until we receive a confirmation one way or the other. The case is from Washington County, and the individual is currently at Kaiser Permanente Westside Hospital. In the interest of privacy, we will not be disclosing the age, gender, or specific condition of the individual. Nevertheless, our concern is certainly with that person and with that person's family, and we want to provide all the support that we can for them. There was no known travel exposure for this individual, so this is a case of community spread of the disease, much like the case from California earlier this week. The patient has spent time at the Lake Oswego School District at Forest Hills Elementary School. We're working with the local school officials and the Oregon Department of Education in the response. We're also working with Washington County and Clackamas County public health authorities to conduct contact tracing to notify people they may have been in contact and offer health guidance. We're also providing guidance to local healthcare providers to help them respond to inquiries they may expect to get from parents and other community members. We've notified the Centers for Disease Control and Prevention and are working closely with all of our local partners. What we don't know. We don't know the number of close contacts being within 6 feet for a prolonged period of time that this individual had. We don't know how this person became infected with COVID-19. It's too soon to say what impact this case has on family, friends, coworkers, or the Lake Oswego School District and other members of the community. Contact tracing is our top priority right now. We'll notify the public as soon as we receive any information about potential exposures. What are we doing? We will notify anyone who is likely to have been exposed. We're continuing to process COVID-19 tests as necessary at the Oregon State Public Health Lab. Earlier today, we identified that there were 2 individuals under investigation, and so we're testing that other individual. We will announce any individual positive test results when we become aware of them. What can you do? The advice is actually pretty simple and has been around for a long time. Cover your cough and sneeze. Wash your hands. If you begin to have symptoms of a cold or flu, it's critically important that you not go to school or go to work. Stay home and call your healthcare provider for guidance. And stay informed. The OHA website, healthoregon.org/coronavirus, has a variety of information pieces for individuals and providers. And the 211 information line is equipped with information to answer inquiries that you might have. We spent a lot of time today at the Capitol and talking with you all about preparedness for this event. We've been expecting this and we're prepared for it, and we're using the system that we described today to respond and help keep Oregonians safe. Now I'd like to turn it over to Dr. Vines.
Good evening, everyone. I'm Dr. Jennifer Vines. I'm a family physician, and I'm the lead for the Tri-County Health Officer Program. That's Multnomah, Clackamas, and Washington counties. I also want to acknowledge the seriousness of this first case. I want to let the family of this ill person know that our thoughts are with them, and I want to acknowledge the public concern that we've been planning for and working hard to address the last several weeks. I would also commend our colleagues at Kaiser Permanente for alerting us to this case and for treating this person and looking out for their frontline healthcare staff. So I would say that we are early in our investigation of this case. We are working tonight and through the weekend to determine where this person spent their time, who may have had close and prolonged contact with that person, and who will need health education to be on the watch for symptoms. We do know this person spent time at an elementary school in Clackamas County. We don't yet know exactly the risk of that the time there poses to those students, but my colleague, Dr. Sarah Present, the Clackamas County Health Officer, is here tonight. She's in direct touch with the school district, and they'll be announcing their next steps shortly. So this is your local and state public health system prepared and doing what we do, which is identification of cases, identifying people who may be exposed, and making sure they have the information they need to stay well and stay safe and keep the rest of us safe. So again, the things for all to do are cover those coughs and sneezes, wash your hands, and now is a good time, like ahead of any potential emergency, make sure that you have a plan for your family, that you have food, medicines, pet supplies for at least a couple of weeks, have a plan for childcare should you need it, and know what your employer's sick policies are so that you can stay home at the first sign of symptoms. So thanks. With that, I think, are we taking questions?
I guess, can you go over again this page? So you're calling this person a Washington County citizen, is that correct, this individual?
Washington County resident.
But spent time at Forest Hills Elementary School in Lake Oswego?
That's correct. The person lives in Washington County and spent time in the Forest Hills Elementary School. We're trying not to be any more specific than that in the interest of patient privacy. Yeah, it's an adult.
And is this patient still currently at Kaiser?
I can't comment on their current treatment or health condition.
Hospitalized?
Yeah, they are still hospitalized.
And when you say presumptive case, is it presumptive until these tests come back from Atlanta?
Right. We're getting our positive test result confirmed. If the test comes back from Atlanta positive, then we'll stop calling it presumptive and say it's a positive case.
Positive here, still waiting.
Right. But the guidance from CDC is we should treat a presumptive case as a case until we have any further information.
Can you differentiate between the term hospitalization and quarantine? This isn't a quarantine, this is a hospitalization?
Correct.
Say how long you expect it to take to get those results back?
Very shortly. We're having them expedited, and it could be over the weekend, and we'll provide that information if it is.
So just to clarify, Forest Hills Elementary in Lake Oswego, spent time there, and then also an elementary in Clackamas.
Forest Hills Elementary is in Clackamas County.
Okay.
Do you expect Lake Oswego School District to come out publicly with some sort of plan tonight?
Yes.
This weekend?
Yes.
Okay. Obviously, since you guys sent the notice to us about this, social media, everyone get anxious about all this. What do you tell them? I mean, people are obviously concerned.
Yeah. So the concern is completely understandable. For most people who contract this disease, it's like any other coronavirus, where the disease itself is relatively mild. A small percentage of people will have a serious disease, and it could progress that way. The most important thing to do, as mundane as it sounds, is cover your cough and sneeze, wash your hands, and this helps demonstrate most critically at the first sign that you have symptoms of a cold or the flu, you should stay home.
I just want to add something. I just want to reassure Oregonians that we are taking this very, very seriously. I also want to encourage Oregonians to go about their daily lives, to stay calm, and as Pat and the doctors have mentioned, to take appropriate public health safety concerns, including covering your mouth when you cough or sneeze, using a tissue, washing your hands thoroughly, and if you're sick with the flu or a cold, to stay home from work or from school.
Governor, were you aware of this presumptive case when you announced the response team this morning, or is this kind of really new within the last couple of hours?
I was not. My team learned of this case at about 3 p.m. this afternoon.
Can you tell us, I know you're trying to keep the person's privacy, what city in Washington County they live in? Or a general area?
Cannot.
Can you say any more about why they were at the school, where they appear?
I'm sorry, we cannot.
Any idea how many people we're talking about that you are attempting to locate?
Dr. Vines.
So I would say we are early in our investigation. We have people working on this literally as I speak, and we'll be working on it through the weekend to identify those who had close and prolonged contact with this person and may be at risk for transmission.
And you can't comment on how they're responding to this illness, what their condition is. Is it mild for them, or is it more serious?
For who?
The
Patient? No, we're not seeing anything other than hospitalized.
And once again, you said this is a community transmission event. Can you talk about what that means and how
Sure.
that is different from some of the other cases we've seen nationally?
Sure. So what we know so far is that this presumptive case does not have travel to any of the known affected areas in the world that have coronavirus transmission ongoing. That leads us to conclude that this person acquired this infection here somewhere in our community. So that's how we call it, presumably a community acquired case.
So they didn't take a plane or anything like that at all?
As far as we know right now, that is correct.
So if they got this from the community, then do we assume someone in the community or someone else that has it? Or how does
Right. So that's the question that we need to answer. And as we identify contacts, and in particular, as we identify people with close contact, ask them to watch for symptoms. If they develop symptoms, they would become candidates for testing, and we can start to get a better sense of how contagious this disease is and what is the range of symptoms that people have with this virus.
Do you think this is going to get a little more concerning before the latter? I mean, obviously there might be someone else, and then you mentioned the second patient. Looks like we might see an increase in numbers here.
I think that's possible, especially now that we have local testing capabilities, which is a real asset to our public health system, to have the state public health lab able to run this test. So the case count may very well tick up, and again, that's public health doing its job of confirming cases in people who've had a known exposure and who develop compatible symptoms.
Were you guys aware of the rumor circulating that somebody with coronavirus was at a Kaiser Permanente facility?
Is that from several days ago?
Several days ago, yes.
Yes, I was aware, and I helped dispel that rumor.
Well, now that we're hearing this, is that the case that people were talking about, or is this something
No.
Now that it's here, we had heard of the California case in Northern California where testing from the CDC wasn't being done as quickly as they would have liked. Has that ramped up? Have national officials reassured you that we have new potential cases coming in, that they will be tested quickly, so maybe this can be isolated?
So just to add, the Centers for Disease Control this week, after that case in California, did expand the number of people who would be tested. So the people with serious respiratory illness who are hospitalized, even without a travel exposure, are now being tested. And they've also committed to ramping up the state public health lab testing capability, which was able to come online today after it was being certified. So yes, the CDC is working to increase that capacity so that we are able to test the people that we're investigating who need that test, so we can confirm whether or not they have this new virus.
What about school closures or quarantining of entire communities? Is that something that is being looked at right now as far as where this patient is located?
Could you repeat the question for the online?
So the question is, what about the tools of school closures or other things that we could do to limit the spread? I think those are tools, as you've heard from us previously today, that we have in our toolbox to try and control a condition. The reason we have people working tonight and through the weekend to identify who this person has contact with, so we can try and draw a tight circle and see the people who are at risk, identify them, assess their symptoms, see if they need to be tested. If we do notice spread in our community or multiple cases, that is certainly something we would consider on a case-by-case basis if the situation escalates in Oregon.
How quickly can you ferret that out? Like you've probably done this before with different illnesses. How quickly do you guys move? When will we know the amount of spread?
So when we know of a case, you will know shortly after us if we identify a case. We've been doing this continuously with our persons under monitoring who've come into Oregon and already cleared about 180 of those people who did not develop symptoms and are now in our community with no threat at all. We have additional Oregonians who've been very compliant in working with our local public health officials and staying home, talking about their symptoms and reporting things. We've had 2 people prior to this who developed symptoms when they were under monitoring, were tested, and those came back negative. So we have the utmost confidence that people are complying and listening to public health. We know there's a lot of concern out there, and that's why we are announcing this case, even though we don't have all the information, because we want people to be assured that public health, the state, our federal partners, our local partners are working together to do everything we can to ensure people are protected.
So is this person self-quarantining, or not self-quarantining, but they're in the hospital?
This person is in the hospital and is isolated.
What about the members of that you know have come in contact with them already? That you don't know if they have it, but have you asked them to kind of
So
stay isolated?
our Kaiser Permanente, our healthcare partners are working very hard on making sure that their staff are protected and taking the steps they need, and our local public health partners who are working with potential close contacts, including this individual's family, are also assessing to make sure that people are taking precautions and not exposing others.
Is there concern over other areas in Washington County where this person could have spent time? I know you mentioned the school, but is there any other areas that you guys are looking into where this person could have spent time that is posing a risk to others?
So that's a great question. Part of the local public health response is to do a detailed timeline of where the person was during the period that we think they were most infectious. So again, that's happening literally as we speak, and we account for pretty much every minute of the day in an important potential exposure like this one. So again, we're looking more for close and prolonged contact, but we are making sure that we do our best to capture anyone who may be at risk and needs to know that they've been exposed.
Dr. Vines, can you explain again the second person you guys are, is there another person that's being tested and you're waiting for those results to come back? You mentioned that, you know about the second.
Yeah, so we committed to doing weekly updates, but since we're here, there's another individual who has developed symptoms and would fit criteria for testing by the CDC. Those results are currently pending, and if those results come back positive, we will certainly confirm those as soon as we have that. To confirm what Dr. Vines said, we work on these prolonged close contacts for these investigations to identify who's at risk. This is not like a measles investigation where even kind of being in the same room with someone or after someone would put you at risk. It does really require kind of being close, having a conversation. Passing someone on the street or in the store isn't going to put them at risk, so that's why we want to reassure Oregonians are safe, as Governor Brown said, and we will work to identify those individuals who had close contact with this person so that we can assure that those individuals are safe and are able to take the steps they need to protect themselves and their families.
Just to clarify, that second person you're waiting on those test results, they were in contact with this confirmed case?
There's no connection between these two.
I just wanted to add real quickly that, and the governor mentioned this as well, you guys literally got information about this within hours of the time that we did, and we're committed throughout this, if there are subsequent cases, to continue to maintain as high a level of transparency as we can. That means there will be times where there are a whole bunch of questions that we can't answer about the individual, but we want you and we want the public to have information about positive cases as quickly as we can.
Mr. Allen, you fully expect more cases to pop up in Oregon given this news today?
Well, I think the CDC has indicated that they think there will be widespread incidence of the disease, and I don't have any reason to disagree with that.
But also saying that right now you say that the exposure for people is low risk, people should go about their lives, go places, do things.
Yeah, I might actually rely on Dr. Dean to comment on that a little bit, but this is not a disease like measles where the virus persists for long periods of time after someone's left. It requires close, prolonged contact, and that's a different circumstance than some diseases that we look at.
Dr. Dean, do you want to add anything to that?
Yeah, I think this is the conversations we have every flu season. You know, the reason we talk about people with flu staying home is one, so that they can recover, but two, the people that they work with or when they're in school, that they're sitting across from having conversations, those are the people most at risk. So if they separate themselves at home, they're not going to put other people at risk. Diseases have very different ease of transmission from one person to another. Something like measles is incredibly good at spreading from one person to another person, and that's why we identify public places, supermarkets, airports where people may have been, so that if people develop symptoms, they can take action. We also, in a disease like TB, we know it's very hard to spread from one person to another, so we usually have very limited people who are at risk. This is something in the spectrum between tuberculosis and measles, but really closer to tuberculosis. It requires someone to be within about 6 feet, that person be coughing or sneezing to have those particles affect the healthy person who's with them to get infected. Unfortunately, what we don't have with this disease is a vaccination to prevent it like we do with the flu. It is still not too late to get your flu shot, and we remind you that flu is still circulating in the community, so someone who develops these symptoms of fever and respiratory infections may have the flu, and there's something that they could have done to protect themselves and their family by getting that flu shot, so get your flu shots.
Governor, can I ask you, are you confident with what's going on nationally to address the coronavirus?
Look, at least the work, I am very confident about the work happening in Oregon. We've handled these situations before, the Ebola virus, the H1N1. We have very well-respected, trained public health professionals, and I'm confident both in terms of our ability to handle the situation in Oregon and that we have the resources needed. I just spoke with Senator Merkley about a half an hour ago. He is working with his Senate colleagues right now on legislation to provide states with additional resources to combat this virus. And so I look forward to seeing that work get done in Congress.
One more question? Two more questions. How about two more questions? More questions.
The person is employed at Forest Hills. Can you say any more?
Not right now, no.
When do you expect to have another update? Are you going to do another press conference? Like, do you know more? Like, say this person who has the second set of tests comes back, will we?
As soon as we have additional information, we will update the public.
This weekend, if you get a positive result, will you?
Yeah, we won't wait till Monday.
We will update the public as soon as we have additional information, regardless of the weekend.
Just because you guys are here, I mean, just to read, it says the individual is employed at a school in Clackamas County and may have exposed students and staff. The school district is planning to close the school to allow public health officials to complete their investigation, including contacting employees there and family of children to inform them of their exposure and let them know the next steps.
I think, as we said, as Director Allen mentioned, we wanted to get this information out as quickly as possible, and obviously over the course of the evening you're going to see additional information coming out to assist the public in decision making.
Thank you.
Thank you.
Thank you.
Well, thank you for coming. Today, again, we are trying to be sure that everyone is kept up to date on the progress of the virus and the progress of our efforts to fight that virus without destroying jobs and families. So today I'm issuing another order. This is a mandatory order. We've issued several that contain mandates and others that contain recommendations. Today, most of those recommendations are becoming mandates, becoming orders with criminal penalties attached. I'm issuing a mandatory home or work order. A home or work order that goes into effect tomorrow afternoon, Tuesday at 5:00 p.m. to close the business. Everyone under this order, everyone should stay home unless they're working, they're visiting family, recreating outdoors, unless they're obtaining necessary goods or services, and those are the limits. We're closing no additional businesses. Those businesses have been closed in previous orders. Also, we're requiring mandates of the retail stores that are open, and that is they must limit the customers. We must have social distancing in these stores, and that specifically is no more than 5 customers for every 1,000 square feet in a retail business, or 20% capacity, according to the fire marshal, whichever is less. A violation of any of these mandatory requirements is a misdemeanor, 30 days in jail and or $100 fine for each day of violation. Why are we doing this now? Why not wait later? Why not have done it earlier? That is because it is time, according to the data, according to the science, according to the facts, and according to the expert advice and guidance, as we have explained before, it is now time to make these recommended actions required. Why is it time? Because too many people, from the statistics, from the facts, from observations, too many people are on the roads, too many people are on the waters, too many people are in the stores, too many people are not requiring with our requests concerning social distancing. We've asked, we've urged, we've suggested, the experts have suggested, everyone is aware of the information that we have disseminated, but the last week or so has shown that it's not enough. The rate of infection is on the rise, and the rate of non-compliance is on the rise. We hope that this order today will reduce the rising rate of infection and also reduce the rate of non-compliance and also reduce the number of people who are losing their jobs because of these necessary orders. This week, ladies and gentlemen, we had over 200 this week. By the end of this week, we expect to have over 200,000 people who have applied for unemployment insurance in South Carolina. That's just the tip of the iceberg. Each one of those 200,000 people likely represents a family. And we know there'll be more. We know there are many more than that have lost their jobs, either because of the market, because of steps taken by businesses and services, or by the orders that we have issued. All of those people have to pay bills, they have to feed their children, they have to save for college. There are many things that people will not be able to do because of these orders. It'd be difficult at the least. So we must be aggressive in going after this virus, but we must seek to do as little damage, as little destruction to the homes and the businesses and the people and the jobs as is possible. Finally, as for the General Assembly, as you know, we have to have a budget, we have to have laws, we have to have business done in the General Assembly. So I am urging the General Assembly to come back to work on Wednesday, as has been planned, and get it done. We have cashiers going to work, we have police officers going to work, we have all kind of people going to work. There's no excuse for the members of the General Assembly not to come to work on Wednesday and take care of this vital business. And finally, again, on Easter services, we recommend that those services continue, of course, but we urge the churches and others to stream on the internet if they can, to meet outdoors if they can, and if they can't do those, please provide for that social distancing in the church. Now, speaking of Easter, would the chaplain please come forward?
I want us to remember a few words from the preamble of the Constitution. That says, "We the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity." If you would, please pray with me if you're a praying person. Great God, you are a God of unity, a God who requires us to love justice, and who longs for peace and mercy amongst his people. During this time, help us, we the people of the United States, continue to love one another, serve each other, and let the spirit of South Carolina and America shine through us all as we patiently obey and pray for the leaders over us, and pray for the healthcare workers and other servant leaders selflessly tending to our needs. I pray all these things in your mighty name. Amen.
Thank you, Governor. Good afternoon, everyone. We are reporting 183 new cases of COVID-19 as of today, which brings the total number of people confirmed to have the disease in South Carolina to 2,232. Over the last week, we have seen an accelerated rate of new infections. In South Carolina, an average of 187 new infections per day have been reported in the past week. That is an increase from an average of 90 new infections per day being reported in the week prior. We recognize the hardships that are facing many South Carolinians as we continue to respond to this public health threat together. I want to reassure the public that we are working hard together as a team from the local, state, and in concert with our national partners to protect the health and safety of all South Carolinians. And as of today, we continue to work with healthcare facilities to stay updated on the availability of acute care beds throughout our state, and currently we are at 51% capacity. A total of 21,384 tests have been performed by both the DHEC Public Health Lab and private labs on South Carolinians in our state, of which 2,232, or approximately 10%, have been positive. While our state's public health laboratory has no delay in testing, private laboratories around the nation have significant delays, which would indicate an even higher number of cases yet to be reported, and we should also include individuals who may not be tested. We are working to avoid the problems that the most impacted areas are seeing related to the stress on the healthcare system, including hospitalization rates, ventilator availability, and others. And we are doing this by prioritizing our limited resources. Our current data shows us that social distancing and staying home helped combat the spread of disease and ultimately save lives. However, while these hard-hit areas of the country are continuing to have significant daily mortality, it puts us in the best position if we plan for the worst. The daily case counts in some of those areas is improving due to strong mitigation efforts, and we've worked in consultation with the governor to implement effective measures to slow the spread of the virus. Our ability to combat the spread of the disease will depend on the actions that each of us takes. This is a historic and unprecedented event, and how we respond as individuals, a community, and a state will be remembered for generations to come, and we ask for your continued support for following the guidance of public health professionals so that we can continue to fight on your behalf. Please do your part, stay at home, and limit close contact with others. And as always, for the latest information, please visit our webpage at scdhec.gov/COVID-19. Thank you.
Thank you, Dr. Davidson. Mr. Davidson.
I'll briefly cover a few items that will be posted on our website later today, both an explanation and a video. Earlier this weekend, the CDC released information regarding the use of cloth masks and face coverings. While these measures are optional, they may help reduce the spread of the virus. They are not intended to replace social distancing or hand washing or any of the other recommendations intended to protect health. South Carolina residents should not run out and buy masks. As a reminder, the CDC has warned that this is a historic and unprecedented outbreak and that supplies are limited. It is important that we save the manufactured masks, be they surgical masks or N95 respirators, for doctors, nurses, and first responders who may need them most. Homemade masks may reduce the amount of virus that one breathes out and may prevent one from touching the nose or the mouth. This measure is recommended to be used in situations where social distancing may be difficult to maintain, such as grocery stores, pharmacies. It's intended to protect others from those who may be infected with the virus and able to spread it but not yet showing symptoms. People wearing masks should not feel a false sense of security as well. This means that masks should be worn to help protect others. It's important to understand that these recommendations do not allow for someone to go out in public if they are ill. They still need to practice social distancing, stay at home if you're ill. Individuals with symptoms should continue to isolate at home, but may consider a homemade mask when leaving to get medical items if a homemade mask is all they have. Again, we will post on our website instructions and a video for making a homemade mask. It's quite simple. All you need is a piece of fabric. You can take the fabric, fold the fabric so that it fits over your mouth and nose. On one end of the fabric, you cover it with a rubber band about 2 inches from the end of the fabric. You do the same on the other end of the fabric, about 2 inches down. You then overlap the fabric on either end, grab the rubber bands, and then pull it to the nose and mouth. Again, that video or a video similar to that will be posted on our website, as well as written instructions as to how to make a homemade mask. Thank you.
Thank you.
Thank you, Governor. Since the announcement of the Governor Master's executive order issued on March the 17th, the South Carolina National Guard has been working with a strong coalition of personnel comprised of various state and federal agencies and our healthcare professionals here in the state of South Carolina to determine the possible impact that the current COVID-19 response plan could have on our healthcare system here in the state. We have implemented a scalable, tailorable, tiered response to increase the bed space, staffing, and other support services needed to operate a medical facility. And I'd like to briefly discuss what our analysis has revealed and the fundamental aspects of this plan. This tiered response plan is intended to operate within the existing hospital healthcare system in the state. It merely expands the hospital footprint outside of the existing hospital facilities. I'd like to recognize some of our participants that have been a part of this process. South Carolina Emergency Management Division, South Carolina Department of Health and Environmental Control, South Carolina National Guard, South Carolina Hospital Association, South Carolina Labor Licensing and Regulations, our regional healthcare providers, South Carolina Department of Transportation, South Carolina Parks, Recreation and Tourism, and the South Carolina Department of Administration. All of those, in addition to others, to include the Army Corps of Engineers, have been a part of developing this plan that we are prepared to begin implementing as of now. As we have heard from the reports from Dr. Bell and others from DHEC over the last couple of weeks, that this pandemic is an ever-moving target. When I say that, the projections and the numbers that we're looking at have changed, and we anticipate they will continue to change. But for planning our initial plan, which is again scalable and tailored to the needs that we may have, our early projections have it that we would have approximately 3,500 potential COVID patients here in South Carolina that could need hospitalization in the early part of May. Again, we will each and every day look at the projections, we will look at those numbers, and we will adjust the plan as necessary to be sure that we're capable of handling the response plan as identified that we will discuss here. Based on today's numbers, you can see the hospital bed space capacity in the state by regions in the PD, the upstate, the Midlands, and in the low country. You can see the numbers that are currently beds that are used and the current beds that have been made available. And we have noted in the past that the hospitals have reduced elective surgeries and other procedures to allow that capacity to be there, and we appreciate their efforts to do that. In addition, as we look at it, you can can see the number of intensive care capacity we have, the beds that are currently being used for ICU patients and those that are available, and the number of ventilators that are being used and those that are available. Again, these numbers will change potentially on a daily basis, and we will always monitor those to ensure that our plan accommodates those. As of today, we have 5,944 hospital beds that are available here in South Carolina. What our plan will allow us to do is to add an additional 3,000 beds to give us an approximate number of 9,000 beds no later than May 5th of this year. From that planning projection standpoint, in our first phase by April the 28th, we will add 1,500 beds in either a Tier 1 or a Tier 2 capacity. And we'll speak a little bit more into that detail as to identify what a Tier 1 and a Tier 2 facility will be comprised of. By May 5th, we will add another 1,500 beds that will give us that 3,000 bed capacity above and beyond what we currently have available. Some key takeaways from this, just want to say that this is a contingency plan. This is a plan that we will have in place, ready to go if those needs do develop. It's a plan that's built around the current hospital system that we have in the state, in the upstate, here in the Midlands, in the Low Country, in the PD, and throughout the state. It is a plan that has been vetted by the South Carolina Hospital Association and by the Office of Rural Health, where they have gone and talked to all the leadership in every hospital in the state. Those members of leadership have indicated that they understand the plan, they believe the plan is workable, and they support the plan, which I think is very important. I will now like to have Dr. Eric Osmond to come and speak to talk specifically how our tiered plan will be implemented. He is the Vice Chair of the Department of Emergency Medicine and Chief of Preparedness and Emergency Management with Prisma Health. At this time, Dr. Osmond.
Thank you, Adjutant General. So what I wanted to do is just build upon what the General has said about the tiered response plan. When we envisioned this plan, it was to really extend the capacity of our existing healthcare system. We're not making anything new or novel. These are simply extensions of the existing systems. So over the last 3 weeks, we've been working with the South Carolina Guard, with the Emergency Management Division, with the South Carolina Hospital Association, and all of our other clinical partners throughout the state to come up with a workable system that is going to give us the bed capacity that we could potentially need. So this is a 3-tiered system. And as I'm sure you're very familiar with, the Tier 3 hospitals are your traditional hospitals. They are the hospitals where we provide critical care services. They're the hospitals where we're able to provide ventilatory management to patients that are very sick. And the role of these hospitals is not going to change. These are going to be the facilities that are going to care for folks that are sick from COVID-19, but they will also continue to care for people that have all of the regular illnesses and injuries that people in South Carolina will encounter. So when we look at the additional expansion, we're really talking about Tier 1 and Tier 2 hospitals. And so the idea behind these hospitals is that we will use them to provide treatment within their scope. So we're going to be in the Tier 2 hospitals, providing care that is appropriate for those patients. It won't be as intense as we're going to provide in Tier 3, but it will be professional, high-quality care on the level that South Carolinians will expect. The Tier 1 facilities we're really using for quarantine and isolation of folks. As you know, with COVID-19, one of the most critical things is that people are isolated from others when they're ill, and that people that are high-risk contacts are quarantined and away from others when they're potentially infectious. So when we talk about these medical surge facilities, what we're really talking about is opening some of the shuttered hospitals, creating Tier 2 facilities in coliseums, in arenas, and then also creating tent hospitals if needed. So all of these are options on the table for the Tier 2 facilities. The Tier 1 facilities are really designed for people that are going to be able to provide self-care. So these are not folks that are going to require intense medical treatment. They will require self-care, and we will have a light medical footprint at the Tier 1 facilities to assist and to monitor those patients. Should they become worse, they'll be transferred as they would during any other event to a regular Tier 3 hospital for evaluation and treatment. So we believe that this tiering of our hospital resources will allow us to increase our capacity and serve our patients appropriately and safely during the COVID-19 pandemic. Thank you.
I would now like to ask Dr. Pat Cawley, he's the CEO at MUSC, and his position there is the Vice President for Health Affairs, where he will discuss some of the staffing challenges that we face as we work to build this surge plan. Dr. Cawley.
Thank you, General. Governor. This plan, on behalf of actually all South Carolina hospitals, I just want to briefly state that we feel we are ready. I want to support what Dr. Osmond said in terms of all hospitals have been surveyed in the past few days, and every single one of those hospitals is supportive of this plan. It is easy to support because this is a mere extension of what our normal emergency operations plans are. In normal emergency operations, we are ready to surge. This one may be a little deeper and a little greater of a surge than usual, but we are ready. I've seen a lot of work across South Carolina hospitals over the past 4 weeks, and I am confident that we will be ready. On behalf of MUSC, we know this is going to be tough. This is not going to be easy. We have a hospital that normally has about 800 patients in it. We are ready to surge that hospital approximately another 150 beds. To go beyond that into the second level facility, we are going to use our fitness center, which is about a block away from the hospital, to surge another 250 beds if needed. Once again, this will not be easy. This will require a different level of personnel and how they are used, but we think we are ready. We've been planning and planning hard. This is going to take our nurses, our frontline doctors, our residents, our fellows. This is going to take an entire team to take care of these patients, but I feel confident that we are ready. It'll be a tough month. The surge is likely to last a while. It won't go away right away, but I think we can pull it together, and I'm confident that based upon what I'm hearing across all other South Carolina hospitals, that those hospitals be ready to work individually as well as together. So once again, I think the message is, I think we're ready. It's not going to be easy, but I think we're ready to deal with this when it comes. Thank you.
I would like to ask Ms. Emily Farr with Labor Licensing and Regulation to come up and discuss their role in the plan.
Thank you, General. Governor. At the South Carolina Department of Labor Licensing and Regulation, we are prepared to support the hospitals in this plan through the licensing and credentialing of qualified healthcare workers to build staffing capacity when and where it may be needed. Since the beginning of South Carolina's first response to the pandemic, the agency and its licensing boards has been working tirelessly to take measured responses and adopt incremental flexibilities to ensure that South Carolina has the resources to combat the virus while still ensuring its citizens are provided with appropriate care and benefit from those flexibilities. So for example, in conjunction with DHEC, the agency waived all state licensure requirements for doctors, nurses, respiratory care practitioners, and physician assistants licensed in another state. This allows additional healthcare workers to come to South Carolina and also serves to expand the use of telemedicine to serve our citizens. We have relaxed regulations so that providers from neighboring states can continue treating South Carolina patients via telemedicine. The Board of Medical Examiners has relaxed regulations related to telehealth to expand availability of medical care. This has allowed doctors, physicians, assistants, and nurse practitioners in certain circumstances to write Schedule II and Schedule III medications via telemedicine without first getting approval from the medical board. It has allowed hospice providers to conduct telemedicine examinations in lieu of traditionally required in-person examinations of patients within 14 days of prescribing medicines for them. It has expanded the ability for the use of telemedicine to treat individuals with opioid use disorder with medication-assisted treatment. We've also expanded access to healthcare through telemedicine by expanding telehealth to other professions such as optometry, dental, speech language pathology, physical and occupational therapy, and telecounseling for counselors and therapists, to name a few. We've expedited emergency temporary in-state licensure for the Board of Nursing and the Board of Medical Examiners. The agency has also taken measures to help the licensees themselves that are out there on the front line to help us combat this virus. Many continuing education requirements required by professionals are now allowed online. We've extended any renewal or continuing education requirements for our licensees to September 30th, 2020. We've given nursing schools full discretion to allow all nursing clinical hour requirements to be done by simulation so that those students could still graduate. We have relaxed other in-person school requirements to allow students to continue the path of earning a professional license. We have also issued practice guidance to licenses from the boards that are provided through links on the website, on the agency's website, to help those practitioners practice safely. All of these measures are available on our website, llr.sc.gov. There is an alert at the top of the page that one can click on and see actions by every board and every area within the agency to help with this pandemic. That link is updated every day as new measures are taken to combat this pandemic. Thank you.
Thank you, General. Thank you, Ms. Farr. Well, as you can see, we have the whole team on the field, public and private. I want to thank these doctors and their staffs, the nurses, the physicians, all those who are on the front line. It's much like a war. They're on the front line. Law enforcement, same goes for them. They're rushing into situations that could be very dangerous to their health. But represented here today and displayed is a large part of the effort that we're making in public health. But also unrepresented today are some you've heard from before, and that's the Department of Employment and Workforce, as well as the Commerce Department, as well as the Department of Mental Health. We know that the isolation that is fostered by these orders and this pandemic are going to exacerbate existing problems and create more. Again, I repeat that we are going to have more and more people that are out of work for various reasons. But we are working around the clock to see that all the resources available to soften that blow, that economic blow, to protect those families, protect those jobs, and get the people back to work when the time comes, are being taken. We are taking measured, deliberate steps. Everything you've seen here so far has been a part of a plan that is working and is expanding, and there will be more steps taken in the future. So, are there any questions for anyone? Yes, ma'am.
Your office has said that you've questioned the constitutionality of a governor's ability to tell people to stay home. What do you think of that now? And I mean, how has your thinking on that evolved?
Well, I think the same of the constitutionality of such orders that restrict the liberty and rights of people that are protected by the United States Constitution. They are there for a reason, and they are there for situations such as this, so that we don't forget. You know, of course, personally, I've been a lawyer practicing attorney for 45 years. Several years as U.S. Attorney and several years as Attorney General. But what you can do under the law, what the government can do is, and we're doing that in this situation. We want to be sure that what we're doing is within the framework of the Constitution and the law. And that is to protect the people, having full regard for due process, their rights of assembly, their right to travel, but to stay within the parameters and the guardrails that are set up by the Constitution. We have a South Carolina Constitution as well. There's a right to privacy. So what we're doing is limiting the impact of what we're doing as much as we can in order to protect the health of the people that we know is protecting their health without going beyond that and destroying more that we are protecting while still sticking with the mandates of the Constitution. So the evidence and the facts that have been referred to today, that is the rising non-compliance, the rising infection rate, such things as the CDC now in the last few days recommending face masks, such things as about a week or so ago the CDC declaring certain states travel advisories in certain domestic travel advisories in certain states. All of those things are leading to a point to where it is within the Constitution to use limited need, don't go any farther than necessary to protect the liberty of the people without depriving them of their rights, and that's what we've done today. I'm confident that what we're doing today is legal Constitution and is similarly protecting the people without destroying families. Yes, ma'am.
Why not just call it a stay-at-home order? You call it
Well, it is. We've been urging people to stay at home from the very beginning. We've been urging, we've had it on 77 signs that we have on the highways. I think we've said that in this is a stay-at-home order. You call it what you like, but it says stay at home. Work and home. Home and work. Those are the places, those are the best places to be. There's certain other exceptions that are good for the health of the people, but will not endanger their health. Those are the things that we've been espousing and promoting from the very beginning. Yes, ma'am.
Governor, you encourage churches to do their services online. Well, a church in Charleston held a service yesterday of more than 100 people who were not social distancing. The pastor said it's his constitutional right to keep it open until the governor says otherwise. Are you going to ask to stop the service? Why or why not? And does this constitute a danger to the public safety?
I can't speak for other governors, but this governor is not going to intrude on the First Amendment. That is an absolute right. We are encouraging pastors and others in any house of worship, any congregation of any kind, to use social distancing. That is, go online. Peggy and I go online with First Presbyterian Church in Columbia. It's a little different because you don't have the whole choir singing, and there aren't but 3 or 4 people in the church. It's a big church, but it works. It's good. But do it that way, or have the service outside with social distancing, or if you must have a congregation under a roof, then use that social distancing. But that First Amendment right is very important, just like the others, and we're respecting that.
Governor, how are you all expecting to enforce this new mandate for folks to stay work home?
It is a crime to violate it. It is a misdemeanor, punishable. It is a crime, punishable by 30 days in jail, up to $100 for every day of violation. Law enforcement, any law enforcement officer can enforce it, just as any law enforcement officer can enforce the 3 or more rule. That is, if there are 3 or more people that are congregating that are in one way or another are violating endangering public health or the public order, they can be arrested and go to jail and pay a fine every time they do it. Same thing on the water. We had, just in the last weekend, we had the Department of Natural Resources was out in force on our waterways, which I mentioned earlier. They busted up over, I think, 2,500 boats that were out on the water and gave a number of citations as well. Ladies and gentlemen, we got to follow the rules. We know what the rules are. They're clear. The orders we've issued are clear. What you've heard from these people today is clear. We have to do it. If people do not comply, then we'll take the next step, and we'll take the next step after that, if necessary, to protect the people. That's what we'll do. We're not going to violate the constitutional rights, but we are certainly going to protect the people with the limits of the power and resources that we have.
Governor,
yes.
What level do you want to see motor traffic actually be in the state? What percentage of the normal amount?
You can get the percentages of what's happened in the last weekend from the Department of Transportation. That was part of our consideration for today, where in some places, some highways, not interstate highways, but measuring the other highways, traffic actually went up over what's usual, or went up 25% in some places. Well, that tells us that there's a level of non-compliance. People must be, they're traveling, they're moving around. Those kind of things added to this increased, increasing incidence of the reports, and those are just the ones that we know about. That doesn't count those cases out there that we don't know about. All those things added together say that we have to do something. Precise percentage, there is no precise percentage, but we want to see it go down. We don't want to see it go up. We want to see the people that are reducing their interaction with others and the chance for contact and spread of disease to go down. And that's what must happen if we're going to stop this fire. It's easy to do. All you have to do is follow the rules that we've laid out, follow the rules that we've discussed every time that we've been here, including stay at home as advice and now stay at home as a mandate punishable by law under the rules that we're announcing today. If everyone will do that, will be serious about this and do that, then the rate of infection will be reduced. Perhaps we won't get to the worst case scenarios that we're talking about and prepared for. By the way, we've been preparing for this for weeks. This is a part of our plan. Maybe we won't get there. We hope we won't get there. But if people don't take it seriously, we will get there. Yes, sir, in the back.
Arenas were mentioned as possible surge hospitals.
I'm sorry, say what?
Arenas have been mentioned as possible surge hospitals. Have arenas like Colonial Life Arena been contacted?
Everyone has been considered. We've had people volunteer. I think the plan that has been announced, I don't know if that includes any arenas at this point.
We are certainly looking at those. We've assessed to date 18 facilities around the state, and these facilities that have either been the owners or those that operate facilities either come forth and says these facilities would be available, or the facilities that the state has some type of operational control over. We look at each facility and we have to vet it against certain criteria. We're utilizing the Army Corps of Engineers, and they're doing this throughout the country now, but we're utilizing some guidelines that they have in place. We're using engineers from the Department of Transportation, from the National Guard, and from the State Guard. The facilities generally have to be ADA compliant. They have to have an adequate restrooms and shower facilities. However, we can contract and put those in place if that's necessary. They must have appropriate fire suppression systems. They must be free from lead and asbestos contamination, and generally all hotels that we are looking at that are built after 1990 meet that criteria. And they have to have emergency backup power. And we can also contract or have that type of resource made available. But we're working throughout the state. We're looking to have in each of those areas that identified earlier at a minimum one Tier 1 and one Tier 2 facility, but we will certainly expand those as needed to accommodate what we believe may be spikes and surges, but we will look to see where we need those facilities built. We also have at our disposal basically hospital tents that are available to us. The state is contracting for one 100 hospital bed tent, and through DHEC they have other hospital tents that can help expand that capacity. That's a fairly quick turnaround that we can identify an area that may need some immediate assistance, and we could have that up and operational fairly quick. Any fixed facilities, we'll be working through the Corps of Engineers to determine what those needs are, and those will take the greatest lead time, so we'll be moving quickly to determine where those will be and get started on those facilities.
Who's going to staff these hospitals?
Did that answer your question?
Do you know Colonial Life Arena is one of those that have volunteered?
I don't know specifically of Colonial Life, but we have had a number of facilities throughout the state that have offered up, and we will be conducting assessments throughout the state over the next few days to determine what our needs are and capabilities are based upon the plan.
Any more questions?
Yes, as a follow-up to the shuttered hospitals that you might reopen, which hospitals are we talking about, and will those be solely for the Tier 1 self-care, or how will they be used?
We have 4 facilities that were recently shut. When I say recently, over the last few years, 2 of those facilities are not going to be available to us due to either having been repurposed or we found unacceptable levels of mold in one. The other 2 will be continued to be looked at, and no final decision at this point has been made on whether we will use that as part of this plan. Excuse me?
Which 2?
I think it's the Fairfield and the Marlboro that are still potentially on the table.
Any more questions in the general?
Yeah, who's going to staff these hospitals when they open up?
The staffing as identified by Dr. Cawley, all of this will be done within the framework of the current hospital system. any support type needs that may be necessary to build up these external facilities. Assets such as the National Guard could be available to help with that. We can contract some of those facilities or some of those capabilities as needed, but we will work within the framework primarily of the existing hospital systems for the actual care itself. The other support systems that are necessary to run a facility may be brought on by other capacities, the Guard or contractor.
Is it 3,500, that's a worst case scenario for the state?
That is a mid-range projection, and we will continue to look at projections each and every day as we look at that. And our system is scalable, and if you look at that number, based on the current availability of hospital beds, we are confident that we can meet that, but we want to have that contingency available in case those numbers do exceed what we are currently planning and working against.
You mentioned the 9,000 beds by May 5th, so is that that is when the 3-tier program will go into effect?
Well, we are actually have started that now. When Dr. Cawley mentioned what they have done at MUSC, that process has already started. And all of the facilities around the state have been actively working to enhance their capability to expand within their current footprint. And I talked with Mr. Thornton Kirby with the Hospital Association and with Dr. Adams. Just want to point out this is not an unusual operation that our hospitals do. In the past 5 years with the hurricanes that we've had, this type of plan has been used before. What we're doing different here now is just using some additional facilities to help expand on that footprint. For planning purposes, we'd like to have these tiered facilities within a reasonable geographic space of the primary hospital. And for planning purpose, we've used 5 miles, but that number was just arbitrary to get us started. But certainly as the needs may exist and what the hospital is better capable of supporting, we will adjust our plan to suit those needs.
Any more questions for the General?
The 35.
Hold it right here.
Go ahead, Sean.
Well, it's actually sort of a joint question. We're talking about needing a lot more medical staff, and we're gearing up, and yet we're being told that hospitals are laying nurses and other people off. So how are we going to staff these geared up facilities?
Well, I can speak on behalf of MUSC only at this point. It is true that this event, this COVID-19, is affecting the entire economy, and it's affecting hospitals and health systems in 2 ways. That in one way, we're being dealt with significant financial challenges, and another way, we're having to deal with the large surge of patients coming. At MUSC, we're going through this adjustment right now. It is not, what we're doing, the adjustment we're going through, will not affect frontline nurses, frontline doctors. What we're doing to make that adjustment is particularly support staff that at this point in time we feel don't need to be part of that surge. And so those are the staff predominantly affected. So once again, I'll just re-emphasize, this is not affecting frontline nurses, nursing techs, respiratory therapists, or anybody that provides direct patient care, including our doctors as well.
So those staff members would not be laid off or furloughed?
That is correct. But those staff members have already been affected by this, right? And they've been affected by this because of the great decrease in hospitalizations, surgeries, ambulatory visits. They typically flex to volume, and they have been affected in that the number of shifts they may be covering in the last 3 weeks has greatly decreased. Now, that may be okay because in the next 4 to 6 weeks, they're probably going to greatly increase. So there's been this period of time where the number of shifts that they typically work is down, but it'll go much higher in the next 4 to 6 weeks.
Is it possible then they could be hired back after a very temporary layoff?
Well, I'm going to reemphasize, we are not laying off, not at MUSC, we are not laying off frontline workers. We're not laying off frontline nurses, nursing techs, respiratory therapists, doctors, anyone that works on the front line taking care of patients, we are not laying off.
Can you give us some examples of who is being laid off then, for the lay folks who don't understand what's considered frontline?
Well, there are often people in the background that work maybe quality work or some registries in the background, billing folks, things like that. Things that are often in the background that during something like this where we have to prioritize patient care, in an environment in which we must be fiscally responsible, we have to prioritize frontline workers.
Any more questions for Dr. Coley at the moment?
Dr. Osmond of Prisma Health.
Doctor?
Where does Prisma Health stand on the COVID testing backlog, or is that caught up?
Our testing is very caught up as of today. We're working closely with DHEC, our internal labs, and then also with some of the private labs. So we feel pretty confident today that we're caught up on the vast majority of that testing.
Are there any more questions?
Yeah. So for
Yes,
him.
in the back.
Yeah, Governor, the South Carolina got pretty much everything it asked for out of the federal stockpile. Is it good to have a friend in a high place? I mean, why do you think South Carolina, while some other states didn't get as much, why do you think South Carolina kind of got everything it asked for?
Well, we've been asking for everything that's available. Of course, it is all, the way it is sent out is by population generally and also including need. There are factors. But the administration, the Trump administration, is working overtime to get factories and producers to come online and switch from one thing to another. And we have a lot of them right here in South Carolina that'll be announced if they haven't already been announced, the people that are coming over and making masks and face shields and tests and all sorts of things. It's an across the board effort, but we talk with the federal officials every day. Someone in our group is on the phone probably at every minute during the day talking to the federal officials, being sure they know what our needs are and that they are sending us everything that is within their power. But a lot of the things that we need, we must get from the private market. And therefore, we just like everybody else, just like the hospitals. We don't just get it from the federal government. So I assure you that our team is working around the clock to see that whatever we need, we get. You remember a year or so ago, the DHEC lab ran out just about of the reagent that's used for the test. Well, we ended up, we got busy and made that need known, and overnight we got the reagent that we needed. So our team is alert in everything that is available out there, whether it's medical supplies, personal protection equipment, unemployment benefits, loans for small businesses, loans for sole proprietors, loans for 1099 or unemployment for those people, 1099 small businesses and others that are usually not a part of the unemployment scheme. They are now. And we are working to be sure that the administration, those in charge of those federal agencies and regulations know what we need here. And we are working vigilantly with our congressional delegation, Senator Graham, Senator Scott, all the others to see that anything that is available, we will get.
Dr. Osmond.
Yes, right here.
You made an order to close non-essential businesses, but gun stores have stayed open.
I'm sorry, say what?
You've made an order to close non-essential businesses, but gun stores have stayed open. Why are they considered essential?
Because there's a constitutional right to have and bear arms. That's the Second Amendment.
Another
Yes,
staffing question. Are we losing a lot of nurses, the frontline people, to New York and other places that might be paying more right now? And if so, are we tracking that?
We're not, as has been explained, we're not losing, but I'll let these gentlemen answer that question.
We've seen some nurses and doctors go. I think they're wanting to go to a place where at the moment they're needed. So we've seen some low level, but I wouldn't say large numbers at this point.
Dr. Osmond, can you comment on what types of staffers at Prisma have been furloughed? Are they nurses?
No, I mean, we're really in the same position as MUSC. None of our frontline doctors, nurses, technicians, people that are going to be providing care. I mean, this is a challenging time for healthcare, but we're taking the exact same approach that MUSC is.
Is it impacting your readiness, having those people laid off?
I don't believe it's affecting our readiness. I mean, our frontline staff remains intact, committed on the job, and it is not impacting the readiness at all.
Do you have any layoffs or any other furloughs planned?
Sort of out of my lane.
Governor McMaster, when will benefits from the CARES Act be available to folks?
Which one is the CARES Act?
That's the one where they file for unemployment and they are able to get those benefits.
That's the $600. There's the $600, regardless, you have the Coronavirus Assistance Act, and then you have the various acts. But the $600 per person for unemployment insurance was not available until, I think it's just started now, because of requirements that had not been met in Washington for the dispersion of those funds. But that's being met now, and those checks, that money will be added to everyone's unemployment check who files for unemployment under the state unemployment system. Now, for others, the $1,200 per person, that is automatic under from the Treasury Department, but you have to be known as a taxpayer. If you're not a taxpayer, then you can file as a taxpayer. You need to hurry up and do it if you haven't filed this year, because the extension's this year. But if you haven't filed yet this year, then what they will use is what was on the books last year. And that, if you have a deposit account, then it'll go directly into your bank account. If you don't have one, you're going to have to they'll have to send you a check. That's going to take a little. All of those things are being handled. There were some restrictions and rules that had not yet been thought out and finalized in the government, the federal government, but they are now, if they haven't been, they are being or will be very soon. So those checks should start flowing immediately. We were working with Director Elsie, Department of Employment Workforce, Department of Commerce. We were preparing to see what we could do ourselves in order to try to help fill that gap. But now the checks, the money, the support should be coming. And I say again, there's ample avenues open. I urge everyone who's interested to go to those websites, the Department of Commerce, Department of Employment and Workforce, and look at those. And there's also loans coming through the private banks as well for small businesses. Yes, ma'am. Ma'am?
MUSC question. Are you still doing non-necessary surgeries to keep the cash flow coming in, like gastric bypass, or other things that could be postponed?
We've postponed anything that can be postponed. We're only doing, at this point in time, emergent surgeries. That means emergencies. And we're doing only surgeries that we call urgent, less than a week. Meaning if it's not an emergency, but it should get done in the next week, we are doing it. What we're also finding, though, over the last, because this has been going on 3 weeks, we have a third category called urgent less than a month. We are starting to get into that group. We're trying to push that off, but unfortunately this has gone on long enough that we're starting to see those. Anything over 4 weeks that is elective, we are not doing.
I have a question for Dr. Bell. Dr. Bell, what can we expect in the coming weeks? I know the Surgeon General has put kind of a grim outlook for the next 2-3 weeks for our nation. What specifically can we look for in South Carolina? What are the projections there?
Well, we have projections, but it's very, very difficult to really answer specifically what to expect. Our projections have already been commented on that are based on a variety of models. We're looking at everything from projecting out case reports based on who's been tested. We are looking at projections based on what other countries have experienced in a recovery phase. And so our preliminary projections based on one particular model suggest that we may see a peak in deaths in the first part of May. And from that information, it gives us the ability to estimate hospitalization use, intensive care unit use, and ventilatory use during that period. So what that actual number is hard to define because it's based on a range where there's a worst case scenario and a best case scenario. And as General McCarty has already commented, a range approximately in the middle of that has been selected for this hospital planning.
Dr. Bell, what's the status of the database for law? What's the status of the database for law enforcement in terms of where COVID-19 cases are?
Director
You're correct. We are working closely with our local partners, law enforcement, emergency management partners, I'll say. We started during this last weekend process through which we can enroll them electronically, And depending upon the type of system, there is not one 911 system around the state. There's many different types of 911 systems, and so some will have access through a query method, internet-based query method, where at a 911 station, if they are responding to an address, they can enter it and they can be told, yes, that's a recent COVID, a residence where there was a recent COVID positive individual, or no, there was not at that same address. There's also a model that we're pursuing. We have several counties that we're trying to work to pilot this with. And so in addition to the 911 center model, there's also a model where the responding unit could do the same thing and provide a query. And then there's also where the larger counties, the counties with more 911 capabilities, would be able to have a system that would more directly integrate with their CAD-based 911 system. So we have several models that we're working simultaneously. Throughout this week, we'll be piloting with several counties, and as the week comes to a close, we should be in end of the week and into the weekend beginning to share with all counties that data electronically, but also I must urge in a very secure way, so that we're not just handing anybody a list per se. It would be through a query-based system for those that have a need to know.
One more simple question for you. Have you been tested for the virus yet?
No, sir. I have not exhibited any of the symptoms. I'm following the protocol. I want to thank all of you for coming. Particularly today was focused mainly on our medical and health response. We appreciate the work, and please tell the doctors and the nurses and all the rest how much we appreciate what they're doing. Also, I want to remind you that law enforcement and the first responders are really in a situation where they have to rush into danger, not knowing what they're going to find. We're trying to solve that problem, as Mr. Davidson just mentioned. But for the ladies and gentlemen and the citizens, the mamas and daddies and children, we're doing all we can, and we're thinking every day of the people of the state. I want to remind people that it is the elderly that the facts, the science, and the data show are more susceptible to this. Those older people, particularly those with underlying conditions, the highest percentages of those up in the 90% range, those are the ones that are succumbing to this illness. So I'd like to urge everyone to be careful about your mama, your daddy, your older people. Be careful about them, and remember that the social isolation involved in this, as it increases as we go along, the social isolation has an impact on people. And that's why our mental health community is standing up. I assure you finally that every resource we have in South Carolina is thinking about nothing but the health and safety and the future of the people of South Carolina. And we thank all of you for being here again today.
Breaking news right now, Connecticut Governor Ned Lamont is in Connecticut right now giving an update on the coronavirus outbreak. Let's take a listen in.
That those individuals were negative. Again, at this time, I must caution all of you that, as you're probably aware, that this situation is extremely fluid and dynamic. It could change at any moment. As your commissioner, it's important for me to say a couple of things in terms of precautions. I want to say that basically the risk is low for U.S. citizens as well as Connecticut residents. With that said, it is important for you to wash your hands, for you to cover your mouth when you sneeze or cough. We are also asking that you no longer shake hands as a precaution, that you do an elbow bump. We also ask that you stop, if you can, to stop touching your eyes, your nose, and your mouth. And we ask that there be some social distancing when you have experiences with individuals with symptoms. With that said, as your commissioner, I spent last week in Washington meeting with 7 congressional leaders from Connecticut. And it was important for me as the commissioner to communicate on behalf of Connecticut, the state health department, as well as our local health department people, the boots on the ground. The communication was very clear that we need to stay ahead of this as much as we can. We need to stay prepared. But in order to do that, we need resources, specifically funding. Our 7 congressional leaders, and one of them is here today, Congressional Leader Blumenthal, it was very important for all of them to hear what was being said. We need the funding to continue to be prepared. But I need to completely say this. Preparedness does not mean that we will stop the virus. It means that we will be prepared. I want to say that the Department of Public Health staff, who have been phenomenal, as of December with our first case, has been on board in communicating with the appropriate state agencies and local leaders, as well as other agencies, as we continue to now beef that up in preparation. So here today, I will tell you that I have the wonderful opportunity to introduce and welcome the United States Surgeon General Jerome Adams. I have to have a little say, though. We invited him in December to talk about overall public health issues. Who knew, with serendipity, that this would have been the perfect storm for him to arrive here in Connecticut and have the opportunity to share with us what is going on nationally with COVID-19. So without further ado, I'd like to introduce our U.S. Surgeon General, Jerome Adams.
Well, it is great to be here in the state of Connecticut. It's great to be here with you, Governor, with you, Senator, and with your wonderful state health director. Again, we came here originally under different circumstances. I just was at UConn this morning talking about the opioid epidemic and the 1,200 lives that were lost in Connecticut due to overdose last year. We're going to have a conversation with the governor over the next couple of days about maternal health and the fact that far too many moms, especially brown and black moms, are dying during the pregnancy time frame, and that for every life lost, we know that there are 70 additional moms who have preventable complications due to things like hypertension, due to opioids, due to other issues that affect maternal health. But the topic everyone wants to talk about today, and appropriately so, is the novel coronavirus. I want to start off that conversation by saying my heart goes out to the families of the individuals, the 2 individuals thus far who have lost their lives to coronavirus. We've seen an increase in cases in the United States over the weekend. I want folks to understand that we knew this was coming. We told folks that this was going to happen, and it is why we've been preaching preparedness from the very start. I want folks to know that we've been here before. The coronavirus is new, but we've dealt with SARS, we've dealt with MERS, we've dealt with H1N1, and we literally all have a playbook that we are following to respond to the novel coronavirus. As the State Director mentioned earlier, the risk to individuals from novel coronavirus right now is low. Why is that? Well, we know that risk is correlated directly with exposure. You can't get the coronavirus if someone around you does not have it. And due to the administration's aggressive containment strategies, we've done a good job of limiting coronavirus entry into the United States. And there's no doubt that has been successful. That said, containment works when you have a limited source. And our containment strategies were focused on limiting travel back and forth to the most affected regions in China. We now have over 40 countries around the world who have reported coronavirus cases, and we cannot hermetically seal the United States. So in addition to trying to contain virus entry into the United States from places that are most affected, we're encouraging communities to think about the steps they can take to limit spread within communities and to mitigate the effects of the virus. Important for folks to know that we will see more cases, and in most cases there will be mild illnesses. Of the 14 original patients in the United States who were tested positive for coronavirus, all 14 of them have recovered or are recovering. If you are healthy, then in most cases you'll have a mild illness that will be like a bad cold or a flu. You'll feel bad for a few days, but you will recover. But just as with the flu, again, we've seen this, we've been there before. If you are someone who is unhealthy, who has cardiovascular disease or lung disease or other comorbidities, you will be at higher risk if you get the coronavirus. So we want those folks in particular to be thinking about travel, to be thinking about how they can protect themselves and take extra precautions, not just to protect themselves from coronavirus, but to protect themselves from flu. Important to note that 18,000 people in this country have died from the flu this year. 18,000. I believe the number is over 60 in the state of Connecticut now reported who have died from the flu. You don't have a single positive coronavirus case. Part of my job as Surgeon General is to help people keep things in perspective. And in terms of keeping things in perspective, we want folks to know that your risk as an individual remains low, but that doesn't mean that we as your health officials and state officials aren't doing everything possible to prepare for what we know will be increased cases of coronavirus. I want to finish by talking about the things that individuals and communities can and should be doing. On an individual level, we know that basic public health precautions like washing your hands for 15 to 20 seconds. And the senator and the governor and I literally just washed our hands before we came in this room and sang happy birthday as we were washing our hands, because that's what we tell people to do to ensure that you've properly washed your hands to protect yourself. Things like social distancing. And social distancing includes not going around people who are sick. It also includes making sure you do common sense things like not shaking hands in the midst of a particularly bad flu season. And that's why we elbow bump now instead of shaking hands. Other things that folks can do to protect themselves include getting a flu shot. How does that help? Well, again, you are at this point in time more likely to be exposed to the flu in Connecticut than you are the coronavirus. Number two, as we visited hospitals, and I was at UConn health systems earlier today, we know that hospitals are overflowing with flu patients. Every flu patient who takes up a bed in a hospital is a bed that's not available for a potential coronavirus case. So getting your flu shot protects you from the flu in a bad season. It also helps us prepare for coronavirus. We also want people to clean their surfaces, and we just talked about that also. It's really simple. Wash your hands, cover your cough, clean your surfaces, stay away. And we can turn it into a little TikTok dance if we need to, people. But we want folks to understand that there are steps that everyone can take to respond to the coronavirus outbreak and the flu outbreak that we have going on right now. On a community level, we want state and local officials to be thinking about and dusting off their preparedness plans, to be thinking about if this does worsen, then what should we do in terms of closures, in terms of telework, in terms of canceling large gatherings. We're not there yet. We're not there yet, but we want folks to be thinking about that so that we're prepared in the event that it does happen. Most of all, I want the people of Connecticut to know that you have the best team that you could ever imagine, not just here in the state of Connecticut, but on a national level. If you were to put together an all-star team of individuals to respond to coronavirus, you would pick Tony Fauci. You would pick Ann Schuchat. You would pick Dr. Robert Redfield. You would pick Alex Azar, who literally wrote the pandemic flu response booklet back when he was in HHS previously. So at a federal level and at a state level, we have an all-star team. We are prepared. We do expect that we'll see more cases of community spread, but folks should not panic. Caution is appropriate. Preparedness is appropriate. Panic is not. And many of you may have seen my tweet from this weekend where I advised folks to stop buying masks. While there are things that you can do to protect yourselves, there are things that actually can harm you and your community. And going out and hoarding masks is one of those things. We know that when individuals who are not healthcare workers and who haven't been advised by a healthcare worker to wear a mask wear them, they often wear them improperly, meaning that they provide very little protection against respiratory disease. One of the other things we know is that folks who aren't comfortable wearing a mask will often touch their face more frequently and adjust the mask, and can actually increase their risk of exposure to flu or coronavirus. So you may actually be harming yourself and putting yourself at increased risk by wearing a mask. And then finally, if we actually utilize masks inappropriately in the community and in the general public, they won't be available for healthcare workers who actually need them to respond. Again, caution, preparedness, but not panic. That's how we're going to successfully navigate this coronavirus situation, just as we successfully navigated H1N1 and MERS and SARS. We're here to make sure we continue to provide radical transparency to all of you. As the Secretary said yesterday, we're going to treat America like adults. We're going to give them the information on what we know and on what we don't know, and then we're going to trust Americans to make the appropriate decisions to protect our health. And the most appropriate thing to do is to prepare but not panic. Governor?
Maybe Senator first. Okay, thank you. First of all, thank you, Surgeon General, Vice Admiral, and Dr. Adams.
Thank you.
Thank you for being here today and for sharing some of that wisdom with us. And I want to thank, in particular, Commissioner Coleman Mitchell for her leadership. She and I have worked together on urging more people to get flu shots, and she's been a leader on opioids and a great many public health issues. And we're very fortunate in Connecticut to have her as the point person on this team. And the federal government could do very well to follow Connecticut's example and put professionals in charge of this effort at the federal level. Not politicians, but professionals who respect science and will implement it and put science above politics. And thank you to the governor for his awareness and his leadership on this issue as well. I want to just take issue a little bit with the commissioner. We are not yet in a perfect storm, and the point of our efforts today is that we can avoid it. Preparedness stops panic. Prevention stops fear. Facts defeat fear. And so, calling it what it is, rather than embellishing or trying to apply political rhetoric to it, is absolutely essential for the American people to have facts and that radical transparency that's so important. But as important as the words are the dollars. And that's part of the reason I'm here. I want to commit to the governor and to our commissioner and to all the people of Connecticut that we are going to fight for the money that is necessary to be effective and stop this disease from becoming the pandemic that is threatened. We have Connecticut's back, not just me, but our entire delegation, united on this issue, that we are going to work and fight for a supplemental appropriation. This week and next, we hope to get it done in the next 10 days. Not the $2.5 billion that the administration has proposed, but multiples of it, at least $8.5 billion. And at least $2 billion of that money will go to reimburse local and state governments, exactly like Connecticut, that are proactive in the way that Connecticut is doing to help stop this virus from spreading. $2 billion to local and state reimbursement, another $3 billion to the Public Health Emergency Fund, which provides similar kinds of money, among others, to Medicaid expenditures that are necessary, $1 billion to develop a vaccine. We're still at least a year to 18 months away from a vaccine, but also money for global health efforts. And we need to be mindful that the major threat of spread comes from abroad. If we can stop it there, we can stop it from coming here. So this package, $8.5 billion, perhaps as high as $15 billion, we will push through Congress. And I say it with some optimism because it is bipartisan. And that's the point that I want to stress today. Congress is addressing this issue in a very bipartisan way. Take one example, my colleague who is the chairman of the Senate Appropriations Committee, Richard Shelby of Alabama, has shown that he is willing to act aggressively on this issue, and I've talked to him. We are working together to put together a coalition that will support vaccine development, state and local reimbursement, other kinds of public health steps that are necessary. Connecticut, we have your back, just as we do the backs of every other state, and we should, because this issue is a national threat. Let me just finish by going to where I began, our state public health network here in Connecticut. Over the last 3-4 days, I've been meeting with local health directors, state officials, hospital doctors, staff, volunteers, and I've been so impressed by their vigilance and vigor. And I think more of the testing, we're here at the state lab, they've recently been given authorization to do that testing, more of it can be done at the local level. And that's key to expanding the testing. If I were asked as a layman, I'm not a doc, I'm not a scientist, what is the priority step? Testing. You cannot solve what you don't know. And if you don't do the testing, you don't know where the virus is spreading. And it can be stopped if the spread is stopped. And I will just finish on this note. Longer term, the public health of our nation demands more resources to CDC and NIH, not the cuts that have been threatened by this administration. They demand more funds for a global health strategy. They demand more staff at the National Security Council, not the dismantling that we have seen over the last years. We need to invest in public health. We know these threatened epidemics occur, whether it's swine flu, H1N1, MERS, SARS. We are playing with fire if we fail to be prepared. And preparedness does defeat panic, but it also achieves health, and that's really what our goal has to be here. We need to invest in the CDC, the NIH, other public health measures, and in the public health networks of our states and localities. That's what makes us strong. That's what makes us strong as a nation, that we are prepared. We cannot shut down whole cities. We cannot tell people not to travel. We can be smart, strategic, swift in our response. And thanks to Connecticut, people here are a lot better off.
Thank you, Senator. Let me just add that as your governor, my job is to hope for the best, but plan for the worst. And that's what we're doing. We're doing this at the federal, the state, and the local level. You heard Senator Blumenthal talk about the resources we need in terms of providing a lot of the backup we need going forward, in terms of perhaps some overtime for folks as if this gets more aggressive. I really appreciate Dr. Adams here being here. What this says in terms of, it's so important we have a unified message as we go out and talk to people who see pictures on TV and they get scared every day. And I think you give us a great deal of confidence about some of the little things we can do going forward. The development of the vaccine as we need it, that could be a year away. You're emphasizing getting the flu shots and how that could be a preventative. You know, Dr. Adams mentioned to me that if he had to make an estimate about what this might look like, and we don't know because it's changing so fast every day, he said probably like a really bad flu season. So take your flu shots. That means less likely you're going to be in the hospital emergency room, more room for us to be able to pay attention to the coronavirus. And Michelle and the Commissioner, I just want to say thank you. I know you've been down in Washington, D.C., working hand in glove with CDC. And at the same time, we're working every day with our hospitals, making sure that they are ready. Working with our business community, just in case they have to think about what could happen next. Miguel Cardona, our Commissioner of Education, reaching out to each and every one of our schools and school districts, just in case. We saw what happened in Rhode Island. They've had an incident there where they temporarily had to close a school. I don't see any of that happen in Connecticut, but we are surrounded by states that have had 1 or 2 incidents, none yet in the state of Connecticut, but that's why we're ready. And I want to say I'm going on the phone with Vice President Pence in just a few minutes. And I appreciate the federal government. Get the experts up front, just like you, Dr. Adams. You talk about the all-star team. I put you right on that all-star team. Give us the information we need. Go to ct.gov. There's Dr. Google out there. He's pretty good, as you mentioned to me, but I would go to ct.gov. That's where you get the information. And as something like this is changing so fast, we'll give you the best information we can. But right now, I feel like the state of Connecticut is in pretty good shape. We're prepared for the worst, hoping for the best. We're here at the lab. I appreciate everything you've done, Doctor. You've showed us that we've done a couple of tests here already. We can get a test done in 3, 4, 5 hours, give people confidence that they don't have this virus. And we can prepare that even more. And as Dick said, if we need to, we'll be able to do the testing at the local hospital level as well. But right now, I think we're prepared, we're ready, and I just hope you take all the necessary precautions. Don't shake a politician's hand in the next couple of weeks. Probably a good thing to stay away. Thanks, everybody.
I just want to highlight something that the governor said. Resources for people out there. ct.gov for state-level information, cdc.gov for national information, including advice on where to travel to and where not to travel to. That's how you can keep yourselves safe, by being informed, by preparing, as the senator said, by not panicking.
Governor, right here in Connecticut, the UConn students, some of them are coming back from their overseas trips, and some of them have not been quarantined. What is your position on that? What should be done of the students who are coming back from UConn and other colleges?
Why don't you take that?
Well, it's interesting. Folks need to understand, first of all, the difference between isolation and quarantine. We isolate sick patients who've already been diagnosed. Quarantine, in this coronavirus situation, it's the first time in a long time we've invoked federal quarantine. And we did that for folks coming back from Hubei province, from China, because we knew that there was a high likelihood that they would be exposed to coronavirus due to the number of cases that have come out of there. And now over 80,000 cases out of China, still a high impact and a high risk area. As far as people coming back from other parts of the country and other parts of the world, we want to make sure we're looking at those highest risk areas. Right now we know Iran is a high risk area. We know that Korea is a high-risk area. We know that northern Italy is a high-risk area. But important for folks to know that we tend to leave quarantine decisions up to the state and local levels. And I encourage the states, as I've encouraged your health officials, to talk with CDC and to make sure they're making the best and most appropriate, most scientifically grounded decisions for folks. And it's going to look different for every state, every situation. Who are you? Where did you come from? And what part of the world did you come from? Is it at high risk for coronavirus? And ultimately, that's how we're going to come up with decisions that keep the most people safe. Well, I'll take that just and say that that's why we're here at the state lab today. We all took a tour of the state lab here. I'm confident that Connecticut is ready to test. Are you all confident? I'm confident in what Connecticut is doing. I can tell you that I spent pretty much my entire day Saturday at the White House. The president, the vice president, and Secretary Azar have as their top priority making sure we're getting test kits out to people and that we have more places available to test. It is the #1 item on our agenda as far as the task force meeting. And so I'm actually encouraged by the fact that more states are telling us they feel comfortable and they're ready to test. The important thing to know is as we test more, we are in fact likely to get more positives. The public should know we are going to see more cases, but that does not mean that it is a time to panic. Most of those cases are going to be mild, and when we find out about them, as the senator said, we can more easily protect our communities.
Let me just add, I think that was exactly the right answer. The Atlanta lab did have a contamination problem, and there was some question about the tests, in effect, being overly expansive, looking for other strains of viruses to be inclusive. The test that is in common use now seems to be reliable, but your question is a good one. We need to be vigilant. We need to test the tests, and there's always the possibility of developing a better test. But right now, Connecticut is using a reliable test. The samples brought here are analyzed reliably and accurately, and I think we can have a high degree of confidence. We never want to be overconfident or complacent, but there's no better place in the world to do testing than right here in the Connecticut lab.
And we have been watching Connecticut Governor Ned Lamont alongside health officials giving an update on his state's response to the coronavirus outbreak. Now, this, as the first case was confirmed in New York City, we have now learned that woman is a 39-year-old healthcare worker who is being quarantined in her Manhattan home. Now, so far, there have been no confirmed cases in Connecticut, but the state has been preparing. Connecticut received federal approval to administer a test for the virus, eliminating the need to send samples out of state. Now, that means patients would know if they have the virus much sooner, within 1 to 2 days. Health officials as well urging residents to stop buying and hoarding masks, but instead they say to wash their hands, and for now to stop shaking hands and limit contact with anyone who may have flu symptoms.
Attorney General, it's great seeing you. Thanks for being with us.
Thanks for having me, Laura.
Right now we have no freedom of worship, public worship to go to gather. We have no real freedom of assembly, not even freedom of movement, given what some of the states are doing. What can you tell our viewers tonight about what the Justice Department will do after this limited period to ensure that our civil liberties are balanced properly against the need to protect the public?
Well, generally speaking, there are occasions where liberties have to be restricted during certain emergencies, such as war, or in this case, a potentially devastating pandemic. But they have to be balanced. Whatever steps you take have to be balanced against the civil liberties of the American people, and it cannot be used as an excuse for broad deprivations of liberty. As things proceed, we're going to be interested in both what the federal government is imposing and also making sure that that's justified, but also what the states do. The states have very broad, as you know, what we call police powers. They have very broad powers that the federal government doesn't have to regulate the lives of their citizens, as long as they don't violate the Constitution. So we'll be keeping a careful eye on that.
Governor Cuomo spoke out this week very forcefully, this Holy Week for Christians, obviously Passover as well for Jewish Americans, about the importance of not gathering together to celebrate. And I want you to listen.
Now is not the time for large religious gatherings. I mean, we've paid this price already. We've learned this lesson. You do no one a service by making this worse and infecting more people.
At what point in time do Americans feel like they're going to be able to have that right back, and that the federal government will stand up if local officials continue this all-out prohibition going forward?
Well, as you know, and as I indicated in my Notre Dame speech, I think religious liberty is the first liberty. It is the foundation of our republic, and a free society depends upon a vibrant religious life among the people. So anytime that's encroached upon by the government, I'm very, very concerned. as a technical matter, as you know, in facing an emergency, the government can put whatever restrictions the government's willing to put on everybody else, like athletic events or concerts and so forth. They can technically do it to religion as well, as long as they're not singling out religion, as long as it's really necessary. So I would hate to see restrictions on religion continue longer than they're strictly necessary. And also, I think when this 30-day period ends, I think we have to consider alternative ways of protecting people.
I guess that he's focused on a lot of the funerals that the Hasidic Jews are having in New York, where people do gather. They gather in, tightly together to mourn and to pray. And so that's the concern. I tweeted out something earlier today, just how, these are inalienable rights. It means, there's a lot of Americans today who are mourning those who've lost their lives in this horrible virus, who also say, the government doesn't have this right to take our rights away, even when the experts are saying this is a horrible time for us, health-wise. And they're very worried, increasingly worried, I think, as time goes on, but they've been very patient as well.
Yeah, I think they have been patient, and I think we have to be very careful to make sure this is, that the draconian measures that are being adopted are fully justified, and they're not alternative ways of protecting people. And I think, when this period of time, at the end of April, expires, I think we have to allow people to adapt more than we have, and not just tell people to go home and hide under the bed, but allow them to use other ways, social distancing and other means, to protect themselves.
Would there become a time in the future, perhaps after this April 30th date, where a state somewhere or a local official who declares no religious services with no accommodation, that there's a lawsuit filed, a federal civil rights lawsuit against that government action, whether it's by executive decree locally or statewide, or whether it's by the federal government? When would that happen? Would it take a lawsuit? Or would you take action?
Well, we've seen situations even up till now where some jurisdictions have imposed special burdens on religion that they weren't also applying to other kinds of gatherings and events. And we jawboned the local governments at that point, saying they really couldn't do that whatever they were doing to churches, they had to do to everybody. And they changed their rules to be neutral in that respect. So we're going to keep an eye on all these actions that restrict people's liberty. But by the same token, in a situation that is essentially akin to wartime, the government can impose certain limitations.
But in wartime, we had a Supreme Court that still was in session. We had a Congress that I don't believe ever went out of session, for any length of time. And now we're at a wartime now, and we have the executive branch. Congress is back home in their district, and the Supreme Court is closed. What's that? How is that the whole of government approach to fighting a pandemic when it's just the executive branch and?
Well, the Congress has taken action, fairly substantial.
Spending a lot of money, yeah.
Substantial action. They certainly had the ability to provide guidance and restrictions on how we responded to this. They've chosen to do what they've done, and they're certainly free to come back into session anytime they want to make a course adjustment. The Supreme Court has, for a period of time, certainly during this 30-day period, stopped their usual business.
So you see what I'm saying? The rule of law still applies during a pandemic. But the rule of law, our inalienable rights, the law of the land, it all still exists, and we don't want to set a precedent where every time experts declare a crisis, and it's scary, and a lot of people are going to die, that we just lose our ability to function as a government. And the executive branch, I know you're the executive branch now, but where we don't have that whole of government real approach to safeguard the liberties of the American people.
Well, one of the things that I think the president has done very well here is to use the strength of a federal system where certain decisions should be made in Washington, perhaps, but also allowing each state to adapt to the situation that confronts it and make their own choices. And that's a form of protecting liberty. The federal system is a form of protecting protecting liberty, to have the government closest to the people make those decisions. So I think we do have that protection. You're right in the general sense that there is a power for the government to take extraordinary steps in genuine emergencies. That obviously creates a slippery slope. What do you call an emergency? And I am concerned that we not get into the business of declaring everything an emergency and then using these kinds of sweeping extraordinary steps. But given where we were back in March, I think the president made the right decision. I think the president's made the right decisions for the right reasons. I think against the advice of many people, he closed the borders. And I think when the history of this is written, that's going to have saved a lot of lives. I think that given the uncertainty that surrounded this and the possibility that it was so contagious that it would swamp our healthcare system, he supported the appropriate moves for a limited period of time.
Will you be recommending going forward any type of changes to protocols at our borders, our ports of entry? Obviously a lot of legal implications there, health screenings of people coming into the country. Again, given the deprivation of Americans' liberties due to a virus that came, without getting into the details, but it came from a foreign entity, namely here, China.
Absolutely, and I think, as horrible as this is and as tragic as it is, there are a couple of good things that could flow from this experience. And one is to once again appreciate the importance of borders and controlling who is coming into the country. I've felt for a long time, as much as people talk about global warming, that the real threat to human beings are microbes and being able to control disease, and that starts with controlling your border. So I think people will be more attuned to more protective measures, but also the supply chain issue. The idea that much of what we need to protect the health of the American people is in the control of foreign governments who can interdict it and say we're not shipping stuff to the United States when everyone else in the world wants it during a pandemic was a crazy situation to get into. Happened before this administration, and the president's trying to deal with it.
This virus originated in China. We still don't have all the data. We still don't really know about patient zero in China. A lot of that data is being withheld still from the United States, and top medical people are saying that. What about the Justice Department getting involved more, I guess obviously, to the American people in this battle against the ongoing propaganda machine of China in the United States at our universities and businesses? Hey, in the White House press room the other day.
Yes. The department is heavily engaged in that. In fact, that's one of our highest priorities in the counterintelligence realm, counterespionage realm, and protection of trade secrets is our activities directed to defend against the Chinese. The Chinese are engaged in a full-court blitzkrieg of stealing American technology, trying to influence our political system, trying to steal secrets at our research universities and so forth. And we are focused on it. We have something we call the China Initiative. We brought a lot of indictments, but it's something that we also have to expose by letting the business community understand exactly the nature of the threat.
Given what you know today about the panoply of abuses internationally against the United States, who's the bigger threat to America's election security, Russia or China?
In my opinion, it's China. And not just to the election process, but I think across the board. There's simply no comparison. China is a very serious threat to the United States, geopolitically, economically, militarily, and a threat to the integrity of our institutions given their ability to influence things.
And yet our premier academic institutions, Harvard University, our top schools across the country have welcomed Chinese students in to learn and to take part in research. Here we've had documented abuses, ongoing federal investigation now, indictments in Boston against a Harvard University professor for conspiring with the Chinese, allegedly. Any thoughts on those ongoing federal grants to institutions where, again, this is an all-out blitzkrieg? Why are we allowing all these Chinese researchers into the United States?
We have to, well, I think we are trying to tighten up on those programs, and a number of the universities are working closely with the government to understand what the nature of the threat is. But it's not just universities. I mean, universities are part of the problem, but a lot of American businesses, just for short-term profit, or what they see as a short-term profit, they know over the long run it's not going to be long-term benefit to their business, but just for short-term gain, they are perhaps not doing what is necessary in the long-term interests of the United States.
The Gates Foundation are in favor of developing digital certificates that would certify that individuals, American citizens, have an immunity to this virus and potentially other viruses going forward to then facilitate travel and work and so forth. What are your thoughts from a civil libertarian point of view about these types of what some would say tracking mechanisms that would be adopted going forward to reopen our broader economy?
Yeah, I'm very concerned about slippery slope in terms of continuing encroachments on personal liberty. I do think during the emergency, appropriate, reasonable steps are fine.
But a digital certificate to show who has recovered or been tested recently, or when we have a vaccine, who has of people who've received it. That's his answer on Reddit, Ask Me Anything. They had a little forum.
I'd be a little concerned about that, and the tracking of people and so forth, generally, especially going forward over a long period of time.
Are you surprised at how wildly partisan a response to this pandemic has become in the United States? I know everything's political, but this is about saving lives and saving the broader life of America. And yet, from a drug like hydroxychloroquine that's been around for 65 years, 70 years, to other measures the president's taken, working with Democrat governors quite well, looks like, it never seems to be good enough.
No, I have been surprised at it. In fact, it was very disappointing because I think the president went out at the beginning of this thing and really was statesmanlike, trying to bring people together, working with all the governors, keeping his patience as he got these snarky gotcha questions from the White House media pool. And the stridency of the partisan attacks on him has gotten higher and higher, and it's really disappointing to see. And the politicization of decisions like the hydroxychloroquine has been amazing to me. Before the president said anything about it, there was fair and balanced coverage of this very promising drug, and the fact that it had such a long track record, that the risks were pretty well known. And as soon as he said something positive about it, the media's been on a jihad to discredit the drug. It's quite strange.
There's a lot of concern now, given the length of this time, and the concern when you hear Dr. Fauci say, well, we probably can't go back to normal life until a vaccine, which would be like 12 months, 18 months, that if things don't open up pretty soon, over some gradual reopening with new protocols, all that, there's a concern about social unrest. You're seeing a lot of stores boarded up in San Francisco, Chicago, Detroit, St. Louis. You're seeing more of that. Small businesses affected, especially by theft and other criminal activity. How concerned are you about the social and unrest and criminal activity in an ongoing shutdown?
I mean, I think if we extend a full shutdown, that's a real threat in some of our communities. But I don't think it's limited to that. I think the president's absolutely right. We cannot keep for a long period of time our economy shut down. Just on the public health thing, it means less cancer. Cancer researchers are at home. a lot of the disease researchers who will save lives in the future. That's being held in abeyance. The money that goes into these institutions, whether from philanthropic sources or government sources, is going to be reduced. We will have a weaker healthcare system if we go into a deep depression. So just measured in lives, the cure cannot be worse than the disease. But when you think of everything else, generations of families who have built up businesses for generations in this country, and recent immigrants who have built up businesses, snuffed out, small businesses that may not be able to come back if this goes on too long. So we have to find, after the 30-day period, we have to find a way of allowing businesses to adapt to the situation and figure out how they can best get started. That's not necessarily instantaneously going back to the way life
People are going to be afraid to go out for a long period of time. They're going to be afraid to go to restaurants, maybe won't go to the re-up at their health club.
Right.
But people have to have confidence that it's decently safe out there to move around.
Right, and that's why they have to be given accurate information. But also, we have to make PPE more broadly available. Restaurants have to change their protocols, perhaps, or other businesses
A lot of them can't stay in business if they can't pack it in. You know, DC,
Right.
they got to pack it. That's the only way they make money, paying these jacked up rents.
Right, that's a danger. That's a danger. So I think we have to allow people to figure out ways of getting back to work and keep their workers and customers safe. I'm not suggesting we stop social distancing overnight. There may come a time where we have to worry less about that. I don't know when that will be.
One question I didn't ask before. Federalism, states' rights, the president has been very clear on that during this health crisis. Are you surprised that certain states, New Jersey in particular, had come in to say that gun stores are non-essential, gun shops are non-essential, but abortion facilities are essential, given what we're facing?
Well, I'm not surprised. I mean, that's where our politics are these days. But obviously the federal government agreed that gun stores are essential.
And abortion facilities in Texas deemed non-essential by the governor, lieutenant governor, very strong on that. That saw a lot of legal challenges. Do you foresee,
I think it was just upheld.
Yeah. Do you foresee that continuing, those types of challenges going forward against what is essential in a crisis?
Well, I mean, again, after this period where we have very strong restrictions in place, hopefully there won't be a need for those kinds of distinctions to be made.
Oh, you think that people are going to have such benevolent approaches? I mean, the left is clearly trying to use this to reshape American society. This is never to let a crisis go to waste. Now we're going to do climate change policy and a massive wealth redistribution for the disparities in health care. That's what all the Democrat politicians are now talking about going forward.
Yeah, I'm concerned about that.
How has this changed your daily life? I mean, it's changed everybody's lives. We've never lived through anything like this. Just personally, reflect on it.
I still come in most days, and we sit at the conference table very spread out when we need a meeting. We do more by telephone and by a group teleconference and video conference than we have before.
Do you take your temperature as you come in? Do you?
I take my temperature. I'm tested occasionally at the White House when I'm going in to see the president. We're starting to wear more as PPE becomes available beyond the healthcare industry. We're wearing more PPE.
Will you wear a mask going out in public if you just had to go to the grocery today? I know you don't go to the grocery store, but if you had to go to the grocery store, Mr. Attorney General.
Well, I actually wear a mask. I wear a mask, and my security detail wear a mask when we go in every morning and we go home, and frequently I'll wear it here in the office. I didn't think you'd let me wear it on this show.
Is there a little?
Although maybe it would be better.
Is there a little design or anything, or is it just
put a little
classic?
Smiley face on?
Yeah, good. Okay. Mr. Attorney General, thank you so much for joining. We appreciate it.
Thank you.
Those watching right now who have now lost their livelihood, who are scared about the future and not sure what tomorrow holds. But through these hard times, I want you to know that we are here to support you. We see you, we know what is happening, and we are doing everything we can to make sure, whether it's at the national level, state level, or here locally, we are here to get through this together. Mayors around the country have been monitoring data that helps us understand how our communities are responding to the changes and the moves around our cities as we work together hand in hand to address this crisis. And we've seen a significant drop in movement. That's because of you, and I thank you for that. It's a sign that folks are abiding by our stay-at-home order, and that is exactly what we need to see. But based on a sample of movement data, we know that Angelinos are still visiting certain places of recreation, and many folks are visiting places of worship. In fact, while it's good news to see a 69% reduction, still 31% of the sample are visiting churches and temples. Going into the holiday weekend, I want to remind you how important it is to stay put. That it is okay to participate. In fact, we encourage you to connect with services online, to listen to a sermon, to hear from religious leaders. But we need to make sure that we do that from a distance. That's how we will keep deaths down. These moments that we commemorate in this Holy Week and in the weeks ahead, we need to make sure that we are not adding to stories of tragedy, but that we are marking them and saving as many people as possible. So let's get to the numbers. Today in Los Angeles County, there were 425 new cases, bringing the total to 7,955 confirmed positive cases of COVID-19. This is just a 6% increase since yesterday, and that is the smallest increase we have seen since we've been tracking the statistics. It's good news and the fourth day in a row of single-digit increases. But remember, every day we are getting more new cases than we got in the first 3 weeks. So hold both of those numbers, that our work is producing a slower rate, but that we still have some of the toughest days ahead of us. In the city, there were 227 new cases, bringing the total in the city of Los Angeles to 3,587, also a 7% increase. And we learned today, tragically, of 25 new deaths, bringing the number total of deaths to 223. Those 25 deaths are the third highest number we have seen, and it was a 13% increase since yesterday. Our numbers of deaths are still doubling every 4 days, and our hearts go out to those families who have lost 25 different families who are mourning the loss of a loved one for the first time, and the other 198 who have still been mourning during this crisis. I know we get numb to these numbers, but let us not be numb to the families and the people behind them, each one who can never fill that hole, but we will remember them, and we will do everything to try to ensure that there are fewer numbers in the days ahead. Hospitals continue to save lives, and I thank all of our hospital workers that are doing such amazing work to treat those that are sick and to prepare for more that will come. The more lives we can save, the more we prepare for the peak. So let me share our hospital bed numbers with you. Across the county, our general emergency hospitals have 1,641 available beds, including 268 ICU beds, and an inventory of 971 available ventilators. Testing, we know too, is the other weapon that's absolutely critical in our ability to not just flatten the curve, but eventually to see that curve bend down. And 3 weeks ago, when there were very few tests available, we acted on our own to provide tests to first responders and to medical personnel. And then we expanded that quickly to residents, administered by our fire and our personnel departments of the city of LA, and now together with county workers as well. We opened up testing earlier this week to anyone in the county that has symptoms. Today, we set a new record, testing more than 4,000 people in our city and county. These were scheduled through our website, and of course there's more tests being done directly through providers. But we blew past our goal through those drive-through and walk-up centers of testing 30,000 people. We hit that 1 day ahead of schedule, and here's even better news. We're aiming to double that number to 60,000 by the end of next week. Even if slots are filled for a given day, I want to remind folks who are viewing that many open up because we always have a few people that don't show up. So check it out. If you can't get into one date, you'll be pushed to another date, and you go to coronavirus.lacity.org/testing to see if you qualify for a test and to get yourself an appointment. The reality is some folks cannot go out, though, to get tested, so we need to go to them. Yesterday, following the news of COVID-related deaths at the Motion Picture and Television Fund nursing home, our LAFD testing team deployed to that facility, where they tested more than 100 seniors and employees right away and another 60 today. We have a responsibility to keep the most vulnerable who live amongst us, our seniors, our grandparents and parents, safe. So tonight I have a good announcement to make in that realm, that beginning now until this crisis ends, the city will deploy a rapid mobile test team that will go to these facilities that are housing the elderly, chronically ill, or debilitated, nursing homes, skilled nursing facilities, assisted living facilities, and respiratory hospitals. And if one of these facilities has a symptomatic resident or sees the start of an outbreak, we will send a testing team there as soon as possible to stop the spread and to help save lives. And we've set up a new website to help facilities get the testing that they need. So let me share that with you. That's coronavirus.lacity.org/assistedliving. Everyone has a right to be protected in this crisis, and they shouldn't have to fight for that right. I also spoke last night about the disproportionate impact that we're seeing across the country of deaths on the African American community. And I'm proud to say that we have doubled the capacity at our Crenshaw Christian Center testing facility in South Los Angeles. It's not enough to identify a problem. We have to take swift action to save lives, and I hope this is an example across the country of making sure that no community that faces tougher health indicators will die because we did not react to the numbers that we saw. Thank you to the county for sharing that, and thank you to my testing team for ramping that up so quickly. Today, workers at 30 fast food restaurants across California walked off the job to demand that their employers provide proper health and safety protections. And I want to remind employers that they have a responsibility to protect their workers. My worker protection ordinance requires that all employers provide face coverings for their employees or reimburse them for them, the opportunity to wash their hands or sanitize every 30 minutes, clean, fully stocked restrooms, physical distancing measures between employees and anyone else at the establishment, and hand sanitizer at key touch points. Additionally, all customers who enter restaurants, markets, and many other businesses must wear a face covering, and this is not negotiable. This is a matter of people's fundamental right to be safe at work. I've loved hearing everybody thank every worker that is out there, whether they're working in a fast food establishment or at a grocery store, in a hospital, or responding to a 911 call. But let's make sure those aren't just words. Let's protect those people so that they don't get sick and so that they don't die. Driving to City Hall each morning, I can see that Angelenos really are taking to heart the facial protection order. Thank you for doing that. But one last reminder that the worker protection order goes into effect officially this evening at midnight. So face coverings will be mandatory whenever you go to shop or work at a restaurant, store, market, hotel, laundromat, or pharmacy that is open, whenever you ride or drive in a taxi or rideshare, and if you're working on a construction site or with a delivery service. We know that during this time of crisis, many individuals and families are in need of services, and support isn't just coming from the city. Your county is here for you too, and I want to thank our Board of Supervisors and each of the county agencies that's stepping forward to help. My wife, her first job when I convinced her to move from the Midwest here to Los Angeles was at the Department of Public Social Services, and those employees do work long before COVID-19 to help address poverty and provide opportunity for our residents. So if you're struggling to put food on the table right now, the CalFresh program is there through DPSS for individuals and families. If you're having a hard time making your ends meet, there's a General Relief Cash Assistance Fund for single adults. There's a CalWorks Cash Assistance Program for families, and the Cash Assistance Program for immigrants that covers aged, blind, or disabled legal non-citizens ineligible for supplemental security income, as well as refugee cash assistance for refugees, those who have found asylum here, as well as trafficking and other serious crime victims. Health coverage benefits have never been more important as well, and this department can help you make sure that you access or enroll for Medi-Cal during this critical time. So don't wait till the last minute to access these benefits or to find out if you're eligible for them. Please, tonight, if you need help, go to dpss.lacounty.gov or call 866-613-3777 to ensure that you have the coverage and support you need. The county also provides critical delivery services for seniors, dependent adults, and disabled Angelenos. And if you need that sort of help, you can call 888-863-7411 to schedule free delivery of groceries, household items, and vital necessities. And I want to thank everybody who's doing this, whether it's neighborhood councils, whether it's some of the food supplemental organizations that help to deliver, and our food banks as well. And you can receive through the county program up to 4 deliveries per month, and I encourage all eligible Angelenos to sign up and take advantage of this service. And with this crisis hitting our elderly and our disabled communities especially hard, the Department of Public Social Services also offers in-home supportive services so that you can stay safer at home. Anyone in need of these services can apply right now for them by calling the In-Home Supportive Services application line at 888-944-4477. I've made it very clear from the beginning of this emergency that this is a local emergency, but that we are not shutting down critical government services. Your city government is up and running with water and power, street cleaning, law enforcement, transportation. All the basics remain and will remain covered. One of those core functions is picking up the trash. I've always said we need to get back to the basics, and I'm proud of our sanitation workers who are doing that day in and day out. And I want to thank all those city workers who are showing up and fulfilling their duty to serve our city. And that work could not be more important because after 3 weeks staying safer at home, a lot of folks are seeing more waste and recyclables that are piling up. So tonight I'm announcing a new effort for the 750,000 single-family homes and many of our apartments in our city that are serviced by our sanitation department. We will temporarily offer free extra collection on those black and blue bins on your regularly scheduled collection days. So here's how it works. If you have extra bags of trash or recycling that don't fit in your bins, we ask that you meet the truck outside when it arrives. So you can hear the truck long before it gets there. Our drivers will stay in their vehicles and customers will have to abide by the proper physical distancing. But once your bin is emptied, you can refill it while the team is there, and they will take that in as well. Simply put, we're doubling down on picking up your trash. And of course, this is free. You won't be charged 1 cent more for this. I know it's not a perfect solution, but it's the creativity that we're trying to add in a very difficult moment to make sure as more people are eating at home, staying at home, that we can lighten the waste load that you have while protecting the health and safety of our workforce. So this is free of charge. It starts on Monday and lasts until the Safer at Home order is lifted. And if you have any questions, please call our sanitation department hotline 24 hours at 1-800-773-2489, or during work hours, call 311. Throughout this crisis, we're constantly evaluating better ways to serve Angelenos while keeping you safe and our city services going. So in order to continue providing excellent care for our city's animals and protect our staff, we're consolidating our animal service care centers, and beginning this Monday, April 13th, the department will close its West Valley and North Central Animal Services Care Centers. The animals housed there will be moved to one of the 4 that remain open. That's the East Valley, the Harbor, Chesterfield Square, and West Los Angeles Animal Service Centers. This is possible thanks to an outpouring of love from all of you for these animals. Last month, you helped us place 307 animals in foster care, found homes for another 919, and placed 752 with rescue partners. Simply put, these numbers are off the chart. And there's never been a better time to foster or to adopt, so nobody should be lonely. And if you want to have a great friend join you, we're encouraging you, and we're available for adoptions to go and adopt. Animal Services has a long list of folks wishing to foster, but you can jump that line if you're willing to adopt. So please visit laanimalservices.com/adopt or call 888-452-7381 and have the animal ID number ready from our website, and we will make sure that we guide you through the application over the phone, schedule an in-person pickup appointment between 11 a.m. and 4 p.m. at one of the open centers. It'll be a great way to get through this and to help an animal in need. During these briefings, we regularly highlight the work of the Mayor's Fund of Los Angeles, which has been a central hub for our city's response. We're collecting and distributing donations to fill critical needs, whether that's meals for newly isolated seniors, whether that's shelter for domestic violence victims, childcare for parents who are working on the front line in hospitals, or direct assistance, cash assistance to Angelenos who are experiencing financial catastrophe. Make no mistake, as we share the news, good news about new contributions, that doesn't mean that we are covered or that we have all the donations we need. It's actually the opposite. Let me give you one example of how we're putting these funds to use and why they're so desperately needed. On Thursday, our city's Family Source Community Centers began distributing $1.2 million in grocery gift cards. In just 4 days, they were gone. Our supply was completely exhausted, and we helped 10,000 Angelenos get groceries that they badly needed. And let me thank the staff at our Family Source Centers who are working in this crisis. They rose to the occasion to manage a completely new program and to get this help out the door as quickly as possible. It's a tremendous example of the city and nonprofit workers who are going the extra mile to help our fellow Angelenos. That's good news, but it's also a reminder of how much need there is out there. And tonight we received a generous gift to help us with some of our most important work. We've all been following stories about domestic violence during this crisis, and most of us are safer at home during this pandemic. But for folks who live in a dangerous environment domestically, this can be a dangerous time. LAPD has reported an increase in calls, and the Los Angeles Housing Authority has determined that approximately 90 victims have been turned away from LA's domestic violence shelters since this crisis began. That's unacceptable for all of us. These shelters are full not because of increased demand, but because they're intended to be temporary, and the Los Angeles shelters normally house victims and their children for 30 to 45 days. During that time, they do incredible work. They work with specially trained staff to address the trauma of these victims, stabilize them, and either return them home, move them to alternative housing with family or friends, or place them in transitional housing. But because of this pandemic, victims right now are frozen there instead of being able to move through those shelters. And as a consequence of this public health emergency, there is no movement to different living situations. The unfortunate fact is that 1 in 4 American women will experience domestic violence in their lifetime. And make no mistake, men are victims too. In Los Angeles County, women who have been victims of domestic violence make up the largest subpopulation of our homeless population. On Skid Row, one study said that 91% of women on Skid Row were the survivors of sexual and/or domestic violence. So we need a surge in shelter capacity. 2 weeks ago, the Mayor's Fund for Los Angeles quickly responded with funds to pay for hotel rooms and meal stipends for 80 families that were suffering from domestic violence for 15 days, an example of how funds are going quickly to fill needs. But on Monday, we will need additional funds to continue sheltering 53 of those families, not to mention new funding to deal with the increased cases, which is why I'm so pleased tonight to announce a donation. And I thanked Rihanna once already, but she stepped up a second time. But Rihanna's Clara Lionel Foundation and a new donor who's been helping us, Jack Dorsey, together are co-funding a $4.2 million grant to provide 10 weeks of support, including shelter, meals, and counseling for individuals and their children who are suffering from domestic violence. Their generous support will cover housing and food for 90 domestic violence victims per week, with an additional 90 victims every week thereafter for 10 weeks. And all I can say is thank you. You are truly angels, helping this city of angels. Jack, Rihanna, you are helping save lives in more than one way, keeping people healthy and making sure that they are safe. So if you can afford it, please, every dollar counts. Go to mayorsfundla.org and chip in whatever you can. Crisis or not, that kind of generosity is part of who we are. And so is gratitude. When we see neighbors who are helping neighbors, when folks answer phone calls as volunteers, when they go to a food bank and help our seniors be fed, people have gone above and beyond to lift up people in need. And I'm so proud to be the mayor of this city, so proud to just be a resident of LA alongside you. There are so many essential workers on the front lines of this crisis, and right now all of us are doing our part to protect public health. But no one is doing more than our healthcare workers. Those doctors, nurses, medical technicians, janitors in our hospitals, those folks that are on the front lines treating patients, risking their own lives to save others. And I want to thank them all. I had mentioned Wet Design. Mark Fuller is the CEO. He called me today and he's donating some facial shields to help those workers and some of our grocery workers. But our medical professionals have just been extraordinary. And we've seen a movement around the country and around the world to thank them. And we want to express our thanks tonight in Los Angeles. So tonight you will see City Hall, hopefully on a TV screen, don't come in person, that lit up blue, as well as a way of us saying thank you to our national healthcare workforce. This is part of this national campaign that's been inspired by a global movement. And you're also going to see the Convention Center, LAX, LA Live, the Coliseum, the Music Center, Staples Center, Bank of California Stadium, and so much more join in tonight. There will be literally blue everywhere. And I know many of you have already started doing this, but if you want to do your part at 8 o'clock tonight, open up a window or open up your door and applaud these workers. Applaud so loud that they'll hear them coming back from a shift or going to an overnight shift. They'll hear them in a hospital or a clinic someplace close by, or in their apartments or homes as they've come to rest their weary feet. One voice, united as a city and a community, we say thank you. You are the ones who are saving our lives. It's the same thing that we can do every single day when we commit to being safe. So stay healthy, stay safe, and stay at home. Thank you, Los Angeles. And with that, I'll be happy to answer questions.
And our first question comes from the line of Alex Michelson from Fox 11 News. Please go ahead.
Hey, Alex.
Hi, Mayor. Congratulations on what seems like some good news and some progress when it comes to the numbers here in Los Angeles and also in California writ large. What is your thinking? Walk us through your thinking of when you will think, now it's time we can start going back on some of this stuff, start easing some of these restrictions, because there's so many people that are so eager for that day to come. And secondly, just listening to your voice, it sounds like, are you a little under the weather? Are you doing okay?
No, I'm fine, thank you. No, I'm all good. My daughter has a non-COVID-19 cough, but besides that, we're all doing well. So a couple things. And now that you said that, I have to clear my throat, of course. I think you hit the nail on the head, Alex. It is really tough because what I've tried to communicate to Angelenos is a mix of kind of your high school sports coach and Debbie Downer every night. I want you to feel encouraged, but I want to be honest about the bad news too, because I think the bad news steels us for what's ahead. And while it's true we have a better number, the last 4 days, single-digit rate of increase, it's still increasing. And the base is bigger. So even any increase off a bigger base means hundreds of people, where we used to say it was just a few or a few dozen people. That's really a tough thing to face, knowing more people are going to be dying in these coming days, more tragedy. Second, we see even in some of the places that did really well early on, I was just reading about Singapore, we're seeing it maybe in Wuhan again, in South Korea, that places that kind of had not only bent the curve down, but flattened it, they now are seeing second waves. It's still not clear. In some places, there's evidence that people who have gone through this once and who we would think would be immune because of the antibodies are getting a second positive. So we really have to follow the medicine. We really have to follow the doctors. We really have to follow the data. And not just as we've always done and we want to follow our hearts. This is a tough challenge because, as I said from the beginning, when it feels wrong, it's the right time to do something. By the time it feels right, it's too late. Or when it feels right, it may be too early, I'd add to that. So the idea that we will suddenly emerge, I don't want that to happen if that means a second wave of deaths, or the marvelous work that we've seen here in Los Angeles by being ahead of many of these actions, in California by being the first state to have a stay-at-home order, that somehow we would see that reversed. And I believe I shared last night with you the story in 1918 in San Francisco, where they did a really good job with the influenza epidemic. They declared victory, came out, and had a sudden and severe onslaught a second time that resulted in a lot of deaths. So we are talking to a lot of folks, but until we have tools that maybe didn't exist 100 years ago, but the tools of being able to test people with the blood tests, figuring out the workplace environment rules, something I'm talking to mayors around the country and doctors to, as well as, of course, our county public health. We're going to think really hard about that moment. We know, have some weeks before we would even contemplate having this order lifted. So with that in mind, we hope in the next few days to have a better idea of that, and we're watching around the world those places that went first, had success, but are now seeing some backtracking of that. What lessons can we learn from that? Thanks, Alex. Next question, please.
And our next question comes from the line of Claudia Pschuta from KNX News Radio.
Hey, Claudia.
Hi, Eric. Wanted to ask, the LA Times did a story today about the difficulties of people on the streets trying to get face masks and wash them. And so I wanted to ask you about that now that the order is due to take effect. One of the concerns that was raised in the story is that, some people may not be allowed to go into laundromats and other essential businesses without masks, which would make it virtually impossible for some homeless people to wash their masks if they can get them, or get food or whatever other items they might need. And also, I'm wondering what steps the city might take, and along with county public health, to track any outbreaks among homeless people on the streets. We know that there are some institutional investigations involving shelters, but what can be done to track something like this?
Yeah, thank you for both questions. From the beginning, we've been very concerned in the street, and we've moved, the Homeless Services Authority has moved away from just educating people on the street to now doing wellness checks. As I announced yesterday, we now have testing through clinics that our unhoused Angelinos regularly go to, with doctors who work with people who are experiencing homelessness. And we saw hundreds of those go out just today alone. And the masks or the facial coverings, we have 35,000 that we have ordered that we can distribute on the streets. Some of that has started as well already. And in terms of the sanitation, on top of the 300 plus wash stations, and as I said yesterday, I wasn't happy that those were being serviced every week. We talked to the provider of those, and now those are going to be filled and checked daily, not just by them, but also by our sanitation workers. So a double check on that to make sure that people can wash those things, can wash their hands, can be clean as well. In terms of outbreaks, remember we've had per capita more COVID-19 cases among people who are housed than people who are unhoused. That said, absolutely, the public health direction we had, whether it was in existing shelters or the new congregate shelters, or even as we move people into hotel rooms and motel rooms, are when we know where people are, we can track them and it can be safer. So for instance, in Granada Hills, I know it was in the news that there was somebody who had tested positive in the shelter there for COVID-19. The system worked exactly as it's supposed to. If they had been out on the street, we wouldn't have known. That could have spread. It could have been a cluster, but instead they were immediately quarantined. Others were tested, the place was cleaned, and folks were able to be restored there. So we have never envisioned a world in which anybody who's housed or unhoused won't get COVID-19. It's about how quickly we can respond. And thanks to the county, for instance, at the Granada Hills shelter, here at Skid Row at one private mission, they immediately have full-time people who are there to monitor and to make sure that, as with jails, as with other congregate settings, that doesn't become a cluster. So far, so good, knock on wood, and we're getting those masks out. Next question, please.
Our next question comes from the line of Jory Rand from ABC7. Please go ahead.
Hey, Jory.
Hey, Mr. Mayor, thank you very much for taking our calls again. I really appreciate you mentioning that cheer that's been going up every night. It's been pretty special to see that happen in downtown in different neighborhoods. So thanks for addressing that. I do want to ask you about, I know you addressed that blood testing, the antibody testing a bit yesterday. We were at a private drive-up testing facility today where they were charging people about $100 to get that antibody test. Is there any oversight of these private facilities? Is there anything people should be wary of when going to one of these sites? And if someone does show positive for the antibodies, that they at some point had the virus, is that still added to the count of those testing positive for the city or the county? And also, I just want to ask you real quickly about the rapid mobile test team that you mentioned earlier that would show up at a place, a facility where there's an outbreak or a patient who's showing symptoms or test positive. Would the city or county be involved in the next step? Would it be evacuating that facility? How would the city and LA County be involved in what comes next after a positive test is found at a facility like this? Thank you.
You bet. Thank you, Joy, and thanks for your words, too, about our public health and health professionals. Let me start with the second question. So the guidance when this happens is, of course, in any of these congregate settings, our marvelous Department of Public Health has staff standing by and that are just focused on congregate settings. So they can bring somebody. It's not necessarily to evacuate folks. Obviously, if it was a huge explosion, that's something to consider. But it's really getting rid of the folks who are there with that and putting them in quarantine. This has been part of the hotel and motel program that the county has. Isn't just for folks that are living on the streets, who are experiencing homelessness, who don't yet have symptoms. It's also for folks, whether you're housed or unhoused, who do have symptoms and have no place else to go, who have been confirmed as positive, so that those can be isolated, those folks can be prevented from spreading further. And then there's usually a public health professional, as I mentioned at Granada Hills Rec Center, who will then stay there ensuring that everybody else is okay. In terms of some of the places we've done this, I mentioned the Motion Picture Home, the Jewish Home for the Aging out in the Valley had some worries and had some positives. And it's not exactly a concierge service, but working with places that have medical professionals, we're able to get these kits. Some of them are through the partnership with UPS and Everlywell that I mentioned, and we can get them free transportation there. They get them, their medical professionals, and this team would immediately be able to help them make sure that they are taken and get them out of there that day to be processed in a lab. So it's a quick process, and in terms of the availability, those hotel rooms and motel rooms that are available right now, there's more capacity than people in them. That's where people would go. Secondly, in terms of the blood tests, I'm glad you raised this. There is no way for us to regulate the private entities that do this, and there are many private providers that are doing testing, both virology and serology. Virology tests are the right tests to know if you have it right now and you're infectious, whether you have symptoms or not. Obviously, we don't have enough tests yet to do that with people who are asymptomatic, but that will tell you whether you are sick and contagious right now. The serology or blood tests will tell you they can tell you whether you have it or whether you have had it, but they're not as dependable for whether you're contagious. So in other words, you may be contagious, you may have the novel coronavirus in you, but you don't have the antibodies yet that would be something that the blood test would catch. So as such, it's not a dependable test to know whether or not you can infect others. It's a good test to know whether you've had it. In terms of the price of this, I hope that our national government will exercise leadership to make this free for everybody. And if we can't make it free for everybody, make it free for those whose employers won't pay for it. I think for us to get people back to work, back to school, etc., we're going to need, school nurses, employers, others to have these blood tests and at least see whether people have successfully had this and survived it. With the caveat that I mentioned, we don't know the data yet. You can get it a second time possibly, even if you've had it once before. So we have to wait for that science. These blood tests are useful. They're most useful in seeing what the incidence is out there. Has there been 2% of the population, 5% of the population, 10% of the population who's had blood tests? So that's where we focused paying for some blood tests ourselves because we need to know that information. In the meantime, we're putting all of our money into the virology test that can tell us if you're infectious right now, because that's what we need to know to isolate you and to stop the spread. Hope that explained both of those. Thanks so much. Next question.
Our next question comes from the line of Steve Gregory from KFI News. Please go ahead.
Good evening, Steve.
Hey, Eric. Good evening. Quick question about some interesting stats that had come out of Dr. Ferrer the other day about the rate of cases in the African American community, and there was a concern about that, and it was disproportionately high. I'm wondering if you've got any kind of a plan to do any kind of aggressive testing or any kind of a program that might target those communities and get them some help in that respect. The other question I have has to do with homeless encampments. Now, we're getting a lot of feedback from listeners that some of these areas that have encampments, people are getting attacked, approached, still panhandling, that kind of thing. They're worried about the social distancing that's not being adhered to by that community. LAPD is involved, and apparently someone from Councilman John Lee's office had told these individuals that basically the city has to be hands off, the police has to be hands off, and they can't really do much about it. I wonder if you could comment. Thank you.
Sure. Let me start with that. I've always been very careful to say, look, we've got crime, people that live on the streets and people who live in homes. And nobody's status in terms of whether you're housed or unhoused will protect you from criminal behavior. So anybody who thinks, and there's always these rumors, and I've said it to the chief said it to every single officer, we will go after crime wherever we can and wherever we see it. And nobody is immune from that simply because they're housed or unhoused. On the flip side, it's very important to remember that, not everybody who's homeless is somebody who has a mental health issue, a substance abuse issue, and or who is a criminal. That in each one of these, when we do plenty of polling on this, we see plenty of surveys on this, this is a minority of the people that are out there. But where there are those incidents, please do call LAPD, 1-877-ASK-LAPD, or if there's something that's happening, a crime in progress, call 911. And there is no sort of immunity to that at all. We can't be all places all the time, but whenever there's violent crime, property crime, those things, right now we've seen a drop in crime during this, a pretty dramatic one. We have resources available. This is not a public safety emergency where we have to restore order. So we do have those resources and we can use them. So please do contact either your local station, your local division, talk to your senior lead officer, or just call that hotline. In terms of the African American community, I mentioned this a little bit in my comments, but let me go a little bit deeper. Yes, it was not enough, I said, to identify this problem that we see in Chicago, Michigan, where sometimes our statistic was 9% of the county population, 17% of the initial data we had in terms of deaths were in the African American community. Really three reasons, and I highlighted two of these yesterday. One is that we've had disproportionate health limitations in the African American community, the impact of years of racism, the impact of poverty. So many of the underlying indicators that can cause somebody when they get the coronavirus to be more likely to die disproportionately exists in those communities of color and low-income communities as well. I bet if we did the same thing for poorer people, wealthier people are going to survive this with the same symptoms more than folks that are poorer. Second, I shared with you part of the things from the LMU poll, which we'll be sharing some more about tomorrow. I know some folks asked about that, and tomorrow we hope to be able to share quite a bit of that robust data with you, or over the weekend. We saw that of all different ethnic groups, that African Americans had the lowest percentage that were extremely worried that they thought that they would get COVID-19. It was 35 or 36% at the time versus about 50% on average. So I said a very loud and clear message that this affects everybody. Don't think that it won't affect you because you're young. Don't think that it won't affect you because of where you live. It is universal. And third, we have also in that same poll, it was very interesting, African Americans were less likely to have lost their job or their hours. And that's a reflection, I think, of how many African Americans work in these critical professions that are on the line in government and other places, whether it's your postal delivery person, whether it is a city worker, whether it's somebody who works in a hospital or drives a bus. African Americans are more likely to be in a dangerous work setting right now because they are well represented in government jobs, and we thank them, and that's why we have an obligation to make sure that we don't just highlight this, but that we do something about it. So yes, as I mentioned in my remarks, we doubled down in the testing center that was closest to the largest population of African Americans in the city, that's run out of the Crenshaw Christian Center, and we've doubled the capacity in a matter of 1 or 2 days. So that the testing there, I think more tests are going through there than anywhere else, because I want to make sure that this statistic isn't one that lingers here, and that we don't just give lip service to saying this is bad, but we actually put our actions into saving lives, and making sure that all the lives that are out there matter equally. Thank you. Next question.
Our next question comes from the line of James Preston Allen from RL News Port of Los Angeles. Please go ahead.
Hey James, how are you?
Mr. Mayor, how are you doing?
Good.
I wanted to ask you something about the business community.
Yes.
Throughout the city of Los Angeles, we have multiple property-based business improvement districts. And I'm wondering whether or not you have elicited their help in helping to alleviate the difficulties that all of the small businesses are going through with the closures or partial closures of the restaurants, bars, and whatnot. Each of these property-based business improvement districts are authorized by the city of Los Angeles. And I'm wondering if you've asked them to participate in relief programs for rent relief for their tenants, or for any other help that they might provide to back up what your good efforts that the city is doing to help support small business.
Yes, thank you for the question. We absolutely have been in contact with the business community and business improvement districts. They've helped, whether it's in Hollywood, the Hollywood Entertainment District, going above and beyond to help us with our sanitation efforts on everything from, pedestrian crossing lights, buttons, to looking at street cleanliness, to making sure that we do everything we can to keep our public spaces less likely to spread the COVID-19. That's one thing they've done. Two, absolutely, a number of them have stepped up. Again, this is a business improvement district is a self-tax of the same businesses that are suffering right now. So I know many of them have looked back at what they could do to return some of that money, help out businesses. It's both sometimes property owners and sometimes it's a business improvement district of the businesses, not the property owners. There's two different kinds. So it's much tougher for these ones to who are already hanging on, or some of them have gone under, to use their own money, obviously, that doesn't exist. In terms of rent relief, no, we haven't reached out specifically to that, because usually the bids budgets are quite small compared to what the need would be, I think, across the bid. But it gets to a good point that I've said many times on this, but I'll say it one more time. Our national government, if we're giving assistance, for instance, to the banks, unlike what happened in 2008, need to give relief to the mortgage holders, these landowners that are the landlords of many of our small businesses, and they in turn need to give help to our small businesses. I believe the same thing should happen for rent forgiveness for our residential tenants as well. But if you look at the numbers, there's no way a business improvement district or even the city of LA would come close to but a small fraction before we would be bankrupt. This has to come from the big packages that are coming out of Washington, D.C. We would be held liable, but they can make that mandate since they regulate the banks, and I think that's the right place to do it. Thanks for the question, James. Next question.
Our next question comes from the line of Eric Hines from CBS News Service. Please go ahead.
Hey, Eric, how are you?
All right.
Go ahead.
I'm sorry, if you could 10 again, please.
I think you got to press 10 one more time.
All right, there you go. And your line is open, Mr. Hines.
Hi, Mr. Mayor, can you hear me?
Yes, I can hear you great.
Okay, fantastic. I was just wondering if you had a number on the volunteer medical workers who have signed up through the portal, and also what kind of work they're doing currently, if they're going to be part of that mobile coronavirus testing unit. Any other details on that program?
Yeah, I just got briefed on this today. I don't know what the full number is. I'll see if I can get to you by the end of this. It was 3,750 something a few days ago. It might be well north of that. Plus, of course, there's the California Medical Corps that the governor put forward that had over 100,000 people signed up already. We've now started going through that list together with partners who need this to relieve our testing centers, to help us out at the convention center where we're setting up hospital beds. So we anticipate that when that gets going in the next week or so, that there will be folks from Medical Corps that help us in the testing centers, any spillover places for standing up new beds, including perhaps helping at St. Vincent's when that opens up. So we know that there's a shortage of medical personnel right now. We've got a wonderful database, but it does require some background checks. It requires a few things that we are speeding up as quickly as possible. It's not quite enough to say, hey, I'm here. When people's medical care is on the line, you have to go through a couple more hoops. But we do anticipate putting the first of those folks to work this coming week. And I'll try to get you an overall number by the end of the press conference. Thanks. Next question, please.
Our last English question comes from the line of Elizabeth Chow from LA Daily News.
Hi, Liz.
Go ahead. One moment, please.
Okay, so I have some questions. I know that you've already answered some potentially about the shelter in Granada Hills.
Yep.
Okay, so my first question is, what is the purpose of the trailers parked outside the Granada Hills shelter? Are they for the employees, as I've heard, or workers? The other question I have is, are there concerns about the air filtration system at the Granada Hills shelter? And has that been brought up with the staff? And the other question I have is, I think you've actually mentioned this idea yourself of commandeering hotels. Are you thinking about revisiting that idea, considering maybe some of this, what happened at the shelter? And I guess I wanted just to tack on the question about what we are doing and regarding what people would go after being at motels and hotels.
Okay.
Thanks.
Great. Thanks, Liz. So in Granada Hills, no, trailers are there available if people need to isolate quickly. In these cases, we're able to, I think right now, put people pretty quickly into hotel and motel rooms, and that's what was done in this case. As I said, there's more capacity than patients for that right now, though we expect that to quickly ramp up, which is why we need more and more hotel rooms. In terms of the air filtration system, no, that's not been brought to my attention. We have public health there, so we'll take any guidance from them, but we don't expect to need to have air filtration systems. I mean, in any place, we're not putting special air conditioning in. People have their temperature taken before they go in there. It's safer than the street, and when anybody does exhibit symptoms like we found there, a test is given. If they're positive, they're taken out of there, the place is cleaned, and you reset it. So the system is working exactly like it's supposed to, so that people don't die on the streets, don't spread on the streets, and it spreads from the streets to everybody else as well. In terms of the more hotel rooms, we can't have enough of them, and we can't have enough of them quickly enough. In terms of my powers, I've said I have the power to commandeer them, but to be clear, the charter says we must pay for them too. So this has always been a funding issue. When I said over 2 years ago, we need a FEMA-like response to our homelessness crisis, I begged the state and the federal government to bring those sorts of resources in so we could house people quickly. It took this crisis, and I'm very thankful to FEMA, saying finally that we can reimburse for these hotel and motel rooms before somebody's sick, before the disaster hits them. In the past, it's only after an earthquake and people are homeless, or after a disaster or fire, that then FEMA will permit that. That is a remarkable change, and one that gives us a real hope in taking many more people off the streets. But as I announced last night, I've put kind of a czar on this, John Vane, who is the president of our Convention and Tourism Commission, so he knows many of those hotel folks. He's talking to them and trying to get even more deals as quickly as possible with the state and the county. And then finally, in terms of the exits, I've said it almost every night, but I'll say it again. Shame on all of us if we collectively let all these folks that we're going to take off the street simply go back to the street. We know not 100% of them will go into housing, but if we can get hundreds or even thousands more than we would have because we brought them into someplace safe, where they've articulated in so many cases, they feel safer, they have a meal, where they're starting to feel more human, they can take showers, they can be clean. We need to have an army of folks and the funding for it. If the federal government says good luck, goodbye, if the state says way to go, here's a few dollars, we will have lost the most important opportunity. And you will hear me talk about this with my fellow mayors up and down the state, that we really want to partner with the federal government. This is an amazing opportunity. Maybe some of these hotels and motels want to sell to us permanently, and we can turn that into housing. But we need staffing for them as well. You can't just put people in a setting and say homelessness is over. People who have needs, from job training to childcare to mental health and substance abuse issues, you have to actually get them those services. And I've always said the solution to homelessness might piss liberals and conservatives off. Liberals because you could finally move people off the street if you had enough beds, and conservatives because you have to pay for it up front. But if you do that, you don't have to pay for this crisis every single year. And so I hope this is not a crisis that we will let go to waste. And I certainly am going to lean in very hard on this throughout this crisis and when we declare victory on COVID-19 to make sure those folks are brought home permanently. Thanks, Liz. Last question, I think, in Spanish or next question?
We do have a follow-up question from the line of Steve Gregory from KFI News.
Okay.
Please go ahead.
Go ahead, Steve.
Hey, Eric, real quickly, I know you want to get to Spanish.
Don't worry.
Do you have an update on the crisis response team and how many contacts you've made with non-essential business still open? How's that working out? Are you seeing the improvement in that area? Thank you.
We've had great outreach. It's over 1,500 contacts. It might be over 2,000. The last briefing I had was over 1,500 contacts. Visits now close to 1,000. And a very small percentage, 92% of them comply. The 8% that then we need a little bit more of touch with, almost all of them comply. And then it's really been just a few dozen where we've had to either bring LAPD and or bring some sort of prosecution. The latest number I had was 8 charges, but I don't know what the latest ones are. Let me see if I can find that out for you as I answer the next questions as well, okay? But it's been working really well. And as I've said with all this, people ask this about masks, people ask this about our outreach folks. We really depend on people's self-enforcement we are here to supplement that and to send a message that we will come after you. So I did get the number, by the way, on the medical volunteers for that question. It was 4,296 people who have now signed up. I'll take the next question. Thanks.
And our only Spanish question comes from the line of Abel Alamillo from Telemundo 52. Please
Hola,
go
Abel.
ahead.
Hi, Mayor. How are you?
Good. How you doing?
Good, thanks. Just wanted to know in regards to the day-to-day COVID-19 cases, we saw that they declined considerably in the last 24 hours in LA County. Do you credit the safer-at-home orders for that decline?
There's no question in my mind that this is your victory out there, that this decline in the increase, and by the way, we can see still larger numbers each day, but the decline in the increase is the result of people staying at home. So this, to me, that we've had 4 days in a row with single-digit increases, that's not good. We're not going to be good until we have negative increase or a decrease. But that said, in the meantime, it shows that what we're doing is working. It's not time to let up. It's not time to declare victory. It's not time to come out. It's time to double down. It's time to stay home on Easter. It's time to not go out and as often as you can, stay at home instead of going to the market. If one person has to go, send one person, not the family. It is evidence to me that this is working. I'll say that as well in Spanish. Estos números son increíbles y son el resultado de sus acciones. Y gracias a la gente de Los Ángeles, porque la reducción en el aumento de casos es el resultado de su visión, de sus acciones, y también es una reflexión del alma de Los Ángeles. Segundo, es importante no declarar una victoria, porque tenemos más y más casos cada día. El aumento es reducido, pero los casos en total están creciendo. Y necesitamos tener días donde no hay un aumento. Este será una victoria, pero ahora es un tiempo para doblar su trabajo, doblar su presencia en su casa. Y es importante también por toda la gente tomar estas órdenes en su corazón, en sus acciones, en una manera seria. Porque nosotros podemos salvar vidas de nuestras familias, de nuestra comunidad, donde continuaremos con este. En unas semanas o unos meses nosotros podemos declarar una victoria, pero estas es buenas noticias. Con esto, I'm going to speak a little bit of Spanish now too. Thank you to everybody in English. Strength and love to you all, and thank you for tuning in. Muy buenas tardes a la gente de Los Ángeles y gracias por estar aquí esta noche. Sé que estos son tiempos muy difíciles, pero quiero que sepan que yo y su ciudad estamos aquí para ayudarle. Primero, la información que usted necesita. Hoy hubieron 425 nuevos casos en el condado de Los Ángeles, llegando a un total de 7,955. Este es el aumento más bajo que hemos visto, pero aún agregamos cientos de casos nuevos. Esto significa que sus acciones están ayudando, pero todavía tenemos días difíciles por delante. En la ciudad de Los Ángeles tuvimos 227 nuevos casos, llegando a un total de 3,587. Y tristemente, hoy fallecieron 25 personas más en el condado, llegando a un total de 223. Nuestro amor está con todas las familias de los fallecidos. En nuestros hospitales tenemos 1,641 camas disponibles. Entre ellas, 268 están en las unidades de cuidados intensivos y tenemos 971 respiradores disponibles también. Hoy hicimos pruebas de detección para 4,300 personas en nuestra ciudad. En total, 33,000 personas se han hecho la prueba en nuestros centros y estamos en camino para doblar ese número a 60,000 la semana que viene. Si tienes síntomas de coronavirus, visita la página coronavirus.lcity.org/testing para hacer una prueba de detección ahora. Pero también sabemos que hay personas quienes necesitan hacerse una prueba, pero no pueden salir. Entonces, esta noche estoy anunciando que la ciudad lanzará un equipo móvil de pruebas de detección para instalaciones alojando a las personas mayores con enfermedades crónicas o comunidades de vida asistida. Lanzamos una página para ayudar a estos lugares a acceder a estos servicios, coronavirus.lcity.org/assisted living testing. Mi orden para la protección de trabajadores entra en vigor hoy a la medianoche, la cual indica que los empleadores deben ofrecer coberturas faciales para sus empleados, la oportunidad de lavarse las manos cada media hora, sanitarios limpios y medidas para implementar la sana distancia. Además, todos quienes entran en un restaurante, hotel, mercado, taxi o un sitio de obra en construcción o servicio de entrega deben llevar una cobertura facial. También les recuerdo que los servicios municipales siguen en operación. Esta noche estoy anunciando que el Departamento de Servicios Sanitarios ofrecerá colección adicional de contenedores gratis, temporalmente para los hogares individuales y pequeños apartamentos. Si tienes una bolsa de basura o reciclaje adicional, espera afuera para recibir el camión cuando llega. Manteniendo siempre la sana distancia, espera que vacíen el contenedor y después llénalo de nuevo con la segunda bolsa y camión se lo llevará. Este servicio es gratis para residentes. Empieza el lunes hasta que acabemos la orden Más Protegidos en Casa. Si tienen preguntas, llama a 311. Además, para continuar a proteger a nuestros animales y personal, empezando el lunes 13 de abril, cerraremos nuestros centros de servicios para cuidado de animales en el Valle Oeste y Centro Norte. Van a mover los animales a uno de los otros centros que quedan abiertos, Valle Este, Harbor, Chesterfield Square y el oeste de Los Ángeles. Si quieres adoptar una mascota, visita la página laanimalservices.com/adopt o llama al 888-452-7381. También quisiera ofrecer progresos sobre nuestros Mayor's Fund de Los Ángeles. El jueves, nuestros centros de recursos familiares distribuyeron $1.2 millones en tarjetas de regalo para supermercados a 10,000 familias que las necesitan. Si pueden donar para ofrecer más a estas familias, por favor visita mayorsfundla.org para contribuir. Tenemos que hacer todo lo posible para apoyar a nuestros héroes y podemos empezar con decirles gracias. Esta noche estaremos iluminando el iluminamiento de color azul para expresar nuestro agradecimiento para ellos. También participarán el Centro de Convenciones, el Aeropuerto, LA Live, el Coliseo, el Centro Músico, el Centro Staples y el Estadio de Bank of California. Y ustedes también pueden participar con abrir sus ventanas o pararse afuera y aplaudir esta noche a las 8. Con una voz y una acción, expresamos quién somos en Los Ángeles. Quédense en buena salud, quédense protegidos y quédense en casa. Fuerza y amor, Los Ángeles. Thank you all so much. We'll see you tomorrow.
It's moving along quickly. The airline business has been hit very hard, as everybody knows, and we are going to be in a position to do a lot to help them so that they keep their employees and they save their businesses. And that'll be taking place, I think you can say, over the weekend. We may even have discussions with some of the airlines or all of the airlines over the weekend. And I think it's going to be a very acceptable package. It's a very big package and a very acceptable package. It'll be good for our country, good for the airlines, good for a lot of people. Likewise, I just spoke with the president of Russia, Vladimir Putin, and the king of Saudi Arabia, King Salman, and we had a big talk as to oil production and OPEC and making it so that our industry does well and the oil industry does better than it's doing right now. It's the numbers are so low that there'll be layoffs all over the world. There'll be certainly layoffs in this country. We don't want that to happen. We built a great energy business in the United States. So we have tens of thousands of jobs. We had a very good talk. We'll see what happens. But as you know, OPEC met today. And I would say they're getting close to a deal. We'll soon find out. So that was a conversation we just had. So we had a busy hour and a half. And let me begin by expressing my sincere gratitude to the American people. Millions of Americans are making profound and difficult sacrifices in their own lives because they know it will save the lives of countless others, and that's exactly what it's doing. You see what's happening and where we are, where we stand, and hopefully we're going to be opening up. We can call it opening very, 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 very soon, I hope. Together, our people are writing one of the most noble chapters in the proud history of our nation. Americans are also encouraged to learn that Boris Johnson, Prime Minister, has been moved out of intensive care. That's a tremendous statement. And we continue to pray for him and his fast recovery. That's a very, very positive development. As the New York metropolitan area continues its battle against the outbreak, the full power of the federal government is there to support them. As you know, the Javits Center has now been fully converted into a 3,000-bed hospital, one of the largest anywhere in the country. And by the incredible professionals, I have to say the Corps of Engineers, what they can do is just incredible. They've done a fantastic job, and they're building nationwide 21 temporary hospitals and care facilities, adding 17,000 hospital beds. And they did that all within a very short period of time. It's incredible what they've done. Army Corps of Engineers and FEMA has been fantastic. Our sweeping airlift operation to keep doctors and nurses supplied with protective equipment, Project Airbridge, continues to expand with more than 24 flights already completed and 49 additional flights now scheduled in the near future. So that's been very successful, and that gear and those outfits are being handed out. As they arrive, they're going directly to point. The American medical system continues to perform beyond our highest expectations, reminding us that the United States is blessed with the most advanced healthcare and the most skilled healthcare workers anywhere on the planet. Other countries are looking to what we're doing, and our testing operation has now become far and away the most sophisticated and the best anywhere. And we want to thank all of the heroes on the front lines as they fight to save American lives. We're at the top of the hill, pretty sure we're at the top of the hill, and now we're going downward. In some cases, we've already started that process. Earlier today, I spoke with hundreds of mental health leaders and advocates from around the country to discuss the vital work and the vital work they're doing. We had the top doctors in the country, some international doctors. Mental health, big factor. Not only has the virus inflicted immense physical suffering on many people, but also mental and emotional suffering as well. Even though we're staying physically apart, no American is alone, and we're all in this together. But the mental health doctors and experts, it's a very great call. It was a very interesting call. They're working very hard. We're also seeing encouraging signs in our race to develop breakthrough treatments and therapies. Pfizer revealed today that it has found a promising new treatment that might prevent the virus from replicating. and that it hopes to begin testing in clinical trials very soon. It's going to be very, very soon. They have great feelings for this particular therapy, and they think that a lot of good things are happening through the FDA's Coronavirus Treatment Acceleration Program. 19 therapies and treatments are now being tested, and 26 more are in the active planning or clinical trials. So we have 19 therapies being tested currently, and 26 more are in the active planning for clinical trials. That's a big statement. That's a lot. Trials for Gilead's anti-rival drug remdesivir continue, and the company has also expanded emergency use for new patients, getting good early results, by the way. The companies that manufacture hydroxychloroquine are massively ramping up production. As you know, many people are recommending strongly Z-Pak be added, the Z-Pak, and also zinc. And the federal government continues to build our stockpiles and distribute millions of doses for doctors to use as they see fit. And I'm pleased to inform you we're just having a lot of good things are happening, but we'll have to see how that all works out. But we've purchased and we have stockpiled millions and millions of doses, and we're distributing it. Some states want it very badly. Michigan, we just sent a lot to Michigan and other areas. I'm reporting today that we passed 2 million tests completed in the United States, first time. Most anywhere in the country. It's a milestone for our country. It's a milestone anywhere. Nobody's done anywhere close. Our tests are highly sophisticated and highly accurate. At the same time, we're making important progress on the economic front of this war. In a few moments, Secretary of Labor Eugene Scalia will explain new steps that we're taking to ensure American workers swiftly receive unemployment and paid leave benefits, and that employers protect the health and safety of all workers, including essential workers on the job, working very, very closely with workers and with employers. To provide further economic relief, the Federal Reserve announced this morning that it will provide up to $2.3 trillion in support to businesses, states, and local governments. $600 billion in loans will be available for mid-sized businesses with up to 10,000 employees, and $500 billion will be available for states, counties with over 2 million residents, and cities with a population of over 1 million. My administration is also working with Congress to replenish the very successful, incredibly successful, the way it's going, Paycheck Protection Program, which is allowing hundreds of thousands of small businesses to keep their workers on the payroll, meaning it'll keep those businesses open. We need both Democrats and Republicans to come together to get this the legislation completed, and it looks like it's on its way, but we need both. And it should be for people that are working, for the workers. And if you look and you see, we have a lot of people that are affected by that, and it's a very positive development. So we have to get a bipartisan approval of that, and hopefully that'll happen today. The Department of Education is also announcing the availability of more than $6 billion in emergency grant funding to assist college students impacted by the cancellation of classes and the suspension of housing. A lot of people had a lot of things suspended. Housing is one of them. Previously, we waived student loan payments for 6 months. So student loan payments have been waived for 6 months. So we'll discuss it after that. Maybe go further. Although this medical war has separated our citizens for a period of time, it's also united our entire nation. I think I can say, like almost never before, Americans are moving forward with common purpose and shared resolve, determined to vanquish the virus and lift our nation to even greater heights. We are supremely confident in the magnificent future that awaits the American people. And with that, before I invite our Vice President, our great Vice President, and Gene Scalia to speak, we'll take a few questions, and then I'm going back into negotiations on oil and on airlines. Yeah, please.
conversation with President Putin and the King.
Yeah, I had a very good conversation.
Did you organize that call? And do they understand the problems they're causing with
Yeah,
the oil output?
yeah. No, there's so much production, nobody even knows what to do with it. That's how it's working. And Saudi Arabia and, as you know, Russia, it's well known that we're producing a lot, and they were perhaps fighting with each other over the production and the amount of oil being produced. And frankly, there's not enough room to even store it. Our storage is now full, going to be very soon. Our strategic national storage is, I said, this is a great time to fill it up, load it up with oil that frankly is at pricing that nobody's ever seen before. I don't think we've seen this probably since the 1950s. That was with big dollars. So we'll see what happens. The conversation was very good. They're getting close to a deal. That's OPEC and many other countries outside of OPEC, and we'll see what happens. No, I think they were getting along very well. We had a very good call. I think it was a very good call. We're going to see what happens, but it was a very good call. They'll probably announce something either today or tomorrow, one way or the other. Could be good, could be not so good, but I think one way or the other. Go ahead, Jim.
Yeah, Mr. President, how can the administration discuss the possibility of reopening the country when the administration does not have an adequate nationwide testing system for this virus? Don't you need a nationwide testing system for the virus before you reopen?
We have a great testing system. We have the best, right now, the best testing system in the world. But there are certain sections. There are certain sections in the country that are in phenomenal shape already. Other sections are coming online. Other sections are going down. And we, in addition to that, are giving out millions of tests. And every day we're doing it exponentially. We're picking up. And what we'll be doing in the very near future is going to certain areas of our country and do massive testing. It's not necessary, but it would be a good thing to have.
You need that, though, Mr. President, to make sure people are safe going back to work. You don't want to send people back to the workplace.
We want to have it, and we're going to see if we have it. Do you need it? No. Is it a nice thing to do? Yes. We're talking about 325 million people, and that's not going to happen, as you can imagine. And no, it would never happen with anyone else either. Other countries do it, but they do it in a limited form. We'll probably be the leader of the pack. Please.
What do you say to the 16 million Americans, more than 16 million Americans who have lost their jobs in the last 3 weeks, in fear that the economy won't just bounce back, like you said?
Well, I think the economy is going to do very well. Now, that's just my feeling. It's a strong feeling. I've had good, proper feelings about a lot of things over the years, and I think we're going to do well. We're doing it looks like we're at the lower end of the curve in terms of death, which is a terrible word, a terrible dark word that we've experienced like nobody's ever seen before in this country. I mean, we have numbers that are terrible, but when you look at the lower levels of 100, lower prediction levels of 100, 120,000 to 220,000, or if we did nothing, up to 2.2 million people, we're looking at a much lower level than the level of, I hope, than the level of 100,000. So we're going to see. We're going to have to, you can never do anything about the people that lost their loved ones and lost their friends, and I mean the great friendships, and I'm not sure a lot of people will ever be the same, but I think our country from an economic standpoint will end up being stronger than ever. We have tremendous stimulus. We have tremendous stimulus plans. We have things in the works that are going to really, I think, fire the country. I think that what's going to happen is we're going to have a big bounce rather than a small bounce. But we will be back, and I think, honestly, I think our country's going to be back from an economic standpoint. Again, you can never replace the people that were lost, and to their families, certainly you can never do a thing like that. But we will have succeeded in many ways, hopefully keeping the number way below our minimum numbers, and also from an economic standpoint. You know, we met with the mental health people today, and that takes this has taken a tremendous toll mentally on a lot of people. And I think we're going to open up strong. I think we're going to open up very successfully. And I'd like to say even more successfully than before. Please.
Thank you, Mr. President. Oil is trading today at about $23 a barrel in New York. Where would you want to see the price? Do you want it at $30, $40, $50 a barrel?
Well, I want to see it where there's a certain market, but I also don't want to see it where people have no idea. We'll be opening up areas for storage of oil, massive areas for storage of oil, because oil today is not selling. And what happened is the virus knocked out 40% of the market. Immediately, you know that, you know the number, 40%. Now, there was a lot of oil, but it was very controllable. All of a sudden, they lost 40%. You look at the roads, you look at the car, you look at what's going on. There's nobody driving. There's no reason for it right now. That'll start coming back. But we are storing millions of barrels of oil that nobody thought would even be possible. Frankly, ships turned out to be a good business for some people because they're filling up tankers, sending them out to sea and not saying where to go. They're just sitting out there loaded up with oil. So we want to save our energy in this country. We want to make sure that our energy companies, businesses, and employees, workers, remain strong. So that's how I'm involved. And I think that's going to happen. So right now, if you look, you're probably talking 23, 25. If they announce a deal, we can get it up. We need a minimum number so the companies don't go out of business. So they're not going to lay off all of these energy workers who are important to our country. And, we're now energy independent. We could do something where we only used our oil. But I think the long-term benefit is to be able to just go with the market. And it's going to work out. It's all going to work out. If you looked at 3 weeks ago, as you know, as we talked about it, 3 weeks ago and 2 weeks ago, this was catastrophic. I think it's really hitting bottom, and I think that, we've had a bottom, but now at $23 and $25 and probably heading up. At the same time, we save our energy, and we also produce great, cheap energy, and we save our jobs. Yeah.
I want to ask you about the Paycheck Protection Program, because every day we're hearing from small business owners who are telling us that their banks don't know how to access this money. They're trying to apply. They can't figure it out. So where does the fault lie? Does it lie with the banks?
I don't think there's a fault. They're doing record numbers of dollars. They're dealing with many community banks. They're dealing with Bank of America, Citibank, a lot of Wells Fargo, as you know, is very much involved. And they're dealing with the bankers. Can't go that quickly, but I'm hearing it's a very, very successful rollout. They did want changes in applications. They want changes in loan requirements, etc. But they're taking billions and billions of dollars worth of loans. And in the very near future, the banks will be relieving the money. They'll be paying out the money. Yeah, please.
Sure. Are you still expecting the USMCA to take effect on July 1st? And considering the fact that the auto industry is hurting these days, are you ready to postpone the...
Well, we have a deal. Yeah, the deal is with Canada. The deal is with Mexico. We have a deal. And obviously the deal is different from the standpoint that production will be lower. But we have a deal. It's a signed deal. It's a deal that's one of the worst deals that we've ever had was NAFTA, one of the worst trade deals ever made by any country anywhere. We'll be terminating that. And the new deal is a great deal for our country. So that's something. Now, again, we get hit by the virus, and we'll see where that all goes. But certainly car production is going to be down for a little while. But ultimately, good for our farmers, great for our farmers. We'll be helping our farmers, by the way. We have money going out to our farmers in the pretty near future having to do with, you see what's happened. The farmers got hurt very badly by all of this. People are eating less from the standpoint that there's no restaurants are open, no businesses are open, no hotels are open. They'll start to come back. But we're going to be helping out our farmers. Yeah, please.
Go ahead.
Thank you, sir. Philip Wegman, Real Clear Politics. Earlier you mentioned Project Skybridge, and we're hearing that through that project, a lot of the PPE that was sent out to other countries is coming back to this country. Do you know when we'll be able to bring a majority of that back? And then are you frustrated that USAID allowed a lot of that aid to go out the door in the first place? Should they have brought it back?
No, I'm not, because we're in very good shape. You'll be speaking with Mike Pence about this in a little while. You look at the hospitals, you look at what's going on. Yesterday I spoke with the governor of Louisiana. I'm saying, do you think we need that extra 1,000 beds that we're in the process of building? We are really in good shape. You're not hearing people are needing ventilators much. In fact, we're going to start helping other countries with ventilators. We're going to end up having a lot of ventilators for future should something happen for hospitals, ideally to keep and have. But no, I think we're in very, very good shape. We have calls with governors all the time, and the governors are in very good shape now. We have helped. We have sent billions and billions and billions of dollars between ventilators, equipment, protective equipment, masks. We have 500 million masks coming. 500 million from one group. 500. It'll be 300 million and 200 million over a short period of time. No, I think we're in very good shape. Please.
President, speaking of testing, some experts, including Scott Gottlieb, have talked about 750,000 tests per week being needed before the economy is opened. Can you address that? Do you agree with those numbers? If not, how many tests per week do you think we should have before the economy is open?
I don't like using the word needed because I don't think it's needed, but I think we're going to try and hit a number like that. That's a very high number, but we're going to be trying to hit it. And we probably might be able to do that. Please, go ahead.
You approve that, sir?
Go ahead, please.
Thank you, Mr. President. Today, the Democrats pushed for more rescue money for states and hospitals, which are complaining that they need it to fight the coronavirus pandemic. Do you think hospitals and states need this money? Would you support
I do, and I do support something, but I support it for the next phase. It's much simpler in the next phase, whether that phase is infrastructure or whatever. So I'm going to leave you now with Mike Pence and with Eugene Scalia, and if you would, I look forward to seeing you tomorrow. We'll see you tomorrow. We have I think a lot of very big news to report. We've had a tremendous day between, I believe, what's happening with the energy industry, and I believe what's happening with airlines. I look forward to seeing you. Thank you very much, everybody. Thank you.
Well, good afternoon, everyone. At the present moment, we have now cleared more than 2 million tests across the country. And I'm pleased to report we're testing more than 100,000 people a day now. But we're working around the clock to scale up the new types of tests that the FDA has approved in record time. And every American can be confident that we'll continue to build out that structure going forward for the weeks ahead and the months ahead. At the present moment, there's more than 450,000 Americans who have tested positive for the coronavirus, and sadly, more than 16,000 Americans have lost their lives. And as President Trump just said, our hearts go out to the families that have lost loved ones. And I want to assure you that all of us working at every level understand these are not numbers, these are lives. And our heartfelt condolences during this heartbreaking week go out to every American family that's lost a loved one to the coronavirus. It has been a difficult week, but as Dr. Birx will reflect in just a few moments, as we look at the data literally on a county-by-county basis every day, we continue to see evidence that in areas where the epidemic has impacted most, the greater New York City area, Louisiana, the Detroit metro, the Denver metro, we continue to see evidence of stabilization. And it appears, as Dr. Birx suggests, that we are close to the peak in each of those areas so impacted. We also express gratitude and appreciation for the people of California and Washington State, who continue to be low and steady in the number of cases that are emerging there. We're watching the Chicago metro area, we're watching the Boston metro area, and as Dr. Birx will discuss, we just continue to urge every American to put into practice the President's coronavirus guidelines, because all evidence indicates from the West Coast to what we're beginning to see in major outbreak areas on the East Coast. It's working, America. And it's working because you're doing it. And we encourage you onward in that. Today, the White House Coronavirus Task Force met, but most of the team also met with Republicans and Democrats in two separate conference calls of the United States Senate. Secretary Mnuchin, our health experts, Admiral Polovchek, Dr. Hahn joined us as we discussed a broad range of issues. The Treasury Secretary touched on The Paycheck Protection Program now in day 5, reporting $125 billion has been approved so far. 30,000 new individual users and 3,900 lenders are participating. We also discussed that the Treasury Department will issue a new frequently asked question document tonight, an FAQ as they're known, to clarify how seasonal businesses can participate in the Paycheck Protection Program as well. With regard to direct payments to Americans, the Treasury Secretary assured senators, and we assure every American, that we remain on the timetable where the first payments in direct deposits will go out by the end of next week. For the average family of 4, that'll be $3,400 in direct financial support, and will no doubt be welcome news. Anyone who is interested in additional information on any of these programs can go to treasury.gov or sba.gov. Since we last spoke, I spoke with Governor Laura Kelly of Kansas, Governor Andy Beshear of Kentucky, also spoke to governors of Texas and Rhode Island. I assured each one of them, as we continue to work through the process of making sure that we distribute the resources at the point of the need, is that at President Trump's direction, our objective working through FEMA is to make sure that states have what they need when they need it. And to see the progress that we've made, the President just reflected on in New York and New Jersey, Louisiana, and the partnership we forged with governors in those states, California and Washington State before. We trust gives confidence to governors and leaders of states across the country, most importantly our dedicated healthcare workers, that we will be there to meet that need should that need arise. At the present moment, FEMA reports the President has approved 54 major disaster declarations, and states around the country have stood up 29,000 National Guard, 11,000 of which are fully funded by the federal government under Title 32. Also, speaking of our military, at the present moment, we received a report today from the Department of Defense that 4,100 active duty military medical personnel have been deployed in New York, New Jersey, and Connecticut. And they are personnel that are working on the ground at the Javits Center, working, of course, at the USNS Comfort ship. But because at the present moment, the utilization of both of those temporary facilities has been fairly modest. The DOD actually worked with the city of New York to establish what amounts to a uniform temp service. They called it the bullpen. And today they literally deployed from the ship and from the Javits Center 75 medical personnel to relieve dedicated healthcare workers within the hospital system in the city of New York, and we'll continue to do that. We're going to make sure those federal temporary hospital and Javits Center is fully staffed. We'll make sure the USNS Comfort is staffed, but the physicians, those military personnel, are going to also be deployed across the city to bring much needed relief to our healthcare workers in our system. From the VA standpoint, we've opened up VA facilities in New York City, East Orange, New Jersey, Detroit, Michigan, and we are opening up the VA facility to coronavirus patients in Shreveport, Louisiana. Finally, I mentioned that today we exceeded more than 2 million tests that have been performed across the country. And also, literally, working with the U.S. Public Health Service, states around the country have stood up hundreds of drive-through testing sites. And just this week, FEMA and the U.S. Public Health Service announced that we will give an option to states to transition from a federal testing site, dozens of which have been assembled around the country, to a state-managed site. I want to emphasize that this is an option. We believe it gives states greater flexibility to style sites or manage sites in areas that they think are most important. But we're also processing requests for continued federal participation in states from New Jersey to Louisiana to Illinois, Colorado, and Texas. And we want to assure people in communities all across the country that we'll continue to partner with states to the extent that they prefer us to be a part of it. With regard to the air bridge, 3 flights were scheduled to arrive today In Chicago, New York, and Dallas-Fort Worth, 49 flights are scheduled over the next 3 days. And we continue to work supplies. We continue to literally leave no stone unturned around America and around the world. We're literally in the process of acquiring tens of millions of supplies that are being brought into a distribution system organized out of FEMA and focused on the areas most in need. We're also bringing real innovation, and at the White House Coronavirus Task Force today, we tasked the FDA and CMS to review the feasibility of allowing hospital workers to use cloth gowns for performing procedures. It was observed that 20 years ago, most physicians and most surgeons wore cloth gowns every day and laundered them, but it's transitioned to disposable gowns, and we're working very rapidly in the next 24 hours, and we'll have guidance for hospitals and healthcare workers about the ability to in effect recycle gowns and make sure that we have the supplies that we need. As the President mentioned today, the President and the First Lady and I and my wife Karen were honored to be a part of a conference call with mental health professionals from all around the country. And we know while there are families that are struggling with the coronavirus and struggling with heartbreaking loss to the coronavirus, we understand this is a very challenging time for every American, but most especially Americans who struggle with mental disorders or struggle with addiction. And the President brought some incredibly dedicated people together to make sure that they know we're with them. Early on, the President expanded access to telemedicine, and we've also issued guidance for using technology to remain connected to social support groups. And we just urge everyone who may be feeling an emotional burden or a vulnerability during this time to reach out to the many resources that are there and to know that you're not alone, that we're with you, and we'll get through this, and we'll get through this together. So despite heartbreaking losses that continue this week in communities from New York to New Jersey to Louisiana, there are signs of progress and hope abounds. The reality is that we see new projections from the experts. And if the projections are right, it's because it's working, America. It's because the American people are putting into practice the social distancing, caring for their neighbors and their loved ones and their family members, and putting their health first. And we just want to urge every American to continue to put those principles and guidelines into practice every day. With that, I'm going to invite Dr. Deborah Birx up for an update, and Dr. Fauci will hear from the Secretary of Labor, and we'll take a few questions.
Thank you, Mr. Vice President. So I wanted to cover today not only what we're seeing across the United States, but some of the testing data to assure from the prior question, if we're testing, I'm sure you're following our numbers every day, and the amount we're going up, about 108,000 to 120,000 per day are being tested. So we're way over the 750,000 per week currently. We have some statistics. Now remember, we required this, thanks to Congress, to be reported. We have about 75% of that test data in now. About 1.5 million of those tests have been reported in. I just wanted to give you some ideas because sometimes we think that we're only testing in the hospitals, so this should give you an idea of the quantity and the types of tests that have occurred. So we've tested over 200,000 young people up to age 25. They have about 11% positivity rate. Over 500,000 people between 25 and 45. They have a 17% positive rate. Now remember, in order to get tested, you have to have symptoms. So this gives you an idea of the number of people who have symptoms that are not infected with coronavirus. Another nearly 500,000 people between 45 and 65, their positivity rate is 21%. Another nearly 200,000 between 65 and 85, 22% positive, and a small group of about 30,000+ individuals over 85, and they have a 24% positivity rate. And so this gives you an idea of we're testing throughout all age categories. I see a lot of men in the audience today. I just want to remind them about the importance of healthcare. Of the male-female ratio, 56% of the people who are tested are female, 16% positive, 44% male, 23% positive. So again, it gives you an idea about how men often don't present in the healthcare delivery system until they have greater symptomatology. This is to all of our men out there, no matter what age group. If you have symptoms, you should be tested and make sure that you are tested. We appreciate you engaging in that, and also really recognizing the issues about comorbidities and making sure that we're addressing those. I had a series of great calls with about 17 states that are in our more rural areas, specifically around our indigenous people and tribal nations. It was a very reassuring call, and we are testing across the country. We do have about 63% of states that have less than 10% positive despite significant testing. And within the indigenous peoples and tribal nations, they're seeing the same thing that we're seeing across the nation. Increased issues among those with comorbidities and those of elderly, but also issues in nursing homes. And so they are testing, many of these states are still capable of doing full contact tracing. And so they've been doing contact tracing from nursing home outbreaks and other outbreaks. It really gives us a clear impression of no matter what we do in the future, we need to really ensure that nursing homes have sentinel surveillance. And what do I mean by that? That we're actively testing in nursing homes, both the residents and the workers at all times. That is where, and that's how we saw this at the beginning. That's what we saw in Washington State. And that's what we're seeing in many of the states that have very low case attack rates. The other thing that I want to leave you with, we certainly know how desperate and difficult the situation has been in New York over the last few weeks. And we've been telling and talking about how this would be the week that would be most difficult because of the large proportion of cases that are coming from the New York metro area. What's been encouraging to us, those early states outside of Washington and California, which still have extraordinarily low attack rates because of their level of mitigation, all of the new areas that are having new increasing cases, we talked about them yesterday, Washington and Baltimore and the Philadelphia metro area. That includes Camden, Wilmington, and the counties around Philadelphia. We're seeing that the case numbers, what we'll get to as far as attack rates, we talked about 1 in 7 in 1,000 in New York that are being measured. These are coming in, even with their progress up their curve, in the 1 to 2 per 1,000 range, showing that when you start mitigation early, it has a very different impact. All of this data is coming together, the testing rates, the seropositivity, the age groups, who really needs hospitalization, ICU, the innovative pieces coming from, we heard a great report from Louisiana this morning on the phone call where they talked about a minimum now of 40% of people coming off of ventilators alive and leaving the hospital. This is very encouraging to us. Really shows amazing progress clinically at each of these hospitals and the real lessons what we're learning and sharing across hospitals. But really shows us that the original outbreaks were very large, but the newer ones that we talk about in Washington and Philadelphia and Baltimore, it looks like their attack rates and the attack rates in Denver and some of these other states that we have been talking about are much lower than New York and New Jersey. And this gives us hope about really understanding how to integrate this information together, not dealing with a model, but the real life cases that are occurring and understanding how to move forward together to really have a different future. So thank you very much.
Thank you very much, Mr. Vice President.
So just reflecting about what we've been doing over the last few days. Remember last weekend when we made the forecast that this would really be a bad week? As I mentioned yesterday and the day before, it is, in the sense of deaths, a bad week. In fact, every day there seems to be a record of number of deaths compared to the day before. In fact, New York today had, again, another record of, I think the city itself was about 820 plus deaths. But what we were predicting with the increase and the real adherence to the physical separation, the guidelines that the Vice President talks about, the physical separation, at the same time as we're seeing the increase in deaths, we're seeing rather dramatic decrease in the need for hospitalizations. Like I think yesterday it was something like 200 new hospitalizations, and it's been as high as 1,400 at any given time. So that is going in the right direction. I say that, and I always remind myself when I say that, that means that what we are doing is working, and therefore we need to continue to do it. I know I sound like a broken record. That's good. I want to sound like a broken record. Let's just keep doing it. I get questions a lot, Dr. Birx and I, about these numbers, the projections that you went from 100,000, 200,000, now down to 60,000. That's a sign that when, as I keep saying, when you take the data you have and you reinsert it into the model modifies. Data is real, model is hypothesis, okay? So that's what you have to do, and that's what I think we're seeing. The other thing that's some just broad general good news from the standpoint of a scientific standpoint, that there are a lot of candidate potential therapeutics that are going into clinical trials now that we're sponsoring at the NIH. The kinds of clinical trials that will give us the answer. Are they safe? Are they effective? And just what is the capability of using them under what circumstances? As prophylaxis, as treatment, in early disease, in late disease. So as the time goes by and we have the public health measures to try and contain this, we're doing an awful lot from a scientific standpoint so that when we do get to next year, next fall, next winter, hopefully we'll have something that we can offer in addition to the very important public health measures. So I'll be happy to answer questions later. Secretary.
Mr. Vice President, thank you, and thanks to the task force, and of course thanks to the President for his leadership. The important public health measures that have been discussed so much in these briefings in this room have had a large impact in American workplaces. We saw that again today as the Labor Department released figures showing that 6.6 million new unemployment claims were filed last week. We're all mindful, the President mentioned this, that the American people are making difficult sacrifices. That has included being furloughed, laid off, or having a small business struggle. That said, American workers can be encouraged by how swiftly and comprehensively the President and Congress have responded. 3 weeks ago, the U.S. had never had a law requiring paid sick leave at U.S. companies. But 3 weeks ago, the President signed the Families First Coronavirus Response Act, which did provide paid sick leave, as well as expanded family and medical leave for employees at small businesses, with those small businesses being reimbursed dollar for dollar for having provided that leave. Last week, we at the Labor Department issued rules to implement these leave requirements of the Families First Act, and we've been in near constant contact with employers and employees to help them understand the law, and in a number of cases already, to help workers get the leave that they were entitled to. Another unprecedented benefit for workers was provided in the CARES Act less than 2 weeks ago. That law, as you know, includes a $600 a week plus-up to unemployment benefits that are provided by the states. We have millions of unemployed Americans who are making a sacrifice for our national well-being. These bonus payments, and they're unprecedented, the government has never provided a plus-up unemployment payment like this. These payments are intended to make those workers whole as near we can. This temporary benefit is available not just to employees, but also to the self-employed and gig economy workers. Before the President signed the CARES Act, gig workers independent contractors were not available for unemployment compensation. Today they are. At the department, our team has worked day and night to enable states to make this benefit available. I'm pleased that a number of states are now making those $600 additional weekly payments. More states will follow in the coming days. How long it takes will vary by states. Some states' systems will take longer, but we at the department will continue to support them. We have already dispersed $500 million to states to help them with their systems and making these payments. We have another $500 million that we're ready to release. And for workers who don't get this benefit when it's first due them, states will be able to catch them up later when their computer systems are able to make these payments. Let me add that we're also mindful at the Labor Department that many Americans remain in the workplace, including on the front lines in our hospitals, as well as our emergency responders. My department's Occupational Safety and Health Administration, or OSHA, has been providing guidance to employers and employees on coronavirus since the early days of this health emergency. We are fielding and responding to calls from workers worried about their health, and sometimes from workers who believe they've been illegally disciplined by their employer for expressing health concerns. We will not tolerate retaliation. OSHA will continue to work with workers and employers to keep workplaces safe, using all the tools available to us, including enforcement if needed. I wanted to finish by commenting on the Paycheck Protection Program, which we heard about earlier, run by the Small Business Administration. This, of course, is loans to small businesses to enable them to meet certain costs, including utilities, rent, and, most important from my perspective, payroll. As you know, if these companies receiving the loans keep their workers on payroll, these loans are largely forgivable. Here's why that program is so important from my perspective. We're seeing unemployment filings right now of the like that we've never seen before. But these numbers aren't the result of an underlying weakness to our economy. Our economy has been vibrant, incredibly strong just weeks ago. If, as we've heard again today, if we are disciplined now and adhere carefully to the guidance being provided by health authorities, we'll get that economy back. The President spoke at the State of the Union of the blue-collar boom we are experiencing. We want to lay the groundwork now for a blue-collar bounce back. We'll get there in part by helping companies hold on to their workers, which is what the Paycheck Protection Program does. Keep them on payroll so that when businesses are ready to reopen, they have the workers they need and Americans have jobs. We will continue at the department, and I know here at the White House, to be laser focused on American workers and jobs until this is done. So thank you very much.
Very well done. Thank you. Great job. Great. We'll take a few questions. Yes, please.
Mr. Vice President, a question for you and then a question for Dr. Birx or Dr. Fauci. Just to clarify, on the federal funding for testing sites in the states, are you saying that federal funding will remain for those sites and will it remain at its current levels?
It's not merely federal funding, but in many cases we provided personnel from the U.S. Public Health Service and also flowed supplies, personal protective equipment that was required for some of the early forms of testing, but it's less required today with new formats for testing. It is an option, and as I've made clear to several governors, we'll continue to partner with our states. But I have to tell you that the way states step forward with the concept of drive-through and community-based testing is really inspiring. For our part, working with FEMA and our great team at U.S. Public Health Service, we've stood up nearly 50 different drive-through test sites around the country, but literally there are hundreds that have been deployed by states and by hospitals and local healthcare providers. But in this instance, we wanted to at least give them the option to take control of that, but we'll continue to resource them with personnel, supplies, and any other support that they need going forward. And
just a question for the doctors. I'm curious, did you see this information out of the CDC in South Korea today that shows that they're seeing evidence of reinfection in some people who had been cured of coronavirus? And what does that mean for our understanding of this?
I'm not aware of what you're speaking about now, but clearly there have been anecdotal mentioning of what appeared to be reinfection. You have to really be very careful when you say reinfection, because and we were dealing with this with even Ebola back during the Ebola time, that someone might still, when someone does a test on them, do a PCR on a body fluid of some sort and be able to detect what are likely nucleotides that are not replication competent. So if you're telling me, which I don't think they're saying, that someone has coronavirus disease, they get sick, it's documented, they get better, and then a month or so later, they get sick with documented coronavirus disease. I don't think that's what they're saying, but I don't want to jump the gun on it until I see the data.
They use the word reactivate. Is that different?
Yeah. Well, yeah, what reactivating what means is that it depends what you mean by reactivating. If someone clearly is ill and they have virus isolated from them, that you may have a prolonged course. I'd like to see how long they reactivate. I mean, if they were sick and had documented virus, and then 3 months later they had documented virus, is that reactivation or is that infection with another virus? I'd like to see the data before I really comment on that.
Dr. Fauci, I wanted to ask about medical criteria. You had a discussion with Dr. Birx and the other public health experts on Tuesday, I understand. Can you discuss what is the medical criteria that you guys are discussing in order to reopen the government? What is the medical criteria?
Well, it's less medical criteria than it is public health criteria. And that is, and I think it's really important because often people say reopen the government like it's a light switch that goes on and off for the entire country. We have a very large country with really different patterns of disease and outbreaks in different parts of the country. So it's not going to be a one-size-fits-all. It's going to be, what is the kinetics of an outbreak? Is it on the way down? Is it essentially out? Is it still smoldering and possibly going up? I think you're going to have to take it individually. And
benchmarks that you're looking at, though? I mean, are there some numbers that you're looking at, some data that you would like to see? What would you like to see before that happens?
Yeah, well, I will allow Dr. Birx to come up with just my own opinion. I don't think they're going to be benchmarks that are going to be consistent from one to the other. For example, I would not want to pull back at all in New York until I was clear that that curve really was doing what we've seen in other countries, a very steep decline down, and we had the capability, if there was a resurgence, of having everything in place to be able to do the containment as opposed to struggling with mitigation with what we've been doing. That's different than a relatively smaller city, town, or whatever you, in the Midwest or mountain regions, which is generally very well controlled. What I would want to see, do we have the capability of doing the isolation, contact tracing, and suppression of it? So it really varies differently. So I don't think there's one medical criteria. But Deb, if you want to speak to it.
Thank you. So it's what I tried to cover in the brief presentation I gave. In talking to the 17 states that have indigenous populations and tribal nations, and discussing with them what they were doing generally and what they were doing specifically through the Indian Health Service, they discussed the ability to find new cases and doing full contact tracing. And so they have strike teams. They are very well organized. You don't hear about them every day, and that's why I wanted to call them out. They're really doing amazing work at their public health institutions with their governors and their mayors, and they are in full contact tracing. Yes, they're doing social distancing, but they're also doing full contact tracing and understanding all aspects of their epidemic. So we're looking at those pieces, as well as when I was talking about blunting, really when you're starting to go up that curve, having that unbelievable blunting where you only get evident attack rates. And I want to be very clear about that. When we see cases, these are symptomatics that have been diagnosed. There's clearly, we believe, people we don't see. And that's why the antibody test is going to be helpful to us to really define that. So those are the pieces that we're bringing together to really analyze that. I did want to say the president talks about the 100 and 50 plus countries that are experience what we're experiencing. I just wanted to do a call out. We have Americans around the world in every embassy that are working with those countries now. This scarf came from Africa. It's one of my public health colleagues there. I just want to recognize the public health colleagues around the world who are doing all of this work together to change the course in their epidemics in every single country around the globe.
Let me go to another question if I can, but in response to that, just so you know, what the President's tasked us to do is there's a number of working groups and that are looking at not only how do we reopen the country, but how do we stay open. And I think most of America knows that no one wants to reopen America more than President Donald Trump. But the President's told us we need to do it responsibly, and we're going to follow the data. We're literally following the data on a county-by-county basis. This morning, we were literally presented with information of each county that had more than 100 new cases and had, it went in the other direction, had, less than 100 than the day before. It's really remarkable. And so I think what you hear the health experts saying will inform the President's decision and timing. But make no mistake about it, that the best thing we can do to reopen America is put the coronavirus behind us, to reach the end of that curve with as little loss of life or hardship as possible, to have in place, that we soon believe we will, the kind of therapeutics, I call them medicines that make you feel better, by this summer, and to have more widespread testing that we're scaling up each and every day, and also to have the kind of guidance that the CDC is even now developing for businesses large and small, for families and for schools, for that day that we do reopen America. Question? Go ahead.
I'm going to ask one more follow-up to the doctor. So it touches on this question of when to lean back on mitigation. There is a study out of Los Alamos this week that I hope you've seen. It's on the CDC website. It looks at this question of R0, which is a technical term that you understand that has to do with the reproductive rate of the virus. The study shows that the R0 for coronavirus isn't between 2 and 3, as had been thought before, but it's actually closer to 6, which means that one person on average is infecting 6 others. So with this information, how does that impact the model? How can you begin to think about when to reopen society if it's more contagious than we thought before?
Well, I can tell you as the layperson on the stage, we have known from the beginning that this is at least 3 times more contagious than the flu. And I believe that fact alone has informed our projections and the modeling, but now I'll let the experts respond.
Quickly, and then we'll tag team together. So when we've been talking about the asymptomatic group, and that's why I gave you that testing data where 11% of young people under 25 were positive, many of them very low-grade symptoms. What we will be triangulating for you is the testing data with hospital admissions, and then you'll be able to start seeing spectrum of disease. Because what you're not seeing in spectrum of disease is people who never even think that this is something significant, that what they have. We're seeing the significant cases. In testing, you can see that we're getting a lot of people in with symptoms aren't positive. And so really finding out what is the R0. Is it 6? Is it 5? And the only way to do that at this point right now is to get the antibodies out there and go into these places that had significant disease. When we talk about attack rates of 7 per 1,000 like New York and 5 per 1,000 in New Jersey, and test the healthcare workers, the first responders, all of the nursing homes for antibody, and really get to your question. Because right now it's still theoretic. We understand they're modeling this, and we will get the data to actually look at that. You will see what others have been presenting. So you presented the 6. What others are presenting, importantly, is they're modeling what's happening with mitigation. And they're publishing that the R0 with mitigation is approaching like 1.3 and 1.5. So think of what that is. If it was 6, and then with mitigation, we have it into the 1s, that really shows the power of the American people. No one has varied R0s like that without a vaccine. But this is what's happening with really the power of the American people, Tony.
Ditto to everything that Dr. Birx said, but I couldn't help but thinking when you talk about, you know what the worst enemy of an R0 is? Physical separation.
How about one more? One more. Go right ahead.
Testing capacity in the country right now to reopen in the foreseeable future? I mean, because the president talked about 2 million tests. Are we going to have the testing capacity needed to make Americans feel comfortable going back into their workplaces? I mean, it seems to me that is a pretty critical question at this point. People are not going to want to go back to work if they think their coworkers might be carrying the virus. If we're not testing enough, how do we know it's safe to go back?
Well, I think the American people see the incredible progress that's been made after President Trump brought in the largest commercial labs in the world to scale testing, the likes of which we've seen. We are, as Dr. Birx said, well over 100,000 Americans being tested every single day. We have an antibody test that is coming online. Abbott Laboratories literally has thousands of machines across the country. We're working with hospitals and labs around the country to activate those machines for the 15-minute test.
Do we have enough testing right now?
Well, let me say we're moving every day toward meeting that moment. But let's be clear: reopening the country, as the president is very anxious to do at the earliest responsible moment, will be through a combination of facts. First would be that we are at the end of the coronavirus for most major communities. Another piece of that is that we have therapeutics for Americans to take medicines if they contract the disease. Another piece of that is guidance from the CDC to public institutions, to businesses large and small, about how to conduct themselves in a safe and a responsible way. And testing is also a piece of that. And as Admiral Joie has reflected, we are spending a great deal of time expanding testing today. Every single day there's more and more tests across the country. But we're also working to scale testing that as we move into this summer and move into the fall, we'll have the testing we need to do what these doctors call not diagnostic testing, which is to take a test of a person that has symptoms, but surveillance testing, so we can identify people that may have had it and may be immune, versus people people that we just need to know whether or not they were ever exposed or and were not exposed. How about one more quick question here, if I can? I think he had one right here, or I'll go to you in the back.
Thank you, Mr. Vice President. In the next few weeks, the Supreme Court is set to rule on DACA and on the Deferred Action for Childhood Arrival, and about 30,000 of those people who are under that program are frontline healthcare workers. Is the administration in any way ready to protect them if the ruling comes in your favor and takes the protection out and they can no longer work in the health field as they're needed right now?
Well, I think the president's been very clear on his desire to reach a solution on that issue with the Congress. But let me say, whether it be healthcare workers or people working in food supply, other people working in critical infrastructure, we're incredibly inspired by the way people across this country are stepping up to keep healthcare rolling and available. A high quality of care, even in areas deeply impacted by the coronavirus. And also, as we said the other day, hardworking people in our food supply, from the farmers to processors, to distributors, to truck drivers, to grocers. We received a good word that over the last several days, we've actually seen a significant drop with one major company in absenteeism. We issued new guidance from the CDC about how people who may have been within close proximity to someone who had the coronavirus could return to work before the 14 days if they didn't have a fever, if they tested themselves twice a day and returned with a mask. But the dedication of people to continue to work is truly inspiring. And I know as we go forward, we'll work through a broad range of national issues, but we're going to be incredibly proud for a long time about the way people all across this country responded to this moment. So thank you all very much. We'll see you tomorrow.
from NBC News. Decision 2016, the first presidential debate. Live from Hofstra University in Hempstead, New York. Here now, Savannah Guthrie and Chuck Todd.
And good evening, everybody. Nice to have you with us, Chuck. After all the hype, all the prep, all the pre-debate gamesmanship from both campaigns, this is it. We are literally just minutes away now from the start of this first and all-important presidential debate on the stage behind us. We've already seen the candidates tonight, Hillary Clinton and Donald Trump, each arriving here a bit earlier this evening. They're waiting backstage. And Chuck, we've had a moment tonight. Yeah. President Bill Clinton is in the house and met Mrs. Melania Trump, and they just shared that handshake. We've got the whole families assembled here.
We do, and I think one thing we got to remember, as big of personalities that they are, and we know this is going to be a clash of big personalities, this is also a clash of two competing visions of America. Hillary Clinton embracing the many cultural changes, the diversity, the acceleration of globalization that's happening. Donald Trump embracing a vision that says, whoa, let's slow down, let's slow things down, let's look inward a little bit. Let's not let that get lost tonight.
Let's bring in our colleague Tom Brokaw, obviously somebody who's watched a lot of debates, but doesn't this feel like there's something special about this one, if nothing else, because they think maybe 100 million people could be watching?
Yeah, I've never seen one quite like this, in part because of that 100 million people, a lot of them are still trying to make up their minds. This is going to be an important debate. You add to the television viewership, we've got social media going on, the tweeting that is going on, the texting that is going on, the streaming that is going on. This is the biggest electronic event in American history, to say nothing of American presidential politics.
The stakes are so high with the polls tight, as we've seen just as recently as today. Let's go to Andrea Mitchell. Hallie Jackson is in the spin room for us. Hallie, good evening.
Hi, Savannah. And here, media and surrogates are ready for what happens after the debate. But before then, here's Donald Trump's biggest test. Can he prove he has the temperament to be commander-in-chief? It's one of his biggest negatives with voters. Too many insults, and he could come off like a bully. Too few specifics, and he could seem unprepared. Savannah?
All right, Hallie Jackson, thank you.
Let's go to Andrea Mitchell, who's been covering the Clinton campaign. What's Hillary Clinton's goal tonight, Andrea?
Well, her need is to really relate to people, especially those millennial voters. And very frankly, one of her top aides said to me, we're glad we have Donald Trump to debate against because he's the draw. He's drawing 100 million people. And that's the kind of crowd Hillary Clinton has not been able to attract. She now has to sell herself tonight. And Bill Clinton is here. He never attended any of the primary debates.
Sure, thank you. Andrea.
So we are about 30 seconds away now from this debate. Chuck, the stakes are very high, and as I mentioned a bit earlier, the polls are extremely tight.
No, they are, and I do think the audience is very fluid. We do have a whole bunch of people who are either none of the above or undecided. So I think the polls will move after tonight.
Here we have the multi-billionaire, the former First Lady, Secretary of State, and U.S. Senator about to debate. We'll let Lester Holt take it away.
Good evening from Hofstra University in Hempstead, New York. I'm Lester Holt, anchor of NBC Nightly News. I want to welcome you to the first presidential debate. The participants tonight are Donald Trump and Hillary Clinton. This debate is sponsored by the Commission on Presidential Debates, a nonpartisan, nonprofit organization. The commission drafted tonight's format, and the rules have been agreed to by the campaigns. The 90-minute debate is divided into 6 segments, each 50 minutes long. We'll explore 3 topic areas tonight: achieving prosperity, America's direction, and securing America. At the start of each segment, I will ask the same lead-off question to both candidates, and they will each have up to 2 minutes to respond. From that point until the end of the segment, we'll have an open discussion. The questions are mine and have not been shared with the commission or the campaigns. The audience here in the room has agreed to remain silent so that we can focus on what the candidates are saying. I will invite you to applaud, however, at this moment as we welcome the candidates. Democratic nominee for President of the United States, Hillary Clinton, and Republican nominee for President of the United States, Donald J. Trump. Well, I don't expect us to cover all the issues of this campaign tonight, but I remind everyone there are 2 more presidential debates scheduled. We are going to focus on many of the issues that voters tell us are most important, and we're going to press for specifics. I am honored to have this role, but this evening belongs to the candidates and just as important to the American people. Candidates, we look forward to hearing you articulate your policies and your positions, as well as your visions and your values. So, let's begin. We're calling this opening segment Achieving Prosperity, and central to that is jobs. There are two economic realities in America today. There's been a record 6 straight years of job growth, and new census numbers show incomes have increased at a record rate after years of stagnation. However, income inequality remains significant, and nearly half of Americans are living paycheck to paycheck. Beginning with you, Secretary Clinton, why are you a better choice than your opponent to create the kinds of jobs that will put more money into the pockets of American workers?
Well, thank you, Lester, and thanks to Hofstra for hosting us. The central question in this election is really what kind of country we want to be and what kind of future we'll build together. Today is my granddaughter's 2nd birthday, so I think about this a lot. First, we have to build an economy that works for everyone, not just those at the top. That means we need new jobs, good jobs, with rising incomes. I want us to invest in you. I want us to invest in your future. That means jobs in infrastructure, in advanced manufacturing, in innovation and technology, clean renewable energy, and small business, because most of the new jobs will come from small business. We also have to make the economy fairer. That starts with raising the national minimum wage and also guarantee, finally, equal pay for women's work. I also want to see more companies do profit sharing. If you help create the profits, you should be able to share in them, not just the executives at the top. And I want us to do more to support people who are struggling to balance family and work. I've heard from so many of you about the difficult choices you face and the stresses that you're under. So let's have paid family leave, earned sick days. Let's be sure we have affordable childcare and debt-free college. How are we going to do it? We're going to do it by having the wealthy pay their fair share and close the corporate loopholes. Finally, we tonight are on the stage together, Donald Trump and I. Donald, it's good to be with you. We're going to have a debate where we are talking about the important issues facing our country. You have to judge us. Who can shoulder the immense, awesome responsibilities of the presidency? Who can put into action the plans that will make your life better? I hope that I will be able to earn your vote on November 8th.
Secretary Clinton, thank you. Mr. Trump, the same question to you. It's about putting more money into the pockets of American workers. You have up to 2 minutes.
Thank you, Lester. Our jobs are fleeing the country. They're going to Mexico. They're going to many other countries. You look at what China is doing to our country in terms of making our product. They're devaluing their currency, and there's nobody in our government to fight them. And we have a very good fight, and we have a winning fight, because they're using our country as a piggy bank to rebuild China, and many other countries are doing the same thing. So we're losing our good jobs, so many of them. When you look at what's happening in Mexico, a friend of mine who builds plants said it's the 8th wonder of the world. They're building some of the biggest plants anywhere in the world, some of the most sophisticated, some of the best plants. With the United States, as he said, not so much. So Ford is leaving. You see that, their small car division leaving. Thousands of jobs, leaving Michigan, leaving Ohio. They're all leaving, and we can't allow it to happen anymore. As far as child care is concerned and so many other things, I think Hillary and I agree on that. We probably disagree a little bit as to numbers and amounts and what we're going to do, but perhaps we'll be talking about that later. But we have to stop our jobs from being stolen from us. We have to stop our companies from leaving the United States, and with it, firing all of their people. All you have to do is take a look at Carrier Air Conditioning in Indianapolis. They fired 1,400 people. They're going to Mexico. So many, hundreds and hundreds of companies are doing this. We cannot let it happen. Under my plan, I'll be reducing taxes tremendously. from 35% to 15% for companies, small and big businesses. That's going to be a job creator like we haven't seen since Ronald Reagan. It's going to be a beautiful thing to watch. Companies will come, they will build, they will expand, new companies will start, and I look very, very much forward to doing it. We have to renegotiate our trade deals, and we have to stop these countries from stealing our companies and our jobs.
Secretary Clinton, would you like to respond?
Well, I think that trade is an important issue. Of course, we are 5% of the world's population. We have to trade with the other 95%. And we need to have smart, fair trade deals. We also, though, need to have a tax system that rewards work and not just financial transactions. And the kind of plan that Donald has put forth would be trickle-down economics all over again. In fact, it would be the most extreme version, the biggest tax cuts for the top percent of the people in this country than we've ever had. I call it trumped-up trickle-down, because that's exactly what it would be. That is not how we grow the economy. We just have a different view about what's best for growing the economy, how we make investments that will actually produce jobs and rising incomes. I think we come at it from somewhat different perspectives. I understand that. You know, Donald was very fortunate in his life, and that's all to his benefit. He started his business with $14 million borrowed from his father, and he really believes that the more you help wealthy people, the better off we'll be, and that everything will work out from there. I don't buy that. I have a different experience. My father was a small businessman. He worked really hard. He printed drapery fabrics on long tables where he pulled out those fabrics and he went down with a silk screen and dumped the paint in and took the squeegee and kept going. And so what I believe is the more we can do for the middle class, the more we can invest in you, your education, your skills, your future, the better we will be off and the better we'll grow. That's the kind of economy I want us to see again.
Let me follow up with Mr. Trump if I can. You've talked about creating 25 million jobs, and you've promised to bring back millions of jobs for Americans. How are we going to bring back the industries that have left this country for cheaper labor overseas? How specifically are you going to tell American manufacturers that you have to come back?
Well, for one thing, and before we start on that, my father gave me a very small loan in 1975, and I built it into a company that's worth many, many billions of dollars with some of the greatest assets in the world. And I say that only because that's the kind of thinking that our country needs. Our country's in deep trouble. We don't know what we're doing when it comes to devaluations, and all of these countries all over the world, especially China, they're the best ever at it. What they're doing to us is a very, very sad thing. So we have to do that. We have to renegotiate our trade deals. And Lester, they're taking our jobs, they're giving incentives, they're doing things that, frankly, we don't do. Let me give you the example of Mexico. They have a VAT tax. We're in a different system. When we sell into Mexico, there's a tax. When they sell in automatic, 16% approximately. When they sell into us, there's no tax. It's a defective agreement. It's been defective for a long time, many years, but the politicians haven't done anything about it. Now, in all fairness to Secretary Clinton, yes, is that okay? Good. I want you to be very happy. It's very important to me. But in all fairness to Secretary Clinton, when she started talking about this, it was really very recently. She's been doing this for 30 years. And why hasn't she made the agreements better? The NAFTA agreement is defective just because of the tax and many other reasons, but just because of the fact.
Let me interrupt just a moment.
Secretary Clinton and others, politicians, should have been doing this for years, not right now because of the fact that we've created a movement. They should have been doing this for years. What's happened to our jobs and our country and our economy generally is, look, we owe $20 trillion. We cannot do it any longer, Lester.
Back to the question, though, how do you specifically bring back jobs, American manufacturers? How do you make them bring the jobs back?
Well, the first thing you do is don't let the jobs leave. The companies are leaving. I could name, there are thousands of them. They're leaving, and they're leaving in bigger numbers than ever. And what you do is you say, fine, you want to go to Mexico or some other country, good luck. We wish you a lot of luck. But if you think you're going to make your air conditioners or your cars or your cookies or whatever you make and bring them into our country without a tax, you're wrong. And once you say you're going to have to tax them coming in, and our politicians never do this because they have special interests, and the special interests want those companies to leave because in many cases they own the companies. So what I'm saying is we can stop them from leaving. We have to stop them from leaving, and that's a big, big factor.
Let me let Secretary Clinton
Well, let's stop for a second and remember where we were 8 years ago. We had the worst financial crisis, the Great Recession, the worst since the 1930s. That was in large part because of tax policies that slashed taxes on the wealthy, failed to invest in the middle class, took their eyes off of Wall Street, and created a perfect storm. In fact, Donald was one of the people who rooted for the housing crisis. He said back in 2006, gee, I hope it does collapse because then I can go in and buy some and make some money. Well, it did collapse.
That's called business, by the way.
9 million people lost their jobs. 5 million people lost their homes, and $13 trillion in family wealth was wiped out. Now, we have come back from that abyss, and it has not been easy. So we're now on the precipice of having a potentially much better economy, but the last thing we need to do is to go back to the policies that failed us in the first place. Independent experts have looked at what I've proposed and looked at what Donald's proposed, and basically they've said this, that if his tax plan, which would blow up the debt by over $5 trillion and would, in some instances, disadvantage middle-class families compared to the wealthy, were to go into effect, we would lose 3.5 million jobs and maybe have another recession. They've looked at my plans and they've said, okay, if we can do this, and I intend to get it done, we will have 10 million more new jobs because we will be making investments where we can grow the economy. Take clean energy. Some country is going to be the clean energy superpower of the 21st century. Donald thinks that climate change is a hoax perpetrated by the Chinese. I think it's real.
I did not.
Science is real.
I do not say that.
And I think it's important that we grip this and deal with it both at home and abroad. And here's what we can do. We can deploy 500 million more solar panels. We can have enough clean energy to power every home. We can build a new modern electric grid. That's a lot of jobs. That's a lot of new economic activity. So I've tried to be very specific about what we can and should do, and I am determined that we're going to get the economy really moving again, building on the progress we've made over the last 8 years, but never going back to what got us in trouble in the first place.
Mr. Trump.
She talks about solar panels. We invested in a solar company, our country. That was a disaster. They lost plenty of money on that one. Now, look, I'm a great believer in all forms of energy, but we're putting a lot of people out of work. Our energy policies are a disaster. Our country is losing so much in terms of energy, in terms of paying off our debt. You can't do what you're looking to do with $20 trillion in debt. The Obama administration, from the time they've come in, is over 230 years worth of debt, and he's topped it. He's doubled it in a course of almost 8 years, 7.5 years to be semi-exact. So I will tell you this, we have to do a much better job at keeping our jobs, and we have to do a much better job at giving companies incentive to build new companies or to expand, because they're not doing it. And all you have to do is look at Michigan and look at Ohio and look at all of these places where so many of their jobs and their companies are just leaving. They're gone. And Hillary, I just ask you this. You've been doing this for 30 years. Why are you just thinking about these solutions right now? For 30 years you've been doing it, and now you're just starting to think of solutions.
Well, actually,
I will bring back jobs. You can't bring back jobs.
Well, actually, I have thought about this quite a bit.
Yeah, for 30 years.
I have, well, not quite that long. I think my husband did a pretty good job in the 1990s. I think a lot about what worked and how we can make it work again.
Well, he approved
3 million new jobs, a balanced budget,
which is the single worst trade deal ever approved in this country.
Incomes went up for everybody. Manufacturing jobs went up also in the 1990s, if we're actually going to look at the facts. When I was in the Senate, I had a number of trade deals that came before me. And I held them all to the same test. Will they create jobs in America? Will they raise incomes in America? And are they good for our national security? Some of them I voted for. The biggest one, a multinational one known as CAFTA, I voted against. And because I hold the same standards as I look at all of these trade deals. But let's not assume that trade is the only challenge we have in the economy. I think it is a part of it, and I've said what I'm going to do. I'm going to have a special prosecutor. We're going to enforce the trade deals we have, and we're going to hold people accountable. When I was Secretary of State, we actually increased American exports globally 30%. We increased them to China 50%. So I know how to really work to get new jobs and to get exports that help to create more new jobs.
Well, you haven't done it in 30 years or 26 years.
Well, I've been a senator.
You haven't done it.
And
You haven't
I
done it.
have been a
And excuse
Secretary
me,
of State, and I have
Your
done
husband signed
a lot.
NAFTA, which was one of the worst things that ever happened
Well,
to the
that's your
manufacturing
opinion.
industry.
That is your
You go to
opinion.
New England, you go to Ohio, Pennsylvania, you go anywhere you want, Secretary Clinton, and you will see devastation where manufacturing is down 30, 40, sometimes 50%. NAFTA is the worst trade deal maybe ever signed anywhere, but certainly ever signed in this country. And now you want to approve Trans-Pacific Partnership. You were totally in favor of it. Then you heard what I was saying, how bad it is, and you said, I can't win that debate. But you know that if you did win, you would approve that, and that will be almost as bad as NAFTA. Nothing will ever top NAFTA.
That is just not accurate. I was against it once it was finally negotiated and the terms were laid out. I wrote about that in...
You called it the gold standard.
Well, I hope...
You called it the gold standard of trade deals. You said it's the finest deal you've ever seen.
No.
And then you heard what I said about it, and all of a sudden you were against it.
Well, Donald, I know you live in your own reality, but that is not the facts. The facts are, I did say I hoped it would be a good deal, but when it was negotiated, which I was not responsible for, I concluded it wasn't. I wrote about that.
So is it President Obama's fault? Is it President Obama's fault?
Even announced. Look, there are
Secretary, is it President Obama's fault?
There are
because he's pushing it.
There are different views about what's good for our country, our economy, and our leadership in the world. And I think it's important to look at what we need to do to get the economy going again. That's why I said new jobs with rising incomes, investments, not in more tax cuts that would add $5 trillion to the debt.
But you have no plan.
Oh, I do.
Secretary,
in fact,
you
I
have no
written
plan.
A book about it. It's called Stronger Together. You can pick it up
That's
tomorrow.
about all you- Folks,
at
we're
the
gonna-
bookstore or at an airport near you.
We're going to move to...
But it's because I see this. We need to have strong growth, fair growth, sustained growth. We also have to look at how we help families balance the responsibilities at home and the responsibilities at business. So we have a very robust set of plans, and people who have looked at both of our plans have concluded that mine would create 10 million jobs and yours would lose us 3.5 million jobs and explode
You are
the
going
debt,
to approve one of
which
the
would
biggest tax
have
cuts
a
in
recession.
history. You are going to approve one of the biggest tax increases in history. You are going to drive business out. Your regulations are a disaster, and you're going to increase regulations all over the place. And by the way, my tax cut is the biggest since Ronald Reagan. I'm very proud of it. It will create tremendous numbers of new jobs. But regulations, you are going to regulate these businesses out of existence. When I go around, Lester, I tell you this, I've been all over. And when I go around, despite the tax cut, the things that businesses and people like the most is the fact that I'm cutting regulation. You have regulations on top of regulations, and new companies cannot form, and old companies are going out of business, and you want to increase the regulations and make them even worse. I'm going to cut regulations, but I'm going to cut taxes big league, and you're going to raise taxes big league. End of story.
Let me get you to pause right there, because we're going to move into the next segment. We're going to talk taxes.
That can't be left
Please
to
just
stand.
take 30 seconds. then we're
I
gonna go
kind
on.
of assumed that there would be a lot of these charges and claims. And so we have taken the homepage of my website, HillaryClinton.com, and we've turned it into a fact checker. So if you want to see in real time what the facts are, please go and take a look. Because
And take a look at mine also, and you'll
not
see.
add a penny to the debt. and your plans would add $5 trillion to the debt. What I have proposed would cut regulations and streamline them for small businesses. What I have proposed would be paid for by raising taxes on the wealthy because they have made all the gains in the economy. And I think it's time that the wealthy and corporations paid their fair share to support this country.
Well, you just opened the next segment.
Well, look, could I just finish?
Actually,
I think I should.
I'm going to
You
give you
go
a
to her
chance right
website
here. With the
and
new
you take a look at her
15-minute
website.
segment,
She's
it's
going to
on-
raise taxes $1.3 trillion.
Mr. Trump,
and look at her website. You know what? It's no different than this. She's telling us how to fight ISIS. Just go to her website. She tells you how to fight ISIS on her website. I don't think General Douglas MacArthur would like that too much.
The next segment, we're continuing
Well,
the
at
subject
least
of
I have a plan to fight
achieving
ISIS.
No, you're telling the enemy everything you want to do.
No, we're not.
See, you're
No,
telling
we're
the
not.
enemy everything you want to do. No wonder you've been fighting. No wonder you've been fighting ISIS your entire adult life.
That's go to the fact checkers. Get
Folks,
to work.
you are unpacking a lot here, and we're still in the issue of achieving prosperity. And I want to talk about taxes. The fundamental difference between the two of you concerns the wealthy. Secretary Clinton, you're calling for a tax increase in the wealthiest Americans. I'd like you to further defend that. And Mr. Trump, you're calling for tax cuts for the wealthy. I'd like you to defend that. And this next 2-minute answer goes to you, Mr. Trump.
Well, I'm really calling for major jobs because the wealthy are going to create tremendous jobs. They're going to expand their companies. They're going to do a tremendous job. I'm getting rid of the carried interest provision. And if you really look, it's not a tax. It's really not a great thing for the wealthy. It's a great thing for middle class. It's a great thing for companies to expand. And when these people are going to put billions and billions of dollars into companies, and when they're going to bring $2.5 trillion back from overseas, where they can't bring the money back because politicians like Secretary Clinton won't allow them to bring the money back because the taxes are so onerous and the bureaucratic red tape. So what is so bad? So what they're doing is they're leaving our country, and they're, believe it or not, leaving because taxes are too high and because some of them have lots of money outside of our country, and instead of bringing it back and putting the money to work because they can't work out a deal to, and everybody agrees it should be brought back, instead of that, they're leaving our country to get their money because they can't bring their money back into our country because of bureaucratic red tape, because they can't get together, because we have a president that can't sit them around a table and get them to approve something. And here's the thing. Republicans and Democrats agree that this should be done. $2.5 trillion. I happen to think it's double that. It's probably $5 trillion that we can't bring into our country, Lester. And with a little leadership, you'd get it in here very quickly, and it could be put to use on the inner cities and lots of other things, and it would be beautiful. But we have no leadership. And honestly, that starts with Secretary Clinton.
All right, you have 2 minutes on the same question to defend tax increases on the wealthiest Americans, Secretary Clinton.
I have a feeling that by the end of this evening, I'm going to be blamed for everything that's ever happened.
Why not?
Why not? Yeah, why not? You know, just join the debate by saying more crazy things. Now, let me say
there's nothing crazy about not letting our companies bring their money back into their country.
This is Secretary Clinton's 2 minutes, please.
Yeah, well, let's start the clock again, Lester. We've looked at your tax proposals. I don't see changes in the corporate tax rates or the kinds of proposals you're referring to that would cause the repatriation, bringing back of money that's stranded overseas. I happen to support that. I happen to support that in a way that will actually work to our benefit. But when I look at what you have proposed, you have what is called now the Trump loophole, because it would so advantage you and the business you do. You've proposed an approach that has a $4 billion tax benefit for your family. And when you look at what you are proposing,
much for my family?
It is,
Lester,
as I said, trumped up trickle down. Trickle down did not work. It got us into the mess we were in 2008 and 9. Slashing taxes on the wealthy hasn't worked, and a lot of really smart, wealthy people know that. And they are saying, hey, we need to do more to make the contributions we should be making to rebuild the middle class. I don't think top-down works in America. I think building the middle class, investing in the middle class, making college debt-free so more young people can get their education, helping people refinance their debt from college at a lower rate. Those are the kinds of things that will really boost the economy. Broad-based, inclusive growth is what we need in America, not more advantages for people at the very top.
Mr. Trump,
typical politician, all talk, no action, sounds good, doesn't work, never going to happen. Our country is suffering because people like Secretary Clinton have made such bad decisions in terms of our jobs and in terms of what's going on. Now, look, we have the worst revival of an economy since the Great Depression. And believe me, we're in a bubble right now. And the only thing that looks good is the stock market. But if you raise interest rates even a little bit, that's going to come crashing down. We are in a believe me, we're in a bubble right now. And the only thing that looks good is the stock market. But if you raise interest rates even a little bit, that's going to come crashing down. We are in a big, fat, ugly bubble. And we better be awfully careful. And we have a Fed that's doing political things. This Janet Yellen of the Fed. The Fed is doing political by keeping the interest rates at this level. And believe me, the day Obama goes... It's moving along quickly. The airline business has been hit very hard, as everybody knows. And we are going to be in a position to do a lot.
Those watching right now who have now lost their livelihood, who are scared about the future and not sure what tomorrow holds.
Attorney General, it's great seeing you. Thanks for being with us.
Thanks for having me, Laura.
Right now we have no freedom of worship, public worship to go.
Day 1175 of this Trump administration, 209 days to go until the presidential election. Another record day across this country in all the bad ways. At today's White House briefing, in what may be a continuation of a rather perverse lesson in adjusting expectations, the president, wanting always to show he acted early and decisively against the virus and was never a denier, said today if the death toll in this country is substantially under 100,000 people, as he put it, we did a very good job. He said today he considers the country ahead of schedule. He says he wants to reopen the country with a big bang. And right before leaving the stage, he said, we're really in great shape. He left the briefing room. Mike Pence started to talk about the grim week we are witnessing here in these United States. The number of confirmed cases worldwide now at 1.5 million. In this country, nearly 15,000 people have lost their lives thus far. At the epicenter of this crisis, New York again reporting its highest single-day death toll, with 779 souls lost in 24 hours. New Jersey also hit its own one-day record, 275 deaths. New York has more confirmed cases than any other country in the world, except for the United States. Yet again today, Governor Cuomo of New York said the latest data indicates the curve of infection is flattening.
The number of patients hospitalized is down. And again, we don't look at just day-to-day data. You look at the 3-day trend. There's no doubt that we can't stop doing what we're doing.
Politico reporting Vice President Pence and Dr. Tony Fauci told lawmakers they too were seeing signs of stabilization and that the administration is now actively exploring ways to return the shutdown nation back to normal. At this afternoon's White House briefing, Trump focused on those glimmers of progress.
We're hopefully heading toward a final stretch, the light at the end of the tunnel, as I was saying. As we continue to wage all-out medical war to defeat the virus, we're also fighting an economic war to ensure we can quickly turn to full financial strength.
What specifically has to happen for you to feel that it's safe to reopen the country, and what is your plan to do that?
Well, I think we can say that we have to be on that downside of that slope and heading to a very strong direction that this thing is gone. Now, we could do it in phases. We can go to some areas, which some areas are much less affected than others. But it would be nice to be able to open with a big bang.
Do that until the health experts tell you it's safe to do it?
Yeah, I would rely very heavily on them, yeah.
Is there a system for monitoring and testing that you're looking at?
Yeah, we're putting in very heavy testing systems.
He's talked about that notion before of opening regionally. It's still not clear how any of that would take place, especially given the current level of testing in this country. We've only tested 0.6% of the population. Yet the director of the CDC came to the briefing with new guidelines outlining how essential employees can return to their jobs even if they've been exposed.
These are individuals that have been within 6 feet of a confirmed case or a suspected case, and so that they can, under certain circumstances, they can go back to work. If they're asymptomatic, they could go back to work if they do several things, as we say here. Take their temperature before they go to work, wear a face mask at all times, and practice social distancing when they're at work.
Stands to reason if people go out too early, the curve creates a bounce. The president is still talking about his goal of Easter Sunday to pack the churches in this country, you'll recall, and get back to work. Well, of course, Easter Sunday is 4 days away. He concedes that isn't going to happen, but he wants credit for the idea while wanting to claim he wasn't entirely serious.
I had a date, and I thought it was a very aspirational date. It's turning out to be very interesting because a lot of good things are happening by Easter. But I had a very aspirational date. I didn't think we could make it. I didn't say we would do it by Easter, but I said, boy, wouldn't that be great to shoot for Easter? That would be a great day, a beautiful day, very important day to a lot of people like me and like some of you in the room, maybe all of you in the room, frankly. But Easter's a very important day. So I had, aspirationally, I said, let's see if we can do it at Easter, but I said it would be very tough. And I was criticized for that. So I don't like giving dates. And that wasn't a date. That was just an aspiration. That would have been incredible. But I don't think we're going to be very far behind. And some of these models are looking like Easter is going to be a very important date anyway because of the curve. I mean, it's hitting the top and it's starting to come down. And one person said Easter is looking like a good time. So a good time for that, for heading down.
In the real world, on this Passover night, the number of virus cases is now growing quickly in cities like Philadelphia, Baltimore, Washington, D.C. There's more reporting today on the rapid spread of the illness in less populated parts of our country. President Trump also promoting the use of that anti-malaria drug against the coronavirus, even though many doctors and public health experts are not yet endorsing an unproven treatment.
Our national stockpile is now equipped with nearly 30 million hydroxychloroquine pills. So we're up to about 30 million. We're distributing them by the millions. In addition, the azithromycin and zinc. They say zinc. You should add zinc. Now, it's all has to be recommended by doctors, physicians, but they say zinc. I want to throw that out there because that's where they seem to be having the best result. So you add the zinc and the azithromycin, and it's been, we've had a lot of good stories.
We'll talk about this with our guests in a bit. The vice president did say there are at least 4 separate clinical trials underway studying this hydroxychloroquine. There's also news concerning the White House original projection of as many as 200,000 virus fatalities, even with social distancing in effect. Those numbers are now being reversed and revised downward. One model used by the administration's task force puts the number at 60,000 and 400 COVID-related U.S. deaths by August. Today, Dr. Deborah Birx said it's evidence social distancing may be working.
That is modeled on what America is doing. That's what's happening. Americans are in adapting to and following through on these behavioral changes, and that's what's changing the rate of new cases, and that's what will change the mortality going forward.
The president was asked again today about that January memo from his trade advisor, Peter Navarro, who warned about the risks and potential costs of a pandemic. A memo the president said yesterday he hadn't read as of yesterday. Here's what he had to say today.
Were you ever briefed on those memos? Did you ever discuss those memos with anybody?
I don't remember that. I've now seen the memo. I saw it. It was, Peter sends a lot of memos. I didn't see the memo. As you know, World Health was saying that was not correct because at the time they called it wrong. But I didn't see the memo, but I acted as quickly as people were shocked that I acted so quickly.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.
Scientists in China are trying to determine if a new virus strain is responsible for a pneumonia outbreak in the city of Wuhan.
China says the number of people infected by a mysterious respiratory virus has more than tripled over the weekend.
China today says it has confirmed cases of human-to-human transmission.
Dr. Li Wenliang tried to raise the alarm about a new mystery illness. That virus has taken his life.
The ability of the deadly coronavirus to spread is getting stronger.
Significant clusters have developed in South Korea, Japan, and Iran.
The World Health Organization says an animal is probably the source of this new virus, and this now closed seafood market is probably ground zero.
Wuhan in China now on lockdown as the country struggles with fear of a pandemic.
出门了以后就发现本来很繁华人很多的街道上面的话，像极了那种末世电影里面的场景。我在武汉封城以后，也是志愿去帮一些身在外地不能回武汉的人去。
They're racing to build a new 1,000-bed hospital to treat patients.
The growing desperation for quarantined cruise passengers. Thousands stuck on ships like this one off the coast of Japan.
It's the not knowing factor that is the real challenge.
The World Health Organization has officially called it COVID-19.
This one is scary because it is a brand new virus, so we don't know how it's going to behave.
But as the number of people infected by this disease continues to mount, so too the impact on all of our lives.
You've heard about flattening the curve. If we don't do anything without protective measures, all these people, and probably more, die.
To keep new cases from entering our shores, we will be suspending all travel from Europe.
This is the worst public health crisis for a generation.
Europe has now become the epicenter of the pandemic.
They're fighting a war here and they're losing.
Sono parecchi anni che lavoro qui in terapia intensiva, sembra di vivere un qualcosa che vedi solo nei film. Adesso è un afflusso proprio soprannaturale.
Overnight, the military cleared the bodies from the hospital morgue in the town because it was full.
The Italian Prime Minister has announced restrictions on movement across the entire country.
Siete degli irresponsabili, dei cretini, degli emeriti cretini.
Se tu non esci, non ti preoccupare, non succede nulla. È inutile che scriva a me. Che cazzo mi scrive a me? State in casa che non succede niente.
Mi aiuterà a capire, a dare più importanza alle piccole cose, alle cose che prima mi sembravano scontate. Vivere, respirare, non so, una passeggiata, un abbraccio.
coronavirus will overwhelm the NHS unless everyone starts to practice social distancing.
From this evening, I must give the British people a very simple instruction. You must stay at home.
And those people and people who are just stripping the shelves of basic foods. You just need to stop it.
Can you all go home, please? It's not a holiday, it's a lockdown, which means you don't just come here and sunbathe. Can you please just leave?
A bright spring day, normally full of tourists. As you can see, it is absolutely deserted.
If anyone is thinking, taking any chances, just take a look at me.
For many of us, this is the challenge of our lives. And it is going to get a bit worse before it gets better. The case numbers will go up.
Do you fear that we're heading for the kind of scale of suffering that we've seen in Italy?
Regrettably, the answer has to be yes.
A blue call is coming in, warns the nurse. This is the reality of working on the front line and managing huge numbers of patients.
For doctors and nurses treating patients, supplies are urgently needed.
We are staying away from our families and we're putting ourselves in danger. It feels like a losing battle, but it's not, because we've all got hope and we're all trying to do what we can, and we're all sticking together.
Well done! Oh my God!
I've just took the team outside to listen. That is absolutely...
I've developed mild symptoms of the coronavirus.
The Prime Minister has been admitted to hospital in what's being described as a precautionary step.
And on the advice of the medical team, who's moved in to a critical care unit.
The U.S. now has more reported cases of the coronavirus than any other country in the world.
The number of cases in the U.S. jumped again overnight to at least 102,000, with 1,600 deaths.
New York, the epicenter in the U.S., still in need of more space and more supplies.
How is it? Hell. Biblical. I kid you not.
Queens in New York is the worst infected district in what is now the world's worst infected city, and the doctors and nurses don't know what's hit them.
There's a common misconception going around that it's only the elder people in our population that's being affected. This is simply untrue.
It is really killing a lot of people.
You're going to start seeing some real light at the end of the tunnel, but this is going to be a very painful, very, very painful 2 weeks.
And now for some good news.
Lean on me when you're not strong, and I'll be your friend. I'll help you.
If there is any silver lining, pollution levels way down.
We should take comfort that while we may have more still to endure, better days will return. We will be with our friends again. We will be with our families again. We will meet again.
Don't know where, don't know when, but I know we'll meet again some sunny day.
Good afternoon to everyone. These are stressful, emotional times, as we know, and today is a day in the state of New York with very mixed emotions based on two very different pieces of information we have. I'm trying to work through the mixed emotions for myself, so I'll just present the facts and then we'll go from there. There is good news in what we're seeing, that what we have done and what we are doing is actually working and it's making a difference. We took dramatic actions in this state. We New York Pause program that closed down schools, businesses, social distancing, and it's working. It is flattening the curve, and we see that again today. So far, meaning what? Meaning that curve is flattening because we are flattening the curve by what we are doing. If we stop what we are doing, you will see that curve change. That curve is purely a function of what we do day in and day out. But right now it's flattening. The number of patients hospitalized is down. And again, we don't look at just day-to-day data. You look at the 3-day trend, but that number is down. The 3-day average trend is also down. Anecdotally, the individual hospitals, the larger systems are reporting that some of them are actually releasing more people than are coming in, so they're net down. So we see the quote-unquote flattening of the curve. We have more capacity in the hospital system than ever before. So we've had more capacity in that system to absorb more people. The sharing of equipment, which has been really one of the beautiful, cooperative, generous acts among different partners in the healthcare system, has worked. If the hospitalization rate keeps decreasing the way it is now, then the system should stabilize over these next couple of weeks, which will minimize the need for overflow on the system that we have built in at Javits and at the USNS Comfort. So that is all good news. There's a big caution sign. That's if we continue doing what we're doing. If we continue doing what we're doing. We are flattening the curve because we are rigorous about social distancing, etc. So if we continue doing what we're doing, then we believe the curve will continue to flatten. But it's not a time to get complacent. It's not a time to do anything different than we have been doing. Remember what happened in Italy when the entire healthcare system became overrun? So we have to remain diligent, we have to remain disciplined going forward. But there's no doubt that we are now bending the curve, and there's no doubt that we can't stop doing what we're doing. That's the good news. The bad news isn't just bad, the bad news is actually terrible. Highest single day death toll yet, 779 people. When you look at the numbers on the death toll, it has been going steadily up, and it reached a new height yesterday. The number of deaths, as a matter of fact, the number of deaths will continue to rise as those hospitalized for a longer period of time pass away. The longer you are on a ventilator, the less likely you will come off the ventilator. Dr. Fauci spoke to me about this, and he was 100% right. The quote-unquote lagging indicator between hospitalizations and deaths. The hospitalizations can start to drop, the deaths actually increase because the people who have been in the hospital for 11 days, 14 days, 17 days pass away. That's what we're seeing. Hospitalizations drop and the death toll rises. I understand the science of it. I understand the facts and the logic of it. But it is still incredibly difficult to deal with. Every number is a face, right? And that's been painfully obvious to me every day. But we have lost people, many of them frontline workers, many of them healthcare workers, many of them people who were doing the essential functions that we all needed for society to go on, and they were putting themselves at risk, and they knew they were. Many of them vulnerable people who this this vicious predator of a virus targeted from day one. This virus attacked the vulnerable and attacked the weak. And it's our job as a society to protect those vulnerable. And that's what this has always been about from day one. And it still is about. Be responsible, not just for yourself, but to protect the vulnerable. Be responsible because the life you risk may not be your own. Those people who walk into an emergency room every day and put themselves at peril, don't make their situation worse. Don't infect yourself or infect someone else so their situation becomes more dangerous. Just to put a perspective on this, 9/11, which so many of us lived through in this state and in this nation, 2,753 lives lost. This crisis, we lost 6,268 New Yorkers. I'm going to direct all flags to be flown at half-mast in honor of those who we have lost to this virus. Big question from everyone, from my daughters, I'm sure around most people's dinner table. When will things go back to the way they were? I don't think it's about going back. I don't think it's ever about going back. I think the question is always about going forward. And that's what we have to deal with here. It's about learning from what we've experienced, and it's about growing, and it's about moving forward. Well, when will we return to normal? I don't think we return to normal. I don't think we return to yesterday, where we were. I think if we're smart, we achieve a new normal. The way we are understanding a new normal when it comes to the economy and a new normal when it comes to the environment. Now we understand the new normal in terms of health and public health. And we have to learn just the way we've been learning about the new normal and other aspects of society. We have to learn what it means, global pandemic, how small the world has actually gotten. Someone sneezes in Asia today, you catch a cold tomorrow. Whatever happens in any country on this globe can get on an airplane and be here literally overnight. And understanding this phenomenon and having a new appreciation for it, how our public health system has to be prepared, and the scale to which we need a public health system. Look at the way we're scrambling right now to make this work. We have to learn from that. I think we've also learned positive lessons. We've found ways to use technology that we never explored before. You have a New York State court system that, thank you, Chief Judge, is basically developing a virtual online court system, which has all sorts of positive benefits going forward. Using technology for healthcare, using technology for work from home, using technology for education. I think these are all positives that we can learn. Testing capacity, which we still have to develop. That is going to be the bridge from where we are today to the new economy, in my opinion. It's going to be a testing-informed transition to the new economy, where people who have the antibodies, people who are negative, people who have been exposed and now are better, those are the people who can go to work, and you know who they are because you can do testing. But that we've all developed a sense of scale over the past few weeks in dealing with this. There's also lessons to be learned. Why are more African Americans and Latinos affected? We're seeing this around the country. Now, the numbers in New York are not as bad as the disparities we see in other places across the country, but there still are apparently disparities. Why? Well, comorbidity, I understand that, but I think there's something more to it. You know, it always seems that the poorest people pay the highest price. Why is that? Why is that? Whatever the situation is, natural disaster, Hurricane Katrina, the people standing on those rooftops were not rich white people. Why? Why is it that the poorest people always pay the highest price? But let's figure it out. Let's do the work. Let's do the research. Let's learn from this moment, and let's learn these lessons, and let's do it now. We're going to do more testing in minority communities, but not just testing for the virus. Let's actually get research and data that can inform us as to why are we having more people in minority communities, more people in certain neighborhoods. Why do they have higher rates of infection? I get the comorbidity. I get the underlying illness issue. But what else is at play? Are more public workers Latino and African American who don't have a choice, frankly, but to go out there every day and drive the bus and drive the train and show up for work and wind up subjecting themselves to, in this case, the virus, whereas many other people who had the option just absented themselves. They live in more dense communities, more urban environments, but what is it? And let's learn from that, and let's do it now. I'm going to ask our SUNY Albany Chief, Dr. Javidan Rodriguez, to head an effort to do it right now. We'll do more testing in minority communities now, with more data research done now. So let's learn now. Department of Health will be doing it along with Northwell. But let's learn these lessons now. We're also going to make an additional $600 payment to all unemployed New Yorkers. The federal government says they will reimburse us for it, but people need money now in their pocket. So New York will be doing that immediately. We're also extending the period covered by unemployment benefits for an additional 13 weeks, goes from 26 weeks to 39 weeks, so that should be a relief. On voting, I've seen lines of people on television voting in other states. This is totally nonsensical. God bless them for having such diligence for their civic duty, that they would go stand on a line to vote, but people shouldn't have to make that choice. And where, by executive order, all New Yorkers can vote absentee on June 23rd, primaries coming up. I want to say thank you to the many places and people who are working with the state of New York. Mercury Medical donated 2,400 BiPAP machines. BiPAP machines are technically not ventilators, but they can be modified to effectively ventilate, even though they're not ventilators, and we're using them. They were brought up from Florida. Thank you very much, JetBlue, for doing that. I also want to thank Oregon and Washington State and California for freeing up ventilators. I want to thank the direct care workers who are doing a fantastic job, and they're doing it every day. I want to thank the state workers who are showing up and doing a great job every day, every first responder. This has been a long battle, and it's going to go on, but I want them to know how thankful we all are of them for what they're doing. I want people to remember that we're flattening that curve, and if anything, we double down now on our diligence. We're going to start a social media campaign. Who are you staying home for, right? It's not about staying home for yourself. Stay home for others. Stay home for the vulnerable people who, if they get this virus, are in a really bad place in life. Stay home for the healthcare worker who's in the emergency room because you don't want to infect anybody else, who then puts another greater load on our healthcare system. So who are you staying home for? I'm staying home for my mother, but everyone, it's not about just you, it's about all of us. So who are you staying home for? And we'll start a social media campaign that does that. But thank you to all the New Yorkers for all they've done. And we still have more to do. We are by no means out of the woods. And do not misread what you're seeing in that data and on those charts. That is a pure product of our actions and behavior. If we behave differently, you will see those numbers change. I just doubled the fine on disobeying the social distancing rules. Why? Because if anything, we have to get more diligent, not less diligent. And we have more to do. And that's New York, tough. But tough is more than just tough. Tough is smart and disciplined and unified. And tough is loving. The toughest guys are tough enough to love, right? Last point, our brothers and sisters in the Jewish community celebrate Passover tonight. We wish them all a happy Passover. The Jewish community has had a long and difficult year besides any of this. The number of incidents of anti-Semitism across this country, the violence that they have seen, even in this state of New York that has such a large Jewish population. So we wish them all well on Passover. And the message of Passover, I know, helps me today, and I offer it to others to consider. Passover says we remember the past, we learn from the past, we remember the lessons of the past, we teach a new generation those lessons. But there's also a message of hope in Passover. Next year in Jerusalem, next year in Jerusalem, next year the Promised Land, next year will be better. And yes, this has been a difficult month. We'll learn a lot, we'll move forward, and we'll be better for it. Questions?
In New York City, 75% of frontline workers are Black and Latino. We're talking about grocery store clerks, people who work in public transit, childcare. Is it time to scale back some of these grocery stores that are open, or some of these businesses that are still open at this point, to try to bridge that gap?
Yeah, the question is, many of the essential workers, public workforce, tends to be African American and Latino. I think that's probably right. I don't know the statistics, but I think that's probably right. I also believe the frontline workers do have a greater exposure than most people. I think that's one of the things we'll find when we do this research on why is the infection rate higher with the African American community and the Latino community. Again, the disparity that we're seeing in New York is nothing like what you see in other places across the country. But I think it is something that we have to understand. I don't think we can reduce the essential services. You know, we're down to basically food, pharmacy, basic transportation, which frankly is more for our essential workers to get where they're going. If you didn't have public transportation, you couldn't have those healthcare workers showing up, you couldn't have the grocery workers showing up. So I don't think we're in a position to say eat less or use less drugs or use less healthcare. I think we have to get through this now and then learn from it and see what changes we can make in the future.
The state was do you think the state was slow?
Excuse me 1 second, Karen, just Bernadette.
Was the state slow to shut everything down? Did New York pause come too late? Do you guys wish that you had started reducing the workforce, shutting down businesses, etc., sooner, especially considering San Francisco had shut down prior to New York? Do you think that New York was late to act?
No, I think New York was early, and I think the actions we took were more dramatic than most, and frankly, were criticized as being premature. So no, I think if you could rewind the tape, you'd have to go back to last November, December. What was going around, what was happening around the world, and what was the effect going to be here. My point about, global pandemics. We're watching China, we're watching Italy, we're watching other countries. Well, extrapolate from that on a national basis. What was the first part of your question, Bernadette?
Just wondering if you think, should you have shut down the schools? There's a conflict between the city schools. De Blasio and you were having that debate over should we shut them down. Also bars and restaurants. Should any of those actions come further?
There wasn't a debate.
Incremental?
There wasn't a debate. I made the decision to close down the city schools. I didn't have a debate. There was a debate about closing city schools, and people thought I closed the city schools prematurely. That was the ongoing debate. But no, I think, look, if anything, in retrospect, it shows what we did is right. I'm sorry, Karen.
Sorry. On the June 23rd voting, do you envision polling places being open? As you know, many of the poll workers are older workers, or would everybody be voting by mail at that point?
I think we're just saying absentee voting is an option. We don't say it's a necessity, right?
We're saying absentee voting is an option. We're saying the temporary illness provision of the absentee voting will include the risk of contracting COVID-19, and I think we're going to take a wait-and-see approach as we get closer on whether or not any polls should be open.
Releasing COVID data to the public, but many other nursing homes aren't. Should all facilities do so?
Do you understand that question? Peconic Landing?
Peconic Landing and the community on Long Island that's been seeing the high number of
Peconic Landing is a nursing home that has been releasing data. Should other nursing homes be releasing data, is the question? Should all nursing homes or any nursing homes?
So we are tracking the nursing homes, and we wanted to protect the privacy of the individuals in the nursing homes, and we do defer that back to the homes themselves, so that particular place has released data, but we do track it.
Outbreaks or known clusters at nursing homes?
Well, we have seen in multiple nursing homes across the state, particularly in the lower, downstate, I should say, cases, and we do track them. Some of them are as a result of one person who was there, and others have gotten infected, so we are looking at that closely.
The public to know about that? Can't the state release the list of nursing homes with a high number of COVID patients like other states and countries have?
Well, again, it goes back to the fact that the nursing home is, in many ways, where they live. It's not like where you go into the hospital and then you can leave the hospital. So we try to protect their privacy a little bit more, but we do track it. If there's a case there or if there's a concern there, we go and investigate it immediately.
Jesse?
Governor Rumway said that it would be shut down until June 7th this morning. Is that going to be a good rule of thumb for other sorts of mass gatherings in New York City or statewide?
No. I wouldn't use what they think.
You anticipate mass gatherings beginning before June 7th?
I don't know, but I wouldn't use what Broadway thinks as a barometer of anything. Unless they're in the public health business and they have seen better numbers and models. I think, look, all of these projections basically turned out to be wrong, right? And this is a very hard thing to model because besides all the variables, you're modeling public behavior and what people will do. If you go back and you look at even models that were put out in January, they all had a premise about how effective social distancing would be, what percent of the population would actually comply with social distancing, etc. And they have turned out to be wrong. But I think, Jesse, they can be wrong either way. I'm more worried about people saying, oh, well, the number of cases is coming down. It's now safer. It's not. It's not. I'm more afraid of the number changing and the curve changing because people read something into it that's not there. If you reduce that compliance on social distancing, you'll see those numbers go up within days. Literally it'll go up within days. So, no, I take it one day at a time, look at the data for the day, look at the numbers for the day, and then make a decision. Well, 2 weeks, look, we only went to April 29th, right, with the school closing. We extended everything until April 29th on the school closing, New York pause. Even that's a projection. I wouldn't go past that.
What about other areas of the state? We obviously see concentrations on Long Island, Stephen, downstate, Hudson Valley. If there are other places where you haven't seen these cases, do you foresee opening schools, opening on?
You haven't seen these cases yet, Jimmy, and be careful of tents and be careful of counting out chickens before they hatch. We haven't seen cases yet. We are in the midst of this. Don't start doing a retrospective like it's over, because that's the attitude we have to avoid. You will see more cases in upstate New York. I'll bet you whatever you want to bet right now. You will see more cases on Long Island. I'll bet you whatever you want to bet right now. So we're not through it. It's not over. We are in the midst of it. We have some good news in that what we're doing is working. And by the way, we've all been killing ourselves, right? One way or the other. Isolation, the work of the healthcare system has been phenomenal. People working 24 hours a day, people exposing themselves. The good news is that's showing a benefit and flatten the curve at a lower rate than almost any of the models were projected. Okay, that's the good news. But we are still in the midst of it. And the bad news, the terrible news is, look at how many lives we lost. I mean, it is breathtaking. So the next time we want to think about, we're getting a little complacent, a little cavalier, look at the number of people we've lost. Remember that before you decide to go out of the house because you have cabin fever.
What sort of metric, what metric would you be looking at, or Dr. Zucker, or any of you, to make that sort of decision? What would be the tipping point, so to speak?
Look at the infection rates, Jesse. That number has to come down on the other side of the mountain. The number of infection, new cases going into a hospital, the infection rate has to come down to a point where you believe the isolation of the vulnerable, the other measures we're taking, is enough to start to reopen. And then how do you reopen? It's not just going to be about Broadway theaters. Before you go to Broadway theaters, people are going to say, when can I go back to work? When can I go back to school? When are the other essential services going to open? You know, before they go to a play, there's going to be a lot of other questions that they're going to ask. And that's going to be a function of numbers. Frankly, I would like to do that on a regional basis with Connecticut and New Jersey, because this is a regional workforce. So I stay very close to Governor Murphy and Governor Lamont on those decisions. I don't believe in these geographic distinctions in these situations, right? There is no New York City. There's New York City, there's Nassau, there's Suffolk, there's Westchester, there's Rockland, right? The virus doesn't stop at a border, and these decisions are regional in nature. So now, Broadway obviously is a microcosm, but the overall decisions are all in a regional context, and I think it's going to be the numbers, and when are the numbers low enough that it is safe?
It wouldn't need to be zero, is what you're saying. It could just be low enough.
Yes, yes. I don't think it has to be zero. I don't think it. Look, it may never be zero. It may never be zero, and you have to watch this. You know, when will we go back to normal? You think there's ever going to be a morning that I wake up again in my life not worried about this in the back of my mind? You don't think we're all going to worry about now, is there a second wave? You don't think we're all going to worry about now when somebody sneezes in Asia, how long until that cold comes here? No, but I would not, zero, I don't know that we ever get back to zero. Doctor, you want to mention something?
I concur 100%.
Hospital capacity, are we?
Well, let's just go ahead.
Governor, we're hearing that hospital
hospitals in Queens, that they don't have the blood gas machines or cartridges, which are critical for operating them. Also, if hospitals do have ventilators, do they have enough operational technicians to operate them?
Do they have enough operational technicians? They must, because somehow they've been working. I don't know what the exact operating technician is for a ventilator, but I have not heard that. I've talked to all the hospitals every day for the past couple of days to find out what's going on, what they need, and the heads of the large hospital systems. Nobody's mentioned that to me. We have over 100 hospitals on the phone, so. What was the first part of your question?
Machines or cartridges?
Blood gas machine cartridges.
Yeah.
Dr. Zucker is an expert on blood gas machine cartridges. He gave me some for my birthday last year, actually. He said, just in case. I didn't know what he meant at the time. And now I know. And he's going to give me a ventilator this birthday, so I'm going to put it all together. Go ahead, you want to ask the
So
blood
those
gas?
are part of the supplies to run the point of care testing, which is a blood gas, the lab test that we do at the bedside. And if there is a decrease in supplies, we are looking into all of them to get them to the hospitals that are needed.
I knew that answer, by the way. I knew what a blood gas cartridge was. I wanted the doctor to be able to.
Hospital capacity, you had projected 110,000 beds. It sounds like if we're nearing the apex or at the plateau, whatever, what number do we have? What do we need these temporary facilities? What are the updates on those numbers? Both in
Not full, Micah, you're right. That's my whole point. We're flattening the curve now below projected peaks because of our behavior. But again, Jimmy, you want to talk about this in the retrospective. There is no retrospective. You're in the middle of it. If you walk in front of traffic on the way home, yes, you're young, you may have a different life expectancy based on your action. We are in the middle of it. I'm not going to say to anyone, right now you've seen a little flattening. That's all you've seen. You've seen 4 or 5 days of flattening. Oh, it's flat. No, you have 4 or 5 days of flattening. You could have tomorrow morning we wake up and the numbers back up. So I'm not willing to say, because it's not true, that any of this is over or anything has been accomplished, because this is just a small snapshot in time where we are. At this rate, we are below projected numbers.
Governor, what peak projection? What is the number of beds we have now, and what is the number of patients?
There is no new peak projection. There is no new peak projection. Listen to what I'm saying. Nobody is saying we peaked. We have flattened the curve. For this period of time, if you continue doing what you're doing, might one think the flattening would continue? One might think that, but nobody knows. Nobody knows.
Are you worried about undercounting in terms of people that may have died at home and not been diagnosed with COVID-19?
I think that's a very real possibility.
And have you given any thought, or has anyone?
We're looking at other models of counting, but I don't know. No, I have no idea. The question is, if people died at home, might you not have those numbers because they would only come from basically a funeral home? We're looking at other models because right now most of the data we have comes from hospitals and major institutions, nursing homes. So there could be a deviation, no doubt about that.
Also impact the hospitalization rate, and couldn't that skew the measurements that you guys have been doing on hospitalizations if there have been that many at-home deaths that have not been tallied and those people have not
nobody
been
said there have been that many at-home deaths. Just a question, could there, yeah, there have been, well, people have said there may be people who have died at home who have not been counted. That is a possibility, right. That would never affect the hospitalization rate, because the hospitalization rate is the number of people who walk into the hospital, right? That is different than the number of people who have passed away.
If people were dealing with this illness at home and perhaps they had symptoms that would have been treatable, or it would have caused them to go to the hospital. So, like it's confusing because if people are in the hospitals, right, but if someone's at home because they can't go to the hospital,
Well, you're
how
right.
do you...
If someone
equate?
never went to the hospital and just stayed at home and passed away at home, they would never show up in the hospitalization rate. They would show up in the number of deaths. There might be, Jesse's point, there might be a lag in the number of deaths because we haven't fully aggregated all the data from all the different sources. That's possible. I don't know how if it's going to be meaningful statistically, but it's possible. So, can I just, I'm sorry.
Thank you, Governor. Governor, there is an emergency room physician in New York City, and I'm sure Dr. Zucker will want to comment on this too, who says he's seeing a very high percentage of patients, maybe 70%, die who are put on ventilators. He's thinking the approach is all wrong. We need to rethink the protocol, that these patients might not need the ventilators, they might need oxygen instead.
So I think, I can't comment on exactly what they're saying, but the fact is when someone shows up in the emergency room, there's a handful of things that are going to take place. One is the oxygen is an initial therapy that someone needs, but the fact is that if someone's respiratory status gets worse, they're going to need respiratory support. The real question maybe is there other interventions that one could do, and we are looking at what other possible therapies would be out there that could possibly be given earlier, and that's all experimental.
Is it possible the ventilators might be doing more harm than good?
So the issue with ventilators in general is that if someone goes on a ventilator, and the government has spoken about this before, about how long people stay on the ventilator, the longer you stay on the ventilator, you end up potentially causing damage to the lung. It's a pressure that's being pushed into your lungs, and you're constantly putting pressure into those little air sacs in the lungs. It can damage them, and the high levels of oxygen also can damage your lungs. But the fact is, it's what's called the catch-22 in a lot of ways, which is where you need the ventilator, but if you're on it a long time, it can cause harm. That's why you try to get them off as fast as possible. Excuse me?
Or in Great Britain?
I can't comment on his case, but obviously, because I don't know the information. But when someone comes in, the initial thing to do is to give someone oxygen by mask, and if someone gets worse, then you end up intubating them. What's happened with these patients is that they get worse relatively quickly, and so there's a lot of interventions that have to happen relatively quickly as well.
Yeah, I'm not a medical doctor, obviously, but look, nobody wants to put people on the ventilator. I've discerned that much, and I think you're right, the percentage of people who go on the ventilator who never come off the ventilator is incredibly high. I've even heard like closer to 80%. I don't think the ventilator is doing that. I think that's why they're on the ventilator. They're doing the ventilator as basically a last resort. So when they put you on the ventilator, it's because everything else has failed, and that's why the mortality rate is so high on the ventilator. And that's what we're seeing here. That death rate is going up because it's the people who've been on a ventilator 7 days, 10 days, 15 days, and they're passing away. So when we had that big increase in hospitalizations about 10 days ago, 2 weeks ago, that big spike in hospitalizations, what we're seeing is the people who went into the hospital on that day, 10 days ago, 12 days ago, who didn't get better, who was put on a ventilator, is now passing away. And that's what's driving this death toll. And look, that number, what's even making it more depressing and distressing, that death toll probably will be this high or near this high or even higher for the next several days, because it's the coefficient of the high hospitalization rate from 2 weeks ago or so. So when you get up tomorrow morning, the news could be just as bleak. And that's why I'll end where I started, mixed emotions. We are flattening the curve. thank God. Thank God, thank God, thank God. And thank a lot of good people who have been working very hard. That is a moment in time. Don't get complacent. It's what we're doing that's working. Keep doing it. That's the good news. And that good news has a big caveat. We're still in the midst of it. Don't get complacent. You start acting different, you'll see that number change in 27 minutes. That's the good news. The bad news is we have had a record number of deaths. I mean, I went through 9/11. I thought in my lifetime I wouldn't have to see anything like that again. Nothing that bad, nothing that tragic. I remember the number of funerals after 9/11. I remember the grief after 9/11. That this should literally eclipse that in terms of numbers of dead in this state. It's almost unimaginable to me. Then how do you square those two things? We're making progress. We lost more people than ever before on a single day. Okay, I'm going to work. Thank you, guys.
Temporary hospitals outside of Javits covered across the state.
We are not building more. We're still maintaining them. We are still in the midst. Don't get overconfident. Don't get complacent. We're still in the midst of this. This can still turn any way from Sunday.
Senator, have you spoken to Gavin Newsom in California about a possible consortium to buy medical supplies?
I have not talked to him about a possible consortium, but it's one of the things the National Governors Association is talking about. Because what we just went through, where states are competing with other states, this made absolutely no sense for anyone. So a statewide consortium would be a positive alternative, or a federal government that did all of the purchasing instead, Jesse, and then just gave it to the states that need it.
A multi-state consortium.
Federal government can purchase, right? When I was in the federal government, FEMA effectively was the shipping clerk. They did the purchasing, they disseminated to the states. That's the simplest system. Federal government on a federal disaster, which means multiple states, that's a federal disaster. They are the purchasing entity. They are the master strategist for the operation. That's option A. If the federal government's not going to do it, option B, let the states as a consortium be a purchasing consortium. That's what the National Governors Association conversation is. Because what happened here, where I place a bid, Chicago places another bid, California places another bid, that's just madness. Talk to you later. Thank you.
Progress, we do need to talk about it because it tells us something. And it's something I think New Yorkers should be proud of because it's really about what you have done. It's really about the fact that New Yorkers listened to the guidance from the healthcare leadership telling you to socially distance, telling you to shelter in place. People really listened and they really did what was needed, even though it was very tough. So I want to talk about that and what it means, but I'm going to also say numerous times we have to be careful not to take this initial information and make more of it than we should, because it is only based on a few days and it's only initial information. It's not something we can draw much bigger conclusions from. In fact, it would be dangerous to take a small amount of information and decide too many things based on it. That actually could create some new problems and new dangers, and we don't want that. But let's talk about what you have achieved, because I think the real heroes here are everyday New Yorkers who had to change their lives. All of you had to do something very, very different in very little time. A month ago, this city was in a very different reality. And a month ago feels like, a year ago now. I think a lot of us are having that kind of feeling that so much has happened so quickly. There's really nothing I can think of in our lives that has had this kind of reality where we've gone through just massive, massive changes in so little time. It seems like every day there's something very, very different, very new. Sometimes, hour by hour we saw huge changes. This is hard for all of us to make sense of. We're human beings. That's asking a lot of us to constantly adjust to such a difficult circumstance. And we as New Yorkers, we are warm people, we are emotional people. We love our family gatherings, we love our gatherings with our friends, we love to go to restaurants and nightclubs. We're probably the most social people in the whole country. We're used to being close together. And for these last weeks, that hasn't been possible, and that's really hurt. The fear about the disease, the anxiety, the pain we're seeing around us. Every New Yorker knows someone who has the coronavirus. So many of us know people who have passed away. That's what's in the front of our minds. And that's what we are every day fighting together. But at the same time, we all feel a sense of loss that we had a life that we in so many ways loved in this city, and it's been so strange and so different in the last few weeks. But I want people to know, the reason I say the heroes are everyday New Yorkers is because when asked to do something incredibly difficult, when asked to make these massive changes, New Yorkers went and did it. Amazing levels of follow-through, compliance with these instructions, no matter how hard it was. And it's something everyone should be proud of, because even though we got a long way to go, this is still going to be a very long battle. What we've seen these last few days really proves that social distancing, shelter in place, these are ideas that make a huge difference. And they only make a huge difference when people do them the right way, and New Yorkers are doing that in so many ways. So this gives me hope, more hope than ever, that we can get through this really tough moment and come out together, save a lot of lives, and get on to recovery at some point. But now here's the point I want to make about not drawing too many conclusions, because again, there's a danger in that. We're proving every day that these smart strategies can save lives, can protect people. But we know from some other parts of the world that they started to see a little bit of progress, took their foot off the gas, let down their guard, and guess what? This awful, ferocious disease started to reassert itself. And that's something we have to guard against. We have to beat it back, not open the door again too early for it to resurge and hurt so many people. So what I'm telling you today is something has started to move. We're going to let you know day by day if we see that that positive pattern is sustained or not, because there's no guarantees. Clearly tells us something about what has been working, but it doesn't tell us when this is going to be over. It tells us we got to actually double down and stick to the strategies that are working. And that is frustrating. I'm trying to tell you the truth based on all the information we have, but it's frustrating because we all want to get back to normal. We all want to go see our family, our friends. You know, the weather's getting nice. Everyone would love to go out, be in the park, you know, eat outdoors at a restaurant. There's all sorts of wonderful things in this city. Outdoor concerts, all the things that we look forward to as it gets warmer. But we're not there yet. And we can't get our hopes up the wrong way. We have to keep vigilant, disciplined, strong, resilient. This is what New Yorkers have done. And this is what we've done in other crises too, and we need to keep doing it. So, the point about doubling down is the strategy's working. Stick to it. Even as it gets warmer, you start to feel that pull, like you want to go do some of the things you used to do. Stick to the plan, stick to the strategy. Over time, we'll be able to give you more sense of how long this will be. I've always said, expect a tough April and a tough May. I'm still saying that. But what we'll do is with every piece of new information, we'll update you, give you a sense of what it means. But in the meantime, see the progress as an affirmation that you have done the right thing, and if you keep doing it, it's going to help us through this. Why are we telling you there's some progress? Well, this is about the facts. First of all, the ventilator use. We've talked so much about ventilators. They are life-saving. This is the way you ensure that someone, God forbid, they're in distress. This disease is close to taking their life, and a ventilator can save their life, help them keep breathing, help the doctors and nurses see them through. The question until very, very recently, just a few days ago, was would we have enough? And that was based on the fact that we saw some very clear patterns in the use of ventilators. And in the last few days, we've actually seen fewer ventilators needed than were projected. And that's very, very important. We expected a really deep intensification of this struggle. We expected the number of ventilators to keep being needed to be more and more going into this week. We've seen actually much fewer needed than we expected. Now, to be clear, we still need more, meaning that there's still each day more people who need them, but much less than expected. That's a good sign. The hospitalizations have stabilized. For a long time, that just kept going up and up. We're now seeing some leveling off, again, based on only a few days, but something good on that front too that's telling us something positive. And I want to be clear, we know that means we're not out of the woods. It's too early, it's too preliminary. But we'll keep telling you each day what the evidence is saying. So far, so good, but a long way to go. Now, the ventilators. So I want to just recap to you what was going on as recently as Sunday. I said then based on all the estimates we could put together, we talked to all the hospitals and looked at every pattern, all the facts, that at that point there were about 4,000 New Yorkers who needed to be intubated, who needed a ventilator to keep alive. And as recently as Sunday, we expected the number of new ventilators we were going to need each day to be 200 to 300, maybe even more. But what's happened in the last couple of days is that number has come down. And it looks like that number is more like 100 or even less in terms of the number of ventilators we'll need new each day. That's a striking difference. It's very early, it's very preliminary, but that is a striking difference. We thought we would need many more ventilators to come in this week just to get through the week. As recently as Sunday, I told you that we needed 1,000 to 1,500. A few days earlier, I told you we needed something more like 2,500 to 3,000. That's how different things have been day to day. We thought we'd need a huge number of ventilators just to keep the hospital system running, just to save the lives that could be saved. That number went down, and it's gone down again. Still a long way to go, but that is striking. Now, constantly over these last few weeks, I've appealed to the federal government, the state government to help us with ventilators. I want to be thankful, and I want to be clear that our call for help has been heard time and time again. So we got constantly shipment after shipment, including most recently 500 more ventilators from the state of New York. This now means we have a total of almost 5,500 ventilators available throughout our New York City hospitals of all kinds. We have a small emergency reserve of 135 that we're holding in case something has to be quickly moved to a place where the need is greatest. What it means for the first time in a while is that I can say with assurance that we will get through this week in terms of ventilators. We actually have enough to get through this week free and clear. We are not going to say that we can accurately predict next week yet. It's still too early this week to say that. But the fact that we have confidence we can get through this week is definitely a good sign. Now, there's some other things to report, and some of them are hopeful, and some of them are very, very tough and raise very important questions about what's really going on. But one that's good is when it comes to our public servants, our first responders, the people who we depend on to keep us safe. So many of them we know were out sick because of symptoms of the coronavirus or because they had a confirmed case of the coronavirus. And that has been something that caused tremendous worry. We were worried for them. They're our heroes. We wanted to make sure they came through okay, their families came through okay. But we also saw fewer and fewer of our first responders available on any given day, and people got very worried about what that would mean. I want to thank the NYPD and the FDNY for holding the line throughout this crisis, always coming up with another way to address all the challenges out there to make sure that the men and women we relied on were ready, always bringing in new first responders. Of course, the amazing effort to bring in paramedics and EMTs from other parts of the country. We're so thankful for that. But here now we're seeing something good start to happen, because I've said all along one thing that's true about our first responders is primarily they are younger and obviously very healthy people, and that meant that they could go through this disease quickly, thank God, in the vast majority of cases. And I'm not for a moment forgetting we have lost some of our first responders. Their families are grieving. But thank God for the vast majority. They've come through quickly and they've come through well. So the NYPD now reports that they have 276 officers who had tested positive who have now returned to duty. The FDNY reports that 1,310 EMTs, paramedics, and firefighters who either tested positive or were exposed to a patient who had tested positive or were suspected of having been infected. 1,310 of our first responders at the FDNY have returned to duty, and that's so moving. That's so important for all of us. So we're very grateful. But I told you there's also some things we're learning that really should cause real concern, and facts that now are clear. And we want to make it very clear to people of this city that as facts become clear, we're going to put them out. We're always going to make sure that we believe the information is accurate. But once it's factual, once it's clear, we're putting it out. So one of the things that's been discussed in recent days is, what do we know about who is being afflicted by this disease? Who are we losing? What does it tell us? Are there some larger realities that we need to look at here? The answer is yes, there are. Here is a disease that has hurt people, hurt families in every corner of our city. Let's be clear. Every community, every zip code has been hurt by this disease. Families are grieving right now across every part of the 5 boroughs. But we also now have information that points out that there are clear inequalities, clear disparities in how this disease is affecting the people of our city. the truth is that in so many ways, the negative effects of coronavirus, the pain it's causing, the death it's causing, tracks with other profound healthcare disparities that we have seen for years and decades in this city. So many people have struggled to get the healthcare they need who didn't have the money to afford the healthcare they deserve. So many people have lived with chronic healthcare conditions throughout their life, so often associated with challenges like poverty. We're seeing folks who have struggled before really being hit particularly hard by the coronavirus. Look, that's a blatant inequality, and we don't accept it, meaning we have to fight in new ways. We have to come up with new strategies to address what is now a documented disparity. As you're going to see, again, every community feeling this pain, some communities feeling it disproportionately. We're going to help everyone, and the strategies we have in place are meant, of course, to save the lives of New Yorkers across the board, every part of our city. But we're going to double down on the strategies that reach people who are the most vulnerable now, because we're seeing these very troubling facts. So here's what the information from our health department shows us. And this is preliminary information, but it is based on specific records, meaning, and this is a tough thing to say, but I want to make sure people understand the facts. This is based on death certificates. This is based on the work of our medical examiner's office and our Department of Health confirming that someone has died of a COVID-19 related illness, and that their specific background is documented. So what we've learned is that the deaths because of COVID-19 in this city, first and foremost, have affected the Hispanic community with 34% of the deaths. That community is about 29% of all New Yorkers in terms of population, but 34% of the deaths. And again, this is preliminary information that we'll keep adding to. It's hard to talk about this stuff like statistics. This means human beings, this means families, but we have to look in the face these disparities that we're learning about. So the Hispanic community, 34%. The Black community, 28% of the deaths, compared to about 22% of the overall population. The white community, 27% of the deaths, compared to about 32% of the overall population. The Asian community, 7% of the deaths, compared to about 14% of the overall population. This is painful to talk about, but we have to be honest about it. There's a lot more information that will keep coming out. As we have information, we can verify. We will keep making it public. But it already tells us something we need to know, and it tells us that we need to act. So now I want to talk about the plan that we will put in place immediately to address this information we now have about disparities. First, the first and most important element of the plan is to focus on our public hospitals in particular, and some other hospitals, some of our independent hospitals certainly as well, but first and foremost our public hospitals, because this is about the most essential concept of ensuring that everyone gets health care, regardless of their background, regardless of their zip code, regardless of their income. That has been the entire idea of our extraordinary public hospital system from the very beginning. We have the biggest, best public hospital system in America. It was always built on that New York belief in fairness and equality. We need to double down on that now. We need to ensure that our public hospitals get absolutely everything they need, because we know that so many New Yorkers who are in the most vulnerable communities, in the most danger, where do they turn to? They turn to our public hospitals. The most obvious example has been Elmhurst Hospital in Queens. We've all seen what's played out there. And the doctors, the nurses, all the healthcare workers, they have been the most amazing heroes, because whatever was thrown at them at Elmhurst, they held. They kept that hospital going. They handled an extraordinary number of cases. They kept saving lives. the public hospitals are the greatest guarantee we have that there will be fairness and equality in saving lives. And that's the single most important thing. Because we know, the blunt truth is we know a huge percentage of New Yorkers, no matter what strategy is put in place, this disease is here. It's going to reach a huge percentage of us, most likely over half and even more. So people are going to have to confront this disease. It's painful, it's awful that that's the truth, but that's the truth. But when they need urgent health care, when they need to have the best doctors and nurses there to save their lives, for so many people that means going to their local public hospital. And we must ensure that that hospital has all the personnel it needs, all the ventilators it needs, all the PPEs, everything. That's been the core of the strategy, and we gotta go even deeper into that strategy because that's where you literally save the lives that can be saved. The second is we're going to do a major campaign to educate people, to give them more and more detailed information on how to address this crisis. There'll be a multi-million-dollar ad campaign, a traditional media, digital campaign, focused on communities of color, focused on communities where English is not the first language. In fact, these ads will be in 14 different languages with a deep effort to get to folks who have gotten some of the word, obviously, but not all the information we want them to have so that we can further protect them. We're going to keep investing in this kind of effort to make sure we get much deeper into communities, including immigrant communities, with real valuable information about how to navigate this extraordinary challenge. Third, the media efforts, everything we're trying to do to educate people every day are crucial, but they certainly will not be enough. And now comes a part that's going to be very challenging because of the nature of this crisis, but we have to do grassroots outreach again. This is something we're going to develop over the next few days. We're going to have to work closely with community-based clinics where there are healthcare workers that have a deep sense of their own communities, who speak the language in every sense of their own communities, who have the relationships and the trust. We're going to have to find a way to get healthcare workers out into communities to educate people, to answer their questions, to help them address their immediate challenges, but in a way that's safe for those healthcare workers. We are absolutely, as you heard earlier, sticking by shelter in place, social distancing, but we need to find a way to get healthcare workers in a safe, smart, strategic way out into communities for direct communication with people in greatest need. So we'll have more on that plan in the coming days. Clearly, those healthcare workers will need to have proper protection, and that has to be absolutely secured for this plan to work, which is why we will continue all our efforts to bring in a huge amount of additional supplies to the city, PPEs, to protect all our healthcare workers and first responders and everyone who needs them. Fourth point is to deepen our efforts that have started, but I think they can go a lot farther. When you call 311, for example, there are many times when you're patched through to a health and hospitals clinician, a doctor or a nurse or another healthcare worker, who can answer questions and determine, for example, a lot of people call wondering if, because of how they're feeling, if they need testing. That's been something that people have been able to get through 311. But we need to deepen that and make it more possible for people to call just to talk through their situation more, to get more advice, and not just because they're wondering whether they need a test, but to actually have a dialogue with healthcare workers, again, in multiple languages, about what they're feeling, what's going on. Maybe it is not someone even just calling about their own condition. Maybe it's someone calling about their grandma, their grandpa. Maybe it's someone calling about their mom or their child. We need to create more of an opportunity for everyday New Yorkers, who many of whom don't have a doctor that's their everyday doctor, to get someone on the phone right away, a trained professional who can talk through the details and give them guidance. That has to be much more available, and that's what we're going to do. Now, to ensure that we protect that first key part of this plan, our public hospitals, We just need more help, particularly when it comes to personnel. The frontline healthcare workers have gone through hell, but they've held the line. They've been heroes in every way. Some of them have gotten sick themselves and been out. We look forward to them coming back healthy. We're praying for them, we're hoping for them, and for their families. But in the meantime, the many, many healthcare workers who are continuing to fight this fight, they have really borne the brunt, and they're tired, and they need relief, and they need support, which is why I've repeatedly asked for military medical personnel, and it's been a plea I've made to Washington repeatedly. We've seen some progress. We have almost 300 who have come in now out in our public hospitals. These are doctors, nurses, respiratory therapists, highly trained people, highly effective medical personnel, many of them with the kind of military experience that makes them very, very ready to handle the toughest situations. Almost 300 of them now deployed out in our health and hospitals, public hospitals. The Navy has sent healthcare professionals to Elmhurst, Bellevue, Woodhull, and Kings County hospitals. The Air Force has sent healthcare professionals to Lincoln, Jacoby, and Queens Hospital. I'm very grateful that our armed forces have come forward to help our public hospitals, but we will need more help, and we need it quickly. Now, let me talk to you about building out even more healthcare capacity for people who need it. And this is another area where there's some real progress, and we got to make sure we keep building. We're still working always from the worst case scenario to make sure that whatever happens with this disease, New York City is ready. So one of the crucial things, again, adding additional beds to relieve some of the pressure on our core hospitals. Last week, about 8 days ago, I was at the Billie Jean King Tennis Center in Queens. When you looked at it, then it was a bunch of tennis courts, indoor tennis courts. Right now, it is being converted into a hospital facility. We'll start receiving patients this week. We will convert 20 beds in the new facility to ICU care. And the total number originally was going to be 350 beds, will now be 470 beds. So this is a case of continuing to go faster, add more, to make sure we can serve people in need exactly when they need it. On the personal protective equipment, a lot of us didn't really use the phrase PPE before a few weeks ago, and now it's something we talk about all the time. We've gotten a lot more in to protect our first responders, to protect our healthcare workers. And yesterday we made a delivery out to the hospitals of this city. Over 3 million surgical masks, over 2 million surgical gloves, almost 1.2 million N95 masks. Over 100,000 pairs of eyewear, protective eyewear, 61,000 surgical gowns. It's very important that this material has come in and gone instantly out to the places that need it. And we're working hard every day to make sure each and every hospital gets what they need, distributes it effectively, constantly gets resupplied when they need it. But we have one urgent need, and that is these surgical gowns. I was at the Brooklyn Navy Yard yesterday talking about an amazing homegrown effort to produce them here in our city, a really heroic effort by companies in the Navy Yard and the folks who work there to protect all of our heroes. They're creating a lot of surgical gowns, but this is an area where we need a huge new supply. So we have asked the federal government for over 9 million surgical gowns to get us through April and into May. We are hopeful that we'll start to get deliveries from that request quickly. We need them even to get through this week. We need more. And we're going to have fallback options in place to make sure we can protect people this week. So the final thing I want to do is talk about some of the people who are stepping up. And even amidst the challenges, we see nonstop everyday New Yorkers helping each other, people feeding our healthcare workers, our first responders, businesses stepping up, amazing efforts. I want to keep talking about them because it's something people should be really proud of, and it's something that's helping to sustain us. And one that's very special I want to talk about today. because it's from a foundation that was born out of our city's darkest hour, and it's a foundation that means so much to us all. The Tunnel to Towers Foundation, born out of 9/11, symbolic of the strength and resiliency of our city. Tunnel to Towers has done so much for so many people, always there for our first responders and their families, now stepping up again. We've just heard of a $3 million pledge by Tunnel to Towers to help our healthcare workers. And I'm so appreciative. Yet another heroic action by that amazing foundation. Also, crucially, Senator Schumer has unveiled something important, the COVID-19 Heroes Fund. And this is an idea that would give the essential workers additional pay, up to $25,000, and would give a one-time $15,000 payment to healthcare workers, home care workers, first responders. This is an idea that needs to be made real to help those who are suffering the most. Keep reminding people, the federal government, we did see some progress in that last stimulus bill. We need a lot more. Spoke to Senator Schumer this morning about the next stimulus bill. I know he is proposing, to his credit, I know Speaker Pelosi is leading the way as well, that in the next stimulus there'll be money for our hospitals, there'll be money for food banks, money to support small businesses, not big corporations, small everyday businesses, and money to help localities and states that have borne the brunt. Obviously that means all of us here in New York and New Jersey especially. Crucially, Senator Schumer, Speaker Pelosi are focused on ensuring that all the cities and states that have lost not only lives, but they've lost so much of the resources to save more lives and protect people and recover, that those resources would be restored through a fourth stimulus bill, hopefully as early as this month. So I want to thank Senator Schumer and Speaker Pelosi for their leadership. Now we need to get the Congress to come back and pass that bill so we can still fight this battle and win this battle and then start on the road to recovery. Look, I'll finish just affirming the point that we all need hope. We all need hope, and when we see good news, when we see something that's working, we need to talk about it, we need to feel good, and we need to especially feel good that everyday New Yorkers built this progress with their hard work, with their sacrifice. Every one of you, when you're hearing today that we see some progress, you should feel that was because of you, because it was. And at the same time, recognize we're not out of the woods. It'll be a long time before we're out of the woods. We've got a strategy that's working. Let's go deeper into it. Let's double down so we can get through this together. I am confident, really confident, always felt in my heart that New Yorkers would rise to this occasion, and you have. You have in a remarkable way. Let's finish the job. It's not going to be days. It's going to be weeks and months, but let's finish the job. Just a few words in Spanish, and then we'll take questions from our colleagues in the media. Es temprano para sacar conclusiones completas, pero los nuevos datos nos dan esperanza en nuestra lucha contra el coronavirus. Sé que todos los neoyorquinos queremos que esto se termine, pero no podemos bajar la guardia. La distancia social y quedarse en casa está salvando vidas. Y tenemos que seguir aún más para salvar a más neoyorquinos. With that, let's turn to questions from the media, and please let me know the name of the reporter and the outlet.
Yeah, and just a quick reminder for folks, we have Dr. Barbeau in the blue room, and on the phone we have Dr. Katz, Commissioner Grillo, and First Deputy Commissioner Torres Springer. And with that, we have Shant from the Daily News up first. Shant?
Yeah, thank you, Mayor. Just wanted to get a little more info about the very troubling data about communities of color from you and Dr. Katz and Dr. Barbeau. Can you say what the understanding is now for the cause of this disparity?
I'll start with a very basic point and then turn to both doctors. You know, in the beginning of this crisis, we all were rushing to set up the ability to handle a huge number of cases. One thing we knew from the beginning, we saw it around the world, is that this is a disease that could escalate quickly, so we were securing the ability of our hospitals to fight this battle. But then as we got more and more information, and you saw the map a few days ago, and that was striking, and this new information is striking, it became clear that these disparities were real and sharp and needed to be talked about and needed to be acted on. One thing I think is clear, I've talked this through with our healthcare leaders, is that people who have had less healthcare available to them are more vulnerable. If throughout your life you haven't gotten the care you deserved, or if you've had pre-existing conditions that weren't addressed the way they could have if you had had more resources, because again, healthcare still in this country is based on how much money you have. And in this city, all of us have tried to change that in some very real ways, but there's still a reality that folks with more resources get more healthcare. So I would say the first thing to know is that, you know, there are a lot of people, particularly seniors, in communities of color that were more vulnerable because their conditions had not been treated the way they could have and should have if the resources had been given to them that they deserved. Dr. Barbeau?
So I'll add to what the mayor just laid out, which is something that I agree with. I think it's important for us to note that where we are seeing these inequities are places and populations that have historically had higher rates of underlying chronic illnesses. And certainly those chronic underlying illnesses put these individuals at greater risk for poorer health outcomes. The other thing that I will say, and you know, I think that we are still really digging into this is I am very concerned when I see the large percentage of Latinos who have died of this illness. And even though we have made lots of efforts to reassure people that all of our public hospitals see individuals independent of their immigration status, independent of insurance status, that you know, the overlay of the anti-immigrant rhetoric across this country, I think, has real implications in the health of our community. And certainly concerns about public charge are some things that I think we need to dig deeper into it. Commissioner Mustafi and I have spoken out about the importance of suspending public charge during this time. And I think, you know, it's something that, again, we will be digging into deeper to better understand. But the overall, you know, concerning aspect of this is the fact that these are communities that have had higher rates of underlying chronic illness, and that it's a reminder that these chronic underlying illnesses in peacetime, as the mayor has spoken about, contribute to higher rates of premature mortality from those chronic illnesses, but that in this particular wartime scenario are really very concerning for higher rates of mortality.
Dr. Katz, do you want to add?
I would just add to what the two of you have so smartly said, that lower income people also live more likely in multi-generational housing because of the high cost of apartment rentals in New York City. And so multiple families may be living together in very small spaces, which I think facilitates the transmission of this virus.
Yeah, and to finish, Sean, look, I gotta tell you, when I saw this, it made me very angry. I want to be clear. We're all trying to fight this battle and keep focused and keep calm in the midst of a battle that we must win, and as leaders we have to stay calm. But it made me angry to see that the disparities that have plagued this city, this nation, that are all about fundamental inequality, are once again causing such pain and causing people, innocent people, to lose their lives. It's just abundantly clear. It's sick. It's troubling. It's wrong. And we're going to fight back with everything we got. And right now, all we have to think about is saving the next life and getting through this crisis. But someday there's going to be a reckoning about what all this taught us. That obviously our nation was not in so many ways prepared, but more importantly even than that, I would say literally more importantly than that our nation has still not come to grips with the fact that healthcare is provided so unevenly and all based on how much money you have. And until we get to some form of universal healthcare, until that's the reality, this kind of danger will exist, not just when there's a pandemic, obviously in people's everyday lives. But you know what? We should be worried about the future. This is not the last time we're going to see a new disease. Here's a disease we never even heard of. It literally didn't exist 6 months ago, and now it's ravaging us. If we're really going to prepare for the future, we better recognize that if we don't create equality and fairness in healthcare, there's going to be people vulnerable always who didn't need to be.
Kathleen from Patch is up next. Kathleen?
Hi, Mr. Mayor. Can you hear me?
Yes.
Wonderful. I was hoping that we could talk for a moment about food disparity or food accessibility. You've said yourself that more than 500,000 New York City dwellers have lost their paycheck. NYPD data is showing that half of the thousands of supermarkets they're visiting are closed. Are you worried that New Yorkers aren't going to be able to access food? Is that something that your office is working to fix, and what would the potential solutions be?
Kathleen, I really appreciate the question. I'm very, very worried. I want to make this crystal clear. When I announced a few weeks ago that Catherine Garcia would be our food czar, it was explicitly because I saw a gathering storm that with so many people losing their income, in the first weeks, you could presume people might be able to get by. But with each passing week, it's getting harder and harder. And yes, I'm glad there was that money in the stimulus to help people directly, but it's not that much money in the scheme of things, and it's not in people's pockets yet. So I'm very worried. When you're not talking about a few thousand people, you're talking about 500,000 people who lost their job. And very soon, that is going to mean more and more people who cannot find a way to pay for the food they need. So I think you make a really good point that if supermarkets are shut down, thank God there are a lot still going, and I want to thank the supermarket workers, the grocery workers. These are folks who are doing something really heroic too, and we got to thank them. Thank the pharmacy workers, all the people out there making sure that the basics are available for people who have enough money to pay for it. Thank God those workers are there making sure that people get what they need. But I'm worried about more and more people literally not having any money at all to pay for food. The plan that Commissioner Garcia is putting together is for a large-scale feeding effort, a large-scale effort to feed hungry New Yorkers, such as we've never seen before. I hope that when it comes down to it, it won't be as bad as we fear, but we are preparing for a very large-scale effort. That will be a priority in everything we do, where we put our resources, where we put our energy, our focus. Making sure people have food is going to be a central priority. We haven't felt the fullness of the danger and the need yet, but I unfortunately believe it is coming. So that means the initial efforts. We're doing expanded home delivery of food to seniors and vulnerable folks who can't get out of their houses. Anyone can call 311 and sign up for that, who is one of the folks who is vulnerable. They can get that. We announced last week that we are now at 435 sites. Schools that were previously just providing food for kids are now providing food for any and all adults who need it. So I just want to make this crystal clear. I was at PS1 in the Lower East Side yesterday. Any adult in New York City can go to one of these 435 sites and get 3 meals for yourself and as many family members as you have. You can ask for it. If you have a household of 5, you can say, I need breakfast, lunch, and dinner for 5 people, and they will give it to you. It's going to be available all 435 sites. It's high-quality food. I saw it yesterday with my own eyes. I saw the food service workers who are also doing valiant work. They want to make sure people are not only fed, but as quality, nutritious food. So they're out there doing that. You can call 311. You can go to nyc.gov to find those locations. So that's going to be crucial, a part of the equation. But I think we're going to even have to go farther than that. We're definitely going to be supporting, in a variety of ways, local food banks, food pantries, to keep them going. And then just keep building from there. My order to Commissioner Garcia is whatever it takes to feed New Yorkers, whatever the expense, whatever the effort, no matter how many city workers it takes, no matter how many volunteers it takes, we're going to do it.
Julia from the New York Post is up next. Julia?
Julia?
Julia, can you hear us?
Hey, Mr. Mayor, how are you?
Good, how you doing? Julia?
Julia, we can't hear you.
You're going to come back?
Yeah, we'll come back to
Okay.
her. Yoav from the city is up next. Yoav?
Hi, Mr. Mayor. I wanted to ask, you've made it clear beforehand when we've asked about the racial and ethnic data that providing the data was of secondary concern to saving lives. But here, in response to producing the data, it's clear that the city is taking steps that are intended to save lives. So why weren't you able to do that beforehand? Because clearly the data is important in determining how the city responds. So why was it secondary? Why was it secondary in nature? You've always said you can walk and chew gum at the same time. Why wasn't that possible here?
Because we're all walking and chewing gum on many, many levels. This is nonstop crisis, and everyone on the phone with me here and all my colleagues are working nonstop. The concern, and Dr. Barbeau can speak to it, is the health department was very concerned that there be something verifiable, that you have to make sure there was enough evidence, that it was confirmed, that we not put out something that was unclear or not based on enough data. So that is absolutely crucial. If we're going to tell people something, we better damn well be right about it. Also, as I said, what's happened out there is more data we'd like to be able to provide, and some of it is been hard to get as clear as we'd like, because in a crisis atmosphere, I assure you that folks at the front line are not focusing on, recording data when they're trying to save lives. So there's been real crisis dynamics that have mitigated against getting the kind of data we would in peacetime. And then there's been real concern to make sure that what we had was accurate and consistent and enough evidence over what's really been just weeks. Now that we believe it, that we really have something hard and fast, it's telling us what we got to do. But as I said in the beginning, the one thing that was unquestionably job one and remains job one for folks experiencing the disparity and everyone is to protect the hospital system. That's where the overwhelming majority of our efforts were going, to protect and build up our hospital system, and that was more important than anything, because that's what every New Yorker needs. Dr. Barbeau?
So to build on what the mayor laid out, I think, we've been focused on having complete data, and I've spoken before about the fact that our reporting is only as good as the quality of the data that we get in. And it's been a challenge to work with hospitals who are overwhelmed with patients in the intensive care unit, on the floors, in the emergency department, to focus on the more granular importance of data. And as I've said in the past as well, we've then resorted to alternative data sets in order to augment the data that we have, meaning that, we're going directly into electronic health records at hospital systems because we recognize that, as the mayor laid out, these folks are overwhelmed with taking care of patients, but it doesn't take away from the importance of needing to know this information. And so the other thing that I will say is that, in spite of all of those efforts that we've made to have complete data, the percentage of reports that we have in terms of race related to people who have died from COVID-19 is slightly less than 2/3. So we're still dealing with incomplete data. But I think it's important to note that we are, as the mayor likes to say, not making perfect be the enemy of good. And so we are not waiting until we have 100%. We are acting now. There are other aspects of our data that we are also looking to improve the racial demographics of, but again, it is an ongoing effort in collaboration with the state as well as with our healthcare partners.
Back to Julia. Julia?
Hi, can you hear me, Mr. Mayor?
Yes, Julia.
Hi. So I found the numbers you gave on the ventilators very interesting. That we were projecting we need 300 more, but we're only needing about 100 more. Could you give us kind of similar numbers to show how hospitalizations are, either leveling off or down? And then I'm just wondering if you could follow up on what you said on TV this morning, that you think that the statistics for folks dying at home, which are overwhelmingly being driven by coronavirus, should be included in the official death toll. Do you expect that to happen soon?
So on that one, look, it's a very, very painful reality. I just want to say, imagine what a family goes through, struggling to help a loved one and obviously hoping and praying that something will pass and then suddenly someone's gone. It's just horrendous. But the numbers speak for themselves. I've been over this with our health colleagues, that this used to be a very, very rare thing in New York City. And suddenly it's jumped up. And obviously the only thing that's changed is COVID-19. So the health department knows what they're doing, but what I would say as a layman is let's just assume that with this kind of increase, the vast majority of these are related to COVID-19, directly, indirectly, and start counting them. And I'm sure the health department, can figure out what's the right way to do that. But I think it would be more accurate to just acknowledge what is, to me, a growing truth. On the question of the hospitals, I'm saying stabilization because I think it's fair to say that the hospital admissions numbers and people going in and out of ICU, there's still a lot of variability there, meaning we get data, but again, what we're finding from a lot of hospitals is there's a lag in their data because they are first and foremost focused on saving lives, and the data is a little bit uneven for that reason. Also, the improvement we've seen is only over a few days. So I think the word stabilization is right to say that for a period of time, we were seeing a constant increase. We're not seeing that now. I'm not clear yet if we're in the territory of any kind of sustained reduction. The ventilator piece is actually, in some ways, much clearer because it's a real finite number. It is specifically about people who are intubated, people in those ICUs. We can literally know how many ventilators are out there, and we can get very quickly updated on how many are in use. So that one, where we thought it would be 300 more each day, and it's looking like 100 more each day or less, that's striking because that moved rapidly in a matter of days. Again, I want to see a lot more days and weeks before we draw any firmer conclusions.
Dave Evans from ABC7 is up next. Dave?
Mayor, this is Dave Evans. Can you hear me okay?
Yes, Dave.
Yeah, I just had a question about antibody testing. And I know it's a state function, but I wanted to ask you because we are the epicenter of this crisis. And the governor talked about it yesterday. Dr. Birx talked about it this morning. They call it a game changer. I just wanted to see if you see it the same way. And my other question about this is, since we are the epicenter, has the FDA, the CDC, has anyone in the federal government contacted the city to see if we can start moving in that direction? I mean, how in the world are we going to do all these tests? And do you see it as a possible game changer?
Yeah, it's a great question, Dave. I'll start, and Mitch, who's obviously thinking about this from the perspective of the frontline hospitals and their heroic employees, and of course, Oxir is thinking about this in terms of the whole city. They'll join in. So I think it's a big deal. I think that the first thing that I understand about the antibody testing is it's not here yet in the kind of numbers we would ideally want. So I want people to understand that with everything with testing, and testing has been sort of the big problem, the big X factor through this whole crisis, is anytime people are wishing for testing, the most important thing to understand is, does it actually exist in the numbers we need it to or not? Right now, the answer is no for antibody testing. But at some point, and that might be, in weeks, that might be in a month or two, you could have antibody testing available on a much bigger level. I think it would be very, very helpful because to begin with, it would help to strengthen the folks who are doing all this heroic work in the hospitals and the first responders if they knew for a fact they were exposed to this disease. And, we all presume that means some immunity. It's not a perfect equation, Dave. I'm sure the doctors are going to say this, that there's no one who knows the answer yet on this question because there's still so much about the coronavirus that there's no one on earth has definitive answers on. We don't know for sure that if you've been exposed to it, it means you cannot get it again. It seems likely that if you've been exposed to it, you wouldn't get it again this year, this season. But we don't know that 110%. But we know enough to say it would sure as hell be helpful if people knew. It would give them a lot more confidence and would tell us a lot. So I'm hoping that's something that could be a big part of the strategy when it's really available on a broad level. I think the bigger point about testing is what we should have had in the beginning was universal testing. It's one of the really crucial strategies we've seen that had worked in the world. It clearly was something the federal government did not have ready, did not provide. Somewhere in the future, universal testing could be part of the way out of this crisis, but it's still clearly, again, the numbers aren't there yet, and they won't be there for a while. But that's something we should be focused on as one of the potential ways to recovery. Mitch, you want to start with anything you want to add?
I think you've gotten all the big points. I know, Mr. Mayor, that you yourself spoke with the head of the FDA, Dr. Hahn, about having enough access to these tests, and they've indicated that they will facilitate it. There are tests that are on the market from other countries that have been developed. Only one has been approved by the FDA so far. The state is interested in using a different one at their state lab. But as you say, I think the most important issue is getting the reagents. Having an approved test is no help if we can't get the reagents to perform it. I think that will change in the next week or two. And I do believe that it could be a game changer. As you say, we won't be able to assure people that they're immune, but we certainly will be able to say to them, look, you've been exposed to this virus and your body successfully dealt with it. And I think that will give people a sense of confidence that they don't need to be as fearful.
Yeah, and Dave, just a quick thing to add before Oxiris. So I want to give real credit to Dr. Steve Hahn, the commissioner of the FDA. Mitch has talked to him a bunch of times. I've talked to him. He's been incredibly accessible and really trying hard to speed approvals. And I'm a layman, but I think we could say FDA was never known for speed historically. I've been really pleased at how responsive he's been and how much they seem to get it now, that they have to move quickly if they're going to be able to help us in this crisis.
So what I'll add is I think we need to remind ourselves of a very fundamental question, and that is, what are you going to do with the results of an antibody test? And so I agree with Mitch on the individual level that it can help in a number of different ways. However, when we think about what we're going to do with the results of those tests at the population level, I don't think we know enough yet about what it means with regards to immunity. The concept of herd immunity is something that I think as a city we've become familiar with through the experience we had with measles. But the reality is, what does it mean to have a whole group of people who may potentially be immune? We just don't know enough about that. We don't know enough about how long that immunity remains. And so I think we just need to temper our expectations about in what arena the use of antibody testing can be a game changer. I think there's a distinction between at the individual level and at the population level.
Aaron from Politico is up next. Aaron?
Mr. Mayor, hi, can you hear me?
Yes.
Okay. I heard what you spoke to earlier about, communities with a history of disparities being the worst affected here. I'm wondering if you could speak more specifically to the Hispanic community, since it seems like in the city specifically, they're the largest share of deaths. I've seen a lot nationally that the Black community has been the worst affected. So is there a reason why we're seeing this particular effect in the Latino community here?
I'll turn to Dr. Barbeau because obviously the statistics come out of the health department, and she has been for her whole life focused on fighting healthcare disparities and with an obvious focus on the community she comes from, the Latino community. But I think just first of all, it is a huge community in this city, getting close to 3 million people in terms of total population. And second of all, I think it's fair to say language means for some people they're not getting as much information as they need, and we want to keep addressing that aggressively. And then immigration status, what's happened in the last few years has really driven a lot of immigrants, undocumented in particular, but even folks who are documented, has driven them away from a lot of the places they would have turned for support and for health care. And that's another story that I think will come out as this whole painful history is looked at. I think that's another one of the reasons here, Doctor.
And so to add to what the mayor laid out, I think fundamentally what we're seeing across the country relates to the additional burden that poor people have in terms of dealing with underlying chronic illnesses, either because of their insurance status and the additional burden of co-pays, a whole host of reasons that we typically talk about with regards to what we call the social determinants of health, but that in reality translate into the impact of where we live, work, learn, and play has on our ability to address and manage underlying chronic illnesses. And so I think what we may be seeing here played out, which is also being seen in Chicago, LA, and other places, is that cycle of those underlying drivers to poor health outcomes, essentially on steroids because of the acuity of this virus. So that in combination with issues related potentially to immigration status and the mixed immigration status households that we have here in the city, I think there are many potential contributors to why we may be seeing the disparities and inequities in this particular situations. But clearly, I think we won't know fully until we have more data. And, as I've said before, and the mayor has said before, we're not waiting until we have perfect data. We need to act now in urgency. And it's a reminder that it's not just about what the health department can do. It's not just about what the healthcare delivery system can do. It really is about what all sectors of civil society can do to contribute to the ongoing improvement and slowing of the spread of this virus. And that, the work that's been put in place and being led by Commissioner Garcia addressing food has implications on not just, everyday survival, but on people's ability to manage their chronic underlying illnesses, what we're doing around housing, etc. All of that plays out in terms of how successful we are in beating this COVID-19, which obviously we're all engaged on and as a team in doing so.
Go ahead.
Gloria from New York One is up next. Gloria.
Thank you. Mr. Mayor, I have two questions, but if you could indulge me, I want to give Dr. Barbeau an opportunity to talk about the data in Spanish, especially for our Spanish-speaking viewers. I want to make sure that they're getting a chance to hear this information in their language. If she could summarize what you have found up until this point, and also talk about the campaign that the city's putting together to reach those communities. And then I have two questions for you, if I may.
Okay, wait, Gloria, I need you to tighten that up a little bit just because we're trying to have a same standard here. So absolutely, Dr. Barbeau will give you the Spanish summary, and I will describe the campaign a little bit more, which we're just putting together now. Let's stay there, and we'll do that. And if you can, I'll give you one follow through right now on that. Is there anything else you want to add to that?
Sure. If I could ask you if you have an update for us on whether correction officers and inmates have received masks. We're getting some reports, including from some folks in the union, that they have not.
So I'll be quick, and then Dr. Barbeau will do the quick summary in Spanish, and I'll come back and just clarify the new initiatives we're putting in place. So the Corrections Department, for the officers who require any form of mask or face covering, yes, that has been sent and will be continued to be resupplied as needed. And for inmates, the same. For, again, folks who, I think Dr. Barbeau confirmed this, if someone is infected and doctors in correctional health want them to be wearing a mask, they'll do that. For other people, it's the same thing as for all New Yorkers to wear a face covering. All of that has been sent and will be resupplied as needed. You want to do the Spanish summary?
Yes. En términos de lo que estamos observando ahora, en términos de las cifras de personas que han fallecido por causa del COVID-19, lo que estamos notando es que los latinos están falleciendo más que cualquier otro grupo en la ciudad. Y esta información nos preocupa y estamos lanzando una campaña de información para asegurarnos que la información de cómo lidiar con el COVID-19 llegue a nuestra comunidad. Esta campaña va a estar lanzando esta semana y también vamos a estar colaborando con nuestros colegas en otras partes de la ciudad para asegurar que los servicios y la atención médica le llegue a personas que estén en necesidad.
Thank you, Doctor. So, Gloria, on the other point about the campaign, so all of these pieces are going to be laid out individually as they're starting. Of course, the first part, the most important part, the continued support for the public hospitals, that we've been updating you on constantly. The ad campaign, we'll be unveiling those ads, again, TV, radio, digital, print, 14 languages. We'll be unveiling that shortly. The grassroots outreach is something we're going to do that's new, and we have to figure out, again, a way very quickly to work with the community-based clinics and to figure out how to get healthcare workers out in the appropriate, safe way. So that's something that's literally being put together over these next few days. We'll announce pieces as they are ready. There'll be a texting element of this, which is important and is something that we've seen to be helpful in other countries, continuing to communicate with people who need information by text. So that's something that will be a part of it. And then the phoning a clinician, as I said, we already have a good experience with this with 311, with folks who are trying to get information about testing, and they got an opportunity to talk to a clinician directly to determine if they actually were someone who had a priority need for testing or not. We have definitely found that people can talk to an actual human being with medical training. It makes a big difference. We want to go deeper now. We're going to figure out how to do that through 311 and make clear that there will be enough clinicians available. But what I want to get to is the point that we really feel confident that anyone who needs to talk stuff through in multiple languages can have that kind of back and forth with a clinician to make sure that they know if they do need to get to a healthcare facility, to know how they can handle their own situation. But I also think, crucially for family members, I think this is one of the missing links we have to address. Family members who are trying to figure out how to take care of a loved one properly while also protecting themselves, who a lot of times are just doing what they would do historically, just taking care of someone. We want to help them to take care of their loved one, but also be safe doing that and having someone they can talk that through with. So those are elements of the campaign. Each piece will be unveiled very quickly as they are ready to go public.
Katie from the Wall Street Journal is up next. Katie?
Good morning, Mr. Mayor, and good morning, New York. My question for you and the administration and everyone there, you laid out the longstanding disparities here in the city in certain communities, particularly immigrant communities and communities of color. Last week or 2 weeks ago, Dr. Katz noted the lack of hospital beds comparatively to other boroughs in Queens, which is the most diverse county in New York City. My question for you is, knowing this pandemic was coming and seeing it as far back as January, what did you and the administration do to ensure that these vulnerable communities had better access? We're hearing now today on, almost in mid-April about grassroots outreach. Why wasn't this done before or earlier? Why weren't community-based organizations and health centers engaged earlier? It just seems to be a little late compared to how quickly this is moving.
Look, this has been a hugely moving target, first of all, this entire reality of coronavirus. There's no one alive who has experienced a pandemic on this level. The last one was 100 years ago. So everyone's been trying to rapidly figure out strategies to address something that's just beyond anything we've ever known and beyond anything we ever could have imagined, honestly. The fact is, from the first time we started talking about it, Dr. Barbeau, Dr. Katz and I, our folks at Emergency Management, our deputy mayor, everyone was saying, one, to start warning people was coming and that we were putting in place the strategies to protect ourselves, which meant reinforcing our public hospitals and getting them supplies, getting them ready for what was coming. It meant a lot of public education, which we were doing constantly, and Dr. Barbeau has led the way on in multiple languages. A lot of the foundation was laid, but the notion of the kinds of strategies it was going to take, we didn't have I don't think anyone had a perfect plan of when you were going to go to each piece and how to prepare people in advance for each piece, because we have never been here before. What we do know is the kinds of outreach we used to do, which we would have done immediately, couldn't be done in the first instance, meaning sending healthcare workers out door to door, having a deep grassroots effort. You couldn't do it. One, you had the challenge, of course, of shelter in place and social distancing, but two, everyone was needed in the hospitals. In a few weeks ago, we were projecting that not only would today be as bad as it is, but it would be much, much worse, and every healthcare worker was going to be needed in the hospitals and then some. All the PPEs would be taken up there. Again, we're not out of the woods, but we are seeing an improvement in our PPE supplies. We are seeing more and more medical professionals come in. The notion that we actually could get people out into the communities that the need is greatest is not impossible now, as I think it would have been even a week ago. So it's a very dynamic situation. We're learning from experience what we need to do more of, as in every situation. I understand your question, I really do. but I've also watched everyone trying to stay ahead on the most basic level, and that was protecting the hospitals. I can't say it enough. This has been a conversation over weeks and weeks and weeks. At all cost, protect the hospitals, surge everything we had into them, particularly the public hospitals. And only now are we even able to think about using our personnel in some different ways to try and go at some of the real specific problems, the deep problems that we're seeing emerge.
And Mr. Mayor, if I can
Please.
add to that, I would say that we from the beginning have engaged our partners both in the healthcare delivery system, hospitals, ambulatory centers, but also our CBOs to deliver much needed information. We've done a lot of outreach with regards to the ethnic media. I think what we're talking about now is using the data and adjusting our approach to add yet another layer. I think none of us could have anticipated, and we said this from the beginning, not only how the virus behaves, but then how are New Yorkers behaving in terms of what we're asking them to do. And this is an acknowledgement that we then now need to leverage those same partners that we used at the beginning in a different way.
Matt Chase from Newsday is up next. Matt?
Olivia, thanks a lot. Mr. Mayor, doctors, good morning. I'm wondering, how exactly is your staff calculating the numbers of ventilators needed in New York City? Can you take us through the specifics of the models you're using, the assumptions you're making? I'm not asking for a general or kind of conclusory statement that you use models. I'm asking you specifics. Basically, please show us, or rather tell us your work.
Yeah. Matt, it's a good question. I think it's pretty straightforward. A regular survey of each of the 56 hospitals to understand the exact usage. That has been deepening. Obviously, the team that Jimmy O'Neill has put together is directly in the hospitals, working with the leadership of the hospitals, working with the people who are managing equipment and supplies. That's giving us, very, very tight, consistent information. And it's the number of people intubated, cross-checking against that. So one part of it is literally the number of machines. The other part of it is obviously the number of people on the machines. And the supply side of the equation is straightforward because the supply comes in to central warehouse and we act from there. So I think it's as straightforward as that. We are asking very specifically, direct into the hospitals, how many people are intubated today, how many ventilators are you using, how many ventilators do you have left, and constantly rechecking that count. That's how we're doing it.
Bridget from WNYC is up next. Bridget?
Good morning, Mr. Mayor. I wanted to make sure that I understand some of the challenges associated with some of this new data that the city's providing related to the demographics of some of the COVID deaths. I spoke with an emergency care doctor in Brooklyn who had talked to me about how the city has a regional health information exchange and that all of our electronic medical records collect this racial and ethnic demographic data so that this is information that the city had. So can you or Dr. Barbeau explain, is it that the health department needed to start doing something differently, or why was it not possible to publish this information sooner? And then on top of that, when you do begin releasing more information about some of those home deaths that are presumably related to coronavirus, will you also release the race and ethnicity of those deaths as well?
I'll start and pass to Dr. Barbeau. Look, anywhere where we have definitive information, the answer is yes. So the home deaths are, again, a painful, awful reality for those families. Clearly, ultimately, each one will have the information. And when we confirm a death in New York City, yes, we do know the background of the people involved. And when that gets factored in, as it should, to the COVID-19 deaths, will absolutely provide the data. I think the other piece is do not underestimate the part I'm telling you about trying to be careful to draw conclusions when we thought we actually had enough information to speak to. This is, as I said, the last month has felt like a year, but we're the first case, not the first death, and someone can check my facts, I believe I'm right. The first case was March 1st. The first death was a while after that. So we're really talking about a universe of about 3 or 4 weeks, and most of that has been the last couple of weeks. We had to be really careful to make sure that we were providing accurate information based on enough to go by. And I think that's really important, because otherwise it could have been something that did not represent a bigger reality, and then that would have been misleading. And the other point, which Dr. Barbeau can go into much more specifically, is there are some kind of data that they do not feel the health department they're getting full data on yet. And some of that is because in the heat of battle, the folks who normally would keep the data and collect the data, one, just are busy fighting, busy trying to save lives, and two, the flow of information has been disrupted compared to normal times. And there's other factors as well, but it's not as simple as the information that we would normally rely on is happening as quickly and reliably as normal. Go ahead.
So yes, I think the most concise answer that I can give is we have had to do a lot of new and different things with regards to data that we've never had to do before. And it speaks to the way in which we have all needed to adapt to our new reality. And so in that, we have approached the regional health information networks and tapped into them. There are some networks where that was a fruitful endeavor. There were other networks where there were technical issues where it wasn't as easy as just tapping into their RIOs. And so we needed to then make arrangements to go directly into their electronic medical records. I think the point is that all of that is work that needed to be accelerated. There were technical issues that had to be addressed, as well as legal issues. I think that we are in a much different place now. And my hope is that when we begin reporting on the probable COVID deaths, that we will be able to similarly report on the racial demographics as well.
And just finishing the point, I just got the facts provided to remind me. The first death, and this again is such a painful reality, but also just a shocking statement on the time and how long each day has been for all of us. The first death was March 14th, so literally 25 days ago. So that's the world in which we're dealing with, that the information we have is based on a very brief period of time. But again, now we believe it is unfortunately enough information to say that there's this clear disparity, and that tells us something that we can act on.
Jeff Mays from the New York Times is up next. Jeff?
Hey, good morning, Mr. Mayor. Just wanted to ask about the preparations regarding the potential disparities. You announced on January 24th that it wasn't a matter of if, but when the virus would arrive in the city. So, what was done in those weeks leading up to March 1st during the first case, especially if the city knows that these disparities are existing? Was there not a plan put together in those beginning weeks to address that potential disparity? And then secondly, you ran on ending a lot of inequality in New York City. I'm wondering if you could talk a little bit about whether your efforts were focused enough in the healthcare area in terms of inequality to help end some of these disparities that are causing these deaths now.
The first point, the whole point of going out early and saying that it was not if but when was to try to do the thing and achieve the thing that really could have protected people so much more deeply, which was the testing. And for weeks, and this is all very documented, the whole idea was to try and get the federal government to send the testing that would allow us to get ahead of it while there was still a chance. And then it quickly turned into a nonstop effort to get the aid we needed from the federal government to prepare our hospitals, sustain our hospitals, the ventilators, the supplies, now more and more the personnel. the point about education, I don't think it should be missed. And I want to really make clear the health department's been doing this nonstop, that the education about how to handle this virus, how to protect yourself and your family has been nonstop for weeks and weeks and weeks. And it has been focused on all communities. The health department, in fact, by its nature, historically focuses on communities that have gotten less health care and less support. So I think you go back and look at all the messages, all the efforts made to educate and inform people, get them help, to help people know where to turn. There's a huge amount that was done, but it's quite clear now we have to go to another level, and we have to do some things now that we would never have been able to do a few weeks ago. Like I said, the grassroots outreach would have been unthinkable a few weeks ago. It's still going to be tough now. We still would have to have enough medical professionals in the hospitals to allow for that. We'd have to find a way to do it safely. But if we could get more in-person activity out there, it would be, in terms of healthcare professionals being out in communities, it would be, I think, profoundly helpful. So I think it's quite clear there's been a huge amount of communication, huge amount of direction given to people, huge amount of guidance in multiple languages to many, many communities. Now it needs even more, and we will do that. On the other question, Jeff, the battle against inequality takes many forms. And I think what Oksira said a few minutes back is really important. There's a deep connection between whether people have affordable housing or not and what happens to their health. There's a deep connection between how much money a family makes, including working people. Do they have decent wages? Do they have things like paid sick leave? Do they have paid family leave? All of these things contribute. Obviously, you're talking about a combination of income, benefits, housing, all of these things that come together, food, to say the least, making sure people have available food and nutritious food. So, and we see all that interconnects with education, all the pieces come together. So from the beginning, what we've tried to do is do, bluntly, a massive amount of redistribution of wealth to help working people and help poorer people, to the tune of tens of billions of dollars. And it's quite clear. All of the things that we did, whether it's massive amount of affordable housing or subsidizing people to stay in their affordable apartment or rent freeze, that kind of thing, straight on through to all the food-oriented programs, all the efforts to increase wages and benefits, $15 minimum wage, paid sick leave, all of those things contributed to try and get people healthier and address the disparities. But then on the pure healthcare front, a lot of the efforts and initiatives that have been supported at the health department, including, the fight against tobacco, for example, which clearly is pertinent here, but also what we did a year and a half ago with guaranteed health care, creating for the first time in this city the notion that every single New Yorker would either be given an insurance plan that they could actually afford and use, or given direct health care through NYC Care. That, to me, is a kind of initiative that gets really even deeper to the root of the matter. We worked on that for years. We were finally able to get it to be something that could work in this city about a year and a half ago, and now it's being implemented. And lastly, and crucially important, health in hospitals was nearing collapse a few years ago. It was nearing bankruptcy. And we put a huge amount, billions of dollars, into restoring health in hospitals. And Dr. Katz and his team have done an amazing job turning it around. I had no idea, Jeff, at the time that we were putting those billions of dollars into the turnaround of health in hospitals, that they would be, the vanguard of fighting off a pandemic, that the eyes of the entire world would be on places like Elmhurst Hospital. I couldn't have imagined that in a million years. But that's exactly what happened. So all of those efforts were based at fighting disparity and preparing to have a more fair and equal city, and especially to get at all the pieces, including the healthcare pieces. And we didn't know we would confront this, to say the least, But thank God we invested in health and hospitals, because it's the only reason they're able to hold the line now.
Last two, Henry from Bloomberg. Henry?
Hello, Mrs. Mayor. How are you?
Good, Henry. How you doing?
On this ethnic disparity, these statistics, I'm struck actually by how close they track to the city's demography. Yes, there's disproportionate impact, which can't be surprising to anyone who has eyes and ears open. There's institutional racism, there's social disparities, but when you look at Chicago, where 68% of the deaths have been experienced in the Black community, which represents about 30% of the population, that's disparity. And the question that is in my mind is whether or not these city statistics, given the reality of racism, are actually accurate, or whether the disparity is much worse than this data would indicate. That's one question I have. The second question, which relates to it, is how much is the city's network of community clinics engaged in this pandemic? We hear nothing about all of this work that was put into community care and decentralizing care outside of the hospitals. Where is the surveillance there? Those are my two questions.
Yeah, no, they're good questions. I appreciate it, Henry. On the community clinics, again, I think in a situation that went from something like normal to total wartime in the period of a few weeks, this was an element of the equation that was really important, but it was hard to focus on, to be truthful, when we were first and foremost trying to save the hospital system. And I really need people to hear this point. There was a period there where it looked like our hospital system across the board could be overwhelmed. And again, we're not out of the woods. We are not out of the woods, to say the least. But there was a period just a few weeks ago where the numbers were tracking very dangerously, that even with all the reinforcements we could bring in, our hospital system might not be able to hold and might not be able to save every life that could be saved. That's where we just put supreme energy and effort, because that was what mattered most, was saving those lives. And the local clinics were not in that immediate equation, obviously, and a lot of them were disrupted by shelter in place. They were disrupted. Their economic reality was disrupted. Now we want to go back and try and build out more of a grassroots strategy. Now that, at least, thank God, today, we're in a better position to hold and maintain and strengthen our hospital system. This grassroots piece becomes more powerful. We've got to go back and work with those clinics to see how we can do it. But again, I'll be the first to say, if God forbid there's another surge where our hospital system needs the help, then everything's going to go back that way. But if we continue to get some breathing room, figuring out that grassroots effort absolutely involves those community-based clinics, and it makes their role more central again, and that's what we would love, to get them in the game and provide them the resources to do that kind of outreach the right way, the safe way. Some of it can be done remotely, but some of it really can't to be effective. To your very good question about the disparities. Look, I don't want to talk about the pain other cities are going through. Some of the numbers we've seen, both the loss of life, the cases, but also the disparities, are just disgusting and troubling and deeply, deeply un-American, really. I don't want to talk about their pain and their challenges. I do want to talk about something that's right about New York City. I think here we have the strongest public health system in America by far. We have the strongest health department. We have the strongest public health system with health and hospitals by far. We also have these amazing community-based health providers, which, like everything else in the nonprofit world in New York City, is just much, much deeper and richer per capita. I'm not just talking about grand total. I'm saying per capita. This is a city that's always believed it's been a compassionate place since well before Franklin Roosevelt and the New Deal. This was a city that put a huge amount into those community nonprofits and the charities and all the organizations that did such important work at the community level. And I think that means that even with real disparities, our disparities are nowhere near some of the other places that just don't have anything like that, or some of the cities that don't have, cities and states that don't have particularly expansive public health capacity. It's just a real profound difference, and something New Yorkers should, even in the middle of this crisis, should be proud of, that we've always invested in things like this. We've always invested in helping people at the grassroots. I think this information we've given today is today's information, Henry. Meaning to say, as we get more, we're going to update people. As we take into account those home deaths, I think those will probably add something to the disparity. I don't know that yet, but I think that. But I think it's not going to be a massive change. I think the template you're seeing here is likely to be pretty consistent. I don't think it ever is the kind of thing you're talking about has happened in a few other cities. But we will keep updating it. And if the numbers shift, because the facts shift, the reality, the human reality is shifting, we're going to talk about it. We're going to talk about what it means. But this today is the best information we have. We'll keep updating it from there. Doctor, anything you want to add, or is that covered?
It covers. The only thing I will add is that of all of the indicators that we track in public health and that we are tracking in this response, the number of deaths of people who have passed because of COVID-19 documented by test is probably the most pristine. And as we add, as the mayor said, the number of individuals who have died from likely COVID-19, I think it may end up showing a somewhat different picture. I don't think, as the mayor says, it will be that much different, but I just want to draw the distinction between a piece of data that is fairly absolute versus a social political construct that is inherently biased, if you will. There is no definitive way on how to collect someone's race, right? If you look at my name on paper, you would never think that I was Latina. If you saw me and I didn't say anything, you might think that I was white, and I'm not white. And so there are inherent biases in how we as a country categorize people, but we shouldn't lose sight of the fact that we are focused on every day saving lives, and that if there are communities, and this is the very definition of addressing inequities, if there are communities that need that much more, then we use our data to drive what, in addition, we provide to those communities so that we can continue to save lives.
Thank you.
Last call, Mary from the Brooklyn Eagle. Mary?
Mary?
Thanks for. Hi, can you hear me?
Yeah.
Yeah, hi. I have two questions. The first is the city considering doing random sampling at various spots around the city to see what percentage of people who may not even know they have the virus have it? That's my first question.
Well, say them both. Say them both.
Oh, okay. And the second one is a totally different one. I know the city is not in charge of the post office, but we've received reports here in Brooklyn of an awful lot of people not getting their mail or getting it only very sporadically. And in the main post office on Cadman Plaza East, a large percentage of the delivery people are out for various reasons. They only have like 6 out of 60 left. So do you have any word on the mail delivery service, getting them personal protection equipment, anything like that?
Great question. So I'm going to, we do not run the post office. That is a very true statement, but I want to speak to it. On the random testing, random sampling, I'll pass to you because that's something I've not heard said like that. But let me say on the post office, look, we all depend on the post office. If they're in trouble, that affects us all. We got to figure out how we can be helpful and how the federal government can step up too. So if they're having that kind of a problem with their personnel, we're going to certainly talk to the folks from the Postal Service to see if there's something we can do. Now, we got to first take care of, obviously, so many other people, our first responders, our healthcare workers. As I said, people like grocery workers, pharmacy workers who need whatever they need. But if we can help postal workers as well, we certainly will. But I'm also going to push the federal government to step up in that because that should be their first responsibility. They're in charge of the Postal Service. Bottom line, we have to protect those workers. We're all depending on them. Dr. Barbeau.
So on the random testing, I think that the concept of random testing is more useful in the very early stages of responding to an outbreak. And unfortunately, we were hampered by the fact that the testing at the federal government level was really not readily available as early as we would have liked in order to have done that early surveillance. I think that the concept of testing will take a different level of importance as we get to the other side of the apex, but it's probably too early to start talking about that just yet because we don't have a good sense in terms of what the overall distribution and availability will be of tests that are being slated for approval.
Okay, thank you very much, Doctor, and thank you to my colleagues and everyone. We obviously have a lot of updates that will be coming up on things we've talked about here, but we're going to be very, very careful to constantly update you on what we're seeing, the things we talked about now, the ventilators, the hospitalizations, all the trends. Again, I'm happy we're seeing a little bit of progress. I don't want any overconfidence, anyone jumping the gun, anyone taking their foot off the gas. Let's stick with what's working. New Yorkers should be proud of the fact that your efforts are working. You are the heroes here. Stick with the shelter in place. Stick with the social distancing. Double down on it. That's the best way for us to overcome this virus. Thank you, everybody.
I wanted to briefly update everybody on a few things that have happened over the course of the last few hours, the last number of days, but none more important to me than to express appreciation to our National Guard, the men and women of the National Guard that took two C-130 planes, flew them to Illinois, one into New Jersey, New York area to provide 100 ventilators for the needs of the state of Illinois. Those in New Jersey, another 100 in the state of New York. Those same men and women, different group within the National Guard ranks now are deploying additional ventilators in Delaware and D.C., in Maryland, and driving, as we speak, driving into Nevada 50 ventilators for each of those states. I just want to thank them in particular because the National Guard have provided not only the kind of humanitarian support that's demonstrable in that example, but also continue to do heroic work at our food banks all throughout the state of California. And in addition to that, we've got 100 of them that just went out on the lines to prepare for this this summer's fire season that is close upon us. They're doing vegetation management, forest management, and so I cannot express enough my gratitude, my respect, my appreciation to our National Guard. I also wanted to update all of you on a significant effort that we have advanced on PPE. So much attention, not just on N95 masks, on coveralls and gowns, on shields, on surgical masks, gloves, and the like. We have been doing our part over the course of the last number of weeks to punch above our weight. We've been able to secure over 41.5 million N95 masks and distribute them throughout the state of California. While we've had a little support from the national stockpile, we haven't relied on that. A little over 1 million N95 masks have come from the strategic national stockpile. 41.5 million have been distributed throughout the state. And it's a way of emphasizing that all of us are working, in some cases collaboratively, in other cases across our respective jurisdictions and sometimes against each other in the open market to compete to procure through a supply chain that is global more PPE. In some cases, we've been actually competing against the federal government. You've seen price gouging. You've seen a lot of mishegas. I made this point the other day about one of our deliveries on the border into Texas, and a lot of the masks were moldy and had to be shipped back. And so in an effort not to play small ball, in an effort to really organize to meet the audacious goal that we had of over 500 million PPE that we announced a few weeks back based upon our modeling, we decided to retool our efforts, refocus on our vendors, refocus on our supply chains. And we're very pleased that we're able to formally submit to the legislature yesterday a request to utilize money from our disaster response emergency operations account that would allow us to invest over $1.4 billion into PPE of all stripes and do so in a way that secure the anxiety that many of us have, not just the healthcare workers in the state of California within the hospital systems, in our community clinics, in our skilled nursing facilities, adult daycare centers, but also our grocery workers, our DMV workers, the frontline employees walking the streets, doing outreach to the homeless, people knocking on your doors to do wellness checks, to basically provide for the amount of personal protective gear that is needed in totality. And so as a consequence, we made a big, bold bet on a new strategy, and it is bearing fruit. I'm going to ask the director of the Office of Mercy Service to walk through a little bit more of the details and how we're going about this, what our supply chains look like, the consortia of nonprofits that are part of this, a private company here in the state of California that really stepped up with strong relationships in China to help us with those direct supply chains. It's a logistics operation that is quite extraordinary in its magnitude in terms of the number of flights that have to come into the United States, the partnerships that have been formed, not just with nonprofits, but organizations like the Asia Society that have been helpful, other private sector partners, both here in the United States, but substantively overseas, and of course FEMA in their incredible work that they've done in collaboration with the state of California to get these contracts procured and to get the commitments of roughly 200 million masks alone. And I specifically point to the masks, the PPE. It's broader than that, but the masks, of course, being so topical, roughly 150 million N95s on a monthly basis and 50 million surgical masks on a monthly basis that we believe with these contracts, multiple contracts and multiple sources, we'll be able to bring into the state of California and procure and begin to distribute at a scale that we haven't been able to date. So with that I want to ask the director of the Office of Emergency Service to come up. He'll fill in the blanks on some of the details of that strategy. I just want to note I have deep respect and gratitude to our partners as well in the legislature. We submitted a $495 million formal request for the first tranche of payments on the over $1.4 billion of procurement for these efforts. That is not an insignificant amount of money, but we're dealing at a time where we need to go boldly and we need to meet this moment without playing small ball any longer. And we need to coordinate and organize our nation state status as we can only in California with our procurement capacity that quite literally is second only to the United States itself. California is in a position not only to leverage those supply chains, leverage our investment, but do so in a way that protects the taxpayers as well. And so with that, let me ask the director to come up, fill in the blanks, and of course we'll have ample opportunity to answer specific questions. But after he speaks, I'll go into a series of other issues that I know are topical and important to everybody that may be watching. Thank you.
Great. Thanks, Governor. Good morning, Mark Ghilarducci, the Director of the Governor's Office of Emergency Services. Let me provide some contextualness to this effort. The Governor's mentioned the challenges that we've faced with getting the PPE and the competition that had existed. What we try to do is really step back and look at this in a much more strategic way. And we really leaned on the way we actually manage major events that happen in California, like when we have wildfires or earthquakes, when we've got limited kinds of resources. We lean back on those procedures and those protocols to be able to build a more sustainable pipeline of resources coming into the state. And so really this has been an effort of building a multi-pronged approach to achieving the objective of getting to the multi-million number of masks that the governor has mentioned. Let me kind of break that down for you a little bit. The different prongs and different approaches. The first is engagement with a number of very, very powerful and very, very helpful non-governmental and community-based organizations. We've really engaged with organizations like Direct Relief, AmeriCares, the Philanthropy California, and the California Endowment, and Frontline. These are NGOs that have reached back. They have relationships in Asia. They've been doing work in different spaces, may not necessarily be exclusively PPE, but for example, in the climate adaptation and resiliency space, or in the public health and space. We've leveraged all of those partnerships and relationships to build into using their pipelines to leverage those to help us. So that has been a source of ongoing PPE, particularly masks, but it's also shields and gowns and other kinds of commodities, both in real time and in our effort to build in the out weeks and the out months additional PPE. The second prong has been through working with direct contracts. We've established a number of contracts with large vendors that have been able to provide the PPE that the governor mentioned already, 41 million masks that we've already distributed. We continue to get the commodities from companies like Bear Mountain Development and JR Resources. These are examples of some of the larger firms. We've also been able to get from our national health providers like McKesson and Cardinal some of the kind of commodities we need. And yesterday, we were able to establish a agreement with a company, California-based company called BYD America, which really has a direct reach back into China to be able to build a pipeline, a sustainable amount of monthly masks that will be coming in to assist us here in California. This is an organization that has a manufacturing capability that is specifically designed to meet this need. And this is a great partnership because it is a California-based company, and it's also one that we have been working with, again, in the area, in the climate space. The third prong that we're approaching and have been working with is closely with our partners at FEMA. And this has been in kind of three different areas. The first is that FEMA has worked hard to establish partnerships with the 6 of the nation's largest medical distributors, including McKesson and Cardinal and United Health and Owens, to be able to go to Asia and procure huge quantities of PPE. And these flights are coming into the United States now regularly. Some of them are coming into California. And as part of that effort and setting up that air bridge, and as part of the national effort to prioritize counties with high probability and or high hotspots that are occurring across the country, in the top national 100 counties, there were a number of counties that have been identified here in California for immediate supply of PPE. And I can tell you, they include Los Angeles County and Santa Clara, San Diego, Orange, Riverside, San Joaquin, San Francisco, Alameda, Sacramento, and San Mateo. And it's not just random. This is closely coordinated with where we're seeing the greatest number of cases that we have to manage. And that doesn't mean that the rest of our counties in the state are not going to get PPE. That means that as through the process of the national program, through the leveraging of these big pharmaceutical corporations, hospitals that normally procure through those particular entities will be able to get PPE that will be available, and they will use their normal process within those counties as prioritized counties. The last piece that we've been working with FEMA on is leveraging a new piece of technology. This is a technology that was manufactured by Patel, a defense contracting company in the United States. It's a technology that is designed to get on the ground and actually bring in a used N95 mask and do a sterilization and cleaning process that makes them basically new again. And this is new technology that has been certified by the FDA and CDC, and it will be here in California here within the next week. This capability will have the ability to clean up to 80,000 masks per day. So what this does is that we will work a coordinated effort with our hospitals and first responders and being able to utilize the PPE that has been used that meets the criteria. We'll bring it to this center. The center will then sterilize these masks, and we'll be able to repurpose them again back in the field again. So to sort of close out, there are a number of different efforts that are happening simultaneously. These are all sustainable. They will meet our needs in the short, medium, and long term. And it is, as the governor said, it's leveraging the power of California's buying capability. It's leveraging the great relationships we have with many organizations and agencies to build the capacity that we need. And as the weeks go on, we'll provide additional updates on how all of this continues to progress. This is not a silver bullet. There are always challenges in anything that we are attempting of this scale and scope. But we believe by putting in the various checks and balances that we have and the great partnerships that we have in place, this will be successful moving forward. Thank you.
Thank you, Director. So it's about sustainable pipeline of commodities, and we think we are in a very different place than we were just a week or so ago. I want to congratulate the Director and his remarkable team for organizing a new construct and a new approach to getting adequate PPE. And as I said, it can't come sooner, particularly now with new mandates across the state as it relates to face coverings, employer mandates, not just consumer mandates as it relates to those that may be purchasing food or essential supplies and their need to also have appropriate face coverings. The big concern has always been a run on masks that would impact our healthcare delivery system and our first responders over the course of the next few weeks. We believe that will substantially be addressed. But again, one should be very cautious in this space. We have been sober, I think, about the last few months of what appeared promising and didn't necessarily materialize, but we, I think, are in a very different place, and the size and the totality of these new contracts and the $495 million first distribution of resources gives you, I think, a sense of the magnitude of this approach and how comprehensive we believe we are. As always, and we made this point from the outset here today, when the state of California has excess capacity, working with our federal partners, working through the SNS, the Strategic National Stockpile, we will avail ourselves to others in need. And that includes not just ventilators, but certainly would include issues related to PPE. So as we scale up, as these supplies arrive, as they become, as we see more certainty, we'll be in a much better position to help support the efforts of others in partnership, again, with FEMA and those doing procurement and appropriately resourcing that procurement on an as-needed basis to parts of this country that are most in need. So that's broad strokes where we are on the PPE side. Very good progress, and it cannot, again, come soon enough. Also wanted to give you an update, a progress report on the total numbers of positive COVID-19 cases in the state of California, the ICU numbers, the hospitalization numbers, update you on the number of deaths, but also to update you on the disaggregation of data that we are finally getting and receiving and organizing as it relates to the issues of race and ethnicity. And I'll give you a progress report on that in just a minute. But let me give you the numbers first in the aggregate. 16,957 individuals that have been tested positive for COVID-19. 1,154 in our ICUs. That represents a 4.2% increase from the previous day. 2,714 individuals that are hospitalized in our system. That represents a 3.9% increase from the previous day. Sadly, we had one of our highest death rates in the state so far, and that was 68 individuals that passed away over the last 24 hours. We now have 442 individuals that have lost their lives tragically, 442 families torn asunder since this virus hit the state of California. Our hearts go out to all of them, particularly on today, Passover. And so I want to just extend our deep sympathies and empathy for all of those struggling and suffering from not only this moment, but then the deep impact losing a loved one is having on families, large and small, all throughout the state of California. Now, as it relates to disaggregation of data, a lot of attention is appropriately being placed, as it always must be placed, on the issue of disparities. It's the cause, again, I said this yesterday, that unites many of the folks that work here in the state of California. They come to public service because of a deep desire to right wrongs and deal with systemic issues. Nothing more frustrating than the systemic challenges, the disparities that manifest in relationship to public health. And those issues preceded this crisis, and they continue to persist even within this crisis. I made the point yesterday as it relates to access to testing. I made a prospective point looking into the future about access to treatment and vaccines and how we must always have a lens of addressing equity in that context. And I assure you, we are having very deliberative conversations in that space. But here are the new numbers. I mentioned 16,957 individuals in the state of California that are currently tested positive. That's 16,957. Within that, as a subset, that we've been able to disaggregate. We're only at 37.2% of that number that have reported in. And I can assure you, we have 10 people, no less than 10 people that are calling coroner's offices, calling hospitals, double checking data. Not every city, not every county is providing that data in real time, but we're trying to work with those that have, make sure that we scrub that data. I said yesterday I wanted to wait till all that data was presented, but understandably people are eager for transparency in real time. So as I said, when I said to my daughter a month before we formalized some of the announcements around public schools that I needed to be honest with all of you, as I am with my own children, let me tell you what we know based on the 37% of the data that we've been able to disaggregate and confirm. We have 6,306 cases that we've been able to analyze on the basis of race, looking within that as a subset that we've been able to disaggregate. We're only at 37.2% of that number that have reported in, and I can assure you we have 10 people, no less than 10 people that are individuals in the state of California that are currently tested positive. That's 16,957. Within that, as a subset, that we've been able to disaggregate. We're only at 37.2% of that number that have reported in, and I can assure you, we have 10 people, no less than 10 people that are calling coroner's offices, calling hospitals, double checking.
That means an awful lot to a lot of people right now. We've also worked with the Department of Elder Affairs in Florida, has worked with the Florida Restaurant and Lodging Association for meal delivery services for seniors. So typically they would do about 45,000 meals statewide. Just here in Miami-Dade, they're doing 50,000 meals. That's in a daily basis. So we really appreciate what they're doing to support our seniors, and obviously talking to the mayors here. I know they've done a lot to protect the senior populations, and we want to keep doing all we can on that. The other major component to what we've been doing from the beginning is there was really a need to expand testing. When this started in February and in early March, the testing was scarce. So we've worked really hard to expand that in the state of Florida. We'll have probably by, it may even be by now we may have the results in, but certainly by probably the end of the day, we'll have over 150,000 tests completed in the state of Florida, and that will put us as one of the top states for testing. The state of Florida and the Florida National Guard have set up 7 drive-through testing sites, many of them in Southeast Florida, so that individuals could go through, get tested, and know whether they're positive or not. And that's important, and those drive-through sites are important. Getting tested at the hospitals has been important too. But the way these labs have worked, sometimes it takes days to be able to get the results. And so if you're somebody who is a healthcare worker, you kind of need to know right now whether you're positive. If you're a senior in a nursing home and you're in a hospital with symptoms and they test you but they don't have results, well, are they going to put you back in the nursing home? They got to keep you in the hospital. So understanding who is positive quickly is important. So we were able to, working with the White House, get a number of this new Abbott Labs tests delivered in the state of Florida over the last week to many of the hospital systems here. This is a rapid test where you would go and you get a positive result in 5 minutes. And so that is huge if you're talking about protecting the healthcare workforce, if you're talking about conserving hospital space, if you're talking about protecting seniors. So right now, the hospitals that haven't had them, we've worked with the hospitals that do and asked if they would shift resources. So I know Cleveland Clinic has shifted some of these machines to Jackson in Miami. Spoke with Mayor Gelber about the hospital here. We're going to work with getting them access to this rapid test because I think it just improves outcomes. It improves our ability to handle this so well. The Florida Department of Health also has had a number of these machines delivered, and so those are going to be deployed strategically in areas where you have a lot of cases.
while it may be flattening, beginning to flatten, the fatalities are going up and sadly will continue to go up. As we do every day, we mourn with the families and friends and co-workers and neighbors of those who we have lost. Our flags continue to fly at half-staff and will continue to fly at half-staff in solidarity with them, so that our whole state remains cognizant of this tremendous toll this pandemic is taking on our New Jersey family. Think about this, over 1,500 lost lives, and sadly that number will continue to rise. Here are just a few of the wonderful New Jerseyans we have recently lost. First up is Joe Hansen. There is Joe. For more than 20 years, he served the riders of NJ Transit as a conductor on the Raritan Valley line. His son Brian followed him into the rail yards and is a mechanic for NJ Transit as well. This picture is of Joe with his grandchildren. He was just 62 years old when he passed. By the way, I'm 62, so that's a wake up for yours truly. His wife Denise and the entire family is in our thoughts and prayers. God bless Joe. To call Jerry Lynch a Belmar icon still couldn't capture his essence. We lost him too at age 91. Jerry was the founder of the Belmar St. Patrick's Day Parade. I had the honor of meeting Jerry. In his youth, he performed on Broadway. He had an incredible voice. In fact, he appeared with Ray Bolger for you Wizard of Oz fans, Dave. I'm looking at you. But then he settled at the shore and was the owner of Lynch's Hotel. He served on the Belmar Board of Education, was president of the Kiwanis Club, remained a loyal member of St. Rose's Church, and gave himself fully to his community. He leaves a large family, headed by his wife Frances. He will be sorely missed and long remembered. Richard E. Barber Sr. Wasn't there as Richard was a senior deacon at the First Baptist Church of Lincoln Gardens in Franklin, Somerset County. Since his youth, leading civil rights protests in Greensboro, North Carolina in 1960, he had dedicated his life to the cause of social justice and community empowerment. He was a past president of the NAACP of New Brunswick, a deputy executive director of the National NAACP, and served as the regional administrator of the Small Business Administration under President Jimmy Carter. He founded numerous community-based organizations. He too was sorely missed and will not be forgotten. And I know my friend, Reverend and Pastor Buster Soares, is brokenhearted right now with the passing of Mr. Richard Barber. And again, let's repeat the point that Judy and I made yesterday. We're only early stage in honor and respect of Mr. Barber. We're only early stage in getting a full handle on the racial toll that this is taking. But the early data points are that we may be seeing a similar reality in New Jersey as we're seeing nationally and elsewhere that communities of color are paying a higher price. Again, as we get the data and get more comfortable with it, we will be very clear with you in terms of how we see that headed. Again, these are just three of the wonderful New Jerseyans we have said goodbye to. There are many, many more whose stories deserve to be told and celebrated and remembered. Each one was a precious, blessed member of our family. But now, what's our job? Our job is to continue honoring them by continuing all that we're currently doing to flatten the curve and to slow the spread of illness. We cannot let up. Tonight especially is the first night of Passover. More on that in a moment. Traditionally, families and friends and entire congregations indeed would gather for the Seder. Some of Tammy's and my favorite memories, particularly with the Jewish community and then with other faiths with us, not just in New Jersey, but in our prior life in the Federal Republic of Germany. Some of those Seders were some of our favorite memories. But stealing from the four questions, tonight is different from all other nights, as are all the nights of Passover this year. I cannot say this strongly enough. We cannot gather together There cannot be large community seders or gatherings, either, by the way, indoors or outdoors. We will have to get creative to come together virtually so that we can gather together again someday soon in person. Folks, let's remember one thing as a general matter. This is not specific to Passover, but it certainly includes Passover. It will include Easter. It will include Ramadan. It will include every minute of every day. This is a war that we are fighting on two fronts. And I said this the other day. It's both Churchill's never have so few done for so many, and at the same time, the symmetry of so many doing for so few. On the many side, on what we can do, the 9 million of us, we have got to stay home and stay away from each other. It brings me no joy in saying that during Passover, Easter, Ramadan, or any other moment, but that is the only way out of this. We have got to stay home. And at the same time, the other front of the war is Judy and Christina and Pat and all the others who are aggressively and heroically building out and sustaining our healthcare capacity. And so you've got two lines, the lines of those infected, which will lead to the lines, Judy, of those hospitalized, and in turn to the lines who will require critical care, and sadly to those whose lives were lost. That's one line. The other line is our capacity, beds, healthcare workers, the heroes, ventilators, personal protective equipments, the right drugs that we need. Our plea, our challenge, our mission is that both of those lines cross at a reasonable rate, at a reasonable date, at a level that we can sustain. Again, what we can do, the many of us, all 9 million of us, is to stay home, stay away from each other, flatten the curve aggressively. Don't let the warm weather or the holidays fool us. We are in the fight of our lives, and we remain in the fight of our lives over here. And while we do that, we allow our healthcare professionals to build out the capacity to get relief from that bullpen for our heroic healthcare workers. And God willing, those two lines cross at a level and at a date that we can manage within our system. That is our collective challenge. Those are the two fronts of the war in which we find ourselves. The story of Passover is a story of strength and perseverance and ultimately deliverance. So we must exhibit these traits today, throughout Passover and every day until this emergency ends. And to our family members of the Jewish faith, bless you. Hag Sameach and Pesach. Hag Sameach, Pesach. To each of you, bless you. We wish you a happy Passover. We know it will be the most unusual one of your lives. May you all be safe and healthy. And our job is, while this one may be really unusual, is to stay home, stay away from each other, so that next year we may be able to say in a big room like this or at a big table together, Hag Sameach Pesach. And Easter, by the way, comes on Sunday, April 12th. Ramadan comes less than 2 weeks later on April 23rd. This is not just Passover. This is those holidays as well. This is every minute of every day. And as I noted yesterday, when the time comes that we can begin to put this emergency in the rearview mirror, please God, do not think that we're going to be able, again, please don't get upset about this, but we cannot think that we're going to be able to get back to normal all at once. It is going to take time to reopen our state and indeed our country in a systematic and careful way to protect against a boomerang of coronavirus. If we open up too soon, I fear we are placing gasoline on the fire. This is not a situation where when the lights go out, you go to the basement and flip the main breaker and the whole house gets powered back up. We're going to have to go room by room, carefully and methodically, to make sure we're doing it in a way that is smart and that it keeps us safe. So I ask you again for your patience, not just for the days and weeks ahead as we work together to flatten the curve and come down the other side, but for the weeks that will undoubtedly follow as we carefully begin to get our state back open again. And we will get there. Let me say that unequivocally, assuming all 9 million of us, including yours truly and my colleagues, assuming we all do our job, and we will get there. We'll come through this together as one extraordinary New Jersey family, stronger than ever before, not without casualty. We've already seen that. The blessed lives lost, not without mistake, I'm sure, and not tomorrow or next week, as much as I'd love to see that. A couple of announcements, if I may, on testing. The PNC Bank Arts Center in Homedale is open today. It began at 8 a.m. Today, April 8th, and it will go to its capacity of either 500 tests or 4 p.m. Tomorrow it will be closed, but likewise, this is the on-again, off-again. Bergen Community College will be open tomorrow, April 9th. If you go on our covid19.nj.gov and you look for testing sites, you'll see, according to Brady O'Connor, we now have at least 54 up and running around the state. That's both government-sponsored by ourselves or counties as well as private. As was mentioned yesterday, and Pat gets a lot of credit here, California Governor Gavin Newsom has availed 100 ventilators to New Jersey. Those ventilators arrived last night and are currently being prepped by Colonel Callahan's team. So I want to say, as I said last night in a television interview to Governor Newsom in the great state of California, New Jersey cannot thank you enough, and know too that we will repay this favor. We are all in this together, and we will support our fellow Americans at every step of the way, just as they are supporting us in New Jersey. Thank you. While I'm at it, I want to give a shout out to Senate Democratic Leader, Minority Leader Chuck Schumer and Speaker Nancy Pelosi on their call today for an additional $150 billion in direct financial assistance to states to help us mitigate the impact of this emergency on our budgets. I was just on the phone a few minutes ago on this very topic with Senator Bob Menendez. To be sure, we're going to need more than that, a lot more than that, and we will need flexibility to not only cover lost revenues, but to also meet unprecedented needs. But this is a good next step. And again, our state is probably like a lot of households right now, expenses that are challenged and rising, and income and revenues that are falling. The American people and our businesses rely upon states to deliver essential services to them, and we need to come out of this emergency in a strong position to ensure our state's recovery and our national recovery. Next up, switching gears, I'm signing 3 executive orders. First, a poorly kept secret. I am moving the date of our primary elections from Tuesday, June 2nd to Tuesday, July 7th. This is being done for 2 simple reasons. First, we want to preserve the possibility that improvements in the public health situation will allow for in-person voting, and delaying the primary by 5 weeks increases the likelihood of that. And 2, if failing that, we eventually have to make the move to a statewide all vote by mail election, which has never happened before, by the way. We must make sure our systems are able to handle that. That task becomes easier with an extra month of time. Our democracy cannot be a casualty of COVID-19. We want to ensure that every voter can vote without endangering their health or their safety. And I don't want a Wisconsin and saw yesterday where folks had to pick between exercising their right to vote on the one hand and protecting their own personal health. The second order I am signing will further our aggressive efforts to enforce social distancing. And this one, if you think that for some reason, just because the curve is beginning to flatten, that we're out of the woods, this executive order will disavow you of that. All non-essential construction across the state will cease indefinitely, effective 8 p.m. Friday. Exceptions to the shutdown include projects at our hospitals and schools, in our transportation and utility sector, the building of affordable housing, other individual housing sites that can adhere to strict limits on the number of workers on site at any given time, emergency repairs and work needed to safely secure a construction site, and other limited instances. This same executive order also aims to mitigate the instances we have seen of overcrowding at essential retail stores and most notably in our supermarkets. All essential retail must indefinitely limit the number of customers in their stores to 50% of their approved capacity. And if we don't see adherence to this, you can assume, as we have had with other steps, that 50 will go down. And they must do more than that. Customers and employees must wear face coverings. Stores must also provide special shopping hours for high-risk individuals, erect physical barriers between customers and cashiers and baggers where practicable, and regularly sanitize areas used by their employees, among other requirements. Things you've heard us preaching, Judy, for the past several weeks. This is codifying all of that. These restrictions that I have laid out must be followed throughout the state. No municipality or county may impose additional restrictions of their own on essential retail businesses. This is one set of rules for everyone in New Jersey. Additionally, this order will also put greater protections in place for the workers at our warehouses and in manufacturing. No one should be working where social distancing isn't being practiced to its fullest extent. Now, again, I want to say something very clearly. We are not running out of food or other items, period. Our supply chain is feeling the stress, but it is holding strong. We are taking the step to protect both customers and essential workers. Ensuring social distancing may require you to change the times in which you go to the store, but that's a small price to pay to ensure the health of your community. My third executive order will increase the weight limits on our interstate highways and toll roads from 40 tons to 46 tons for trucks carrying COVID relief supplies. We have this flexibility because of the major disaster declaration we received from the federal government, and we will keep our supply chain moving. Other news. This morning, Judy, Pat, myself, along with Senator Cory Booker, Major General Jeffrey Milhorn, Lieutenant Colonel David Park of the U.S. Army Corps of Engineers, Major General John King of the 5th Army, Adjutant General Jamal Beal, and others toured the 500-bed field medical station being set up at the New Jersey Convention and Exposition Center in Edison. I want to also give a shout out to our brothers and sisters in labor who helped get that up and running so quickly. This is the largest of the 3 stations being stood up in our state. And we express our thanks to the U.S. Army Corps, the federal administration, our in-state hospital networks, state police, Department of Health, and others for their partnership in getting these stations up and ready to serve patients. Here we go, some pictures. While these sites are preparing, and again, this is a bigger one, it's similar, it looks very similar to the one that we toured in Secaucus, but twice as large. While these sites are preparing to go into service, I know Judy would want me to say this, we have a critical need for volunteers with direct medical experience, and specifically, the Department of Health's immediate need is for people with experience as a chief nursing officer or chief medical officer, physicians certainly, respiratory therapists, that I think is the top of our list, to help lead these field medical stations. And I should note that these positions would be paid. So we urge you to contact us through our volunteer portal at covid19.nj.gov/volunteer. And as we have stated before, in addition to the field medical stations, we have undertaken aggressive efforts alongside our hospitals to increase their bed capacities. So far, our health systems and independent acute care hospitals have already increased their potential bed capacity by approximately 60%, and they continue to explore other creative solutions for expanding further. And Judy stressed this earlier on a call today. The creativity being exercised by our hospital systems is truly outstanding and by their extraordinary workforce. A couple of examples. Over the past several weeks, Hunterdon Medical Center has increased its bed capacity from 178 to 366 beds. I believe my math says that's a 93% increase. Hackensack Meridian Health, I mentioned I was on the phone with their senior leadership on Monday, and its hospitals have more than tripled negative pressure beds from 278 to 869. And at Hackensack University Medical Center, critical care capacity has gone from 48 to 191, and other areas of the hospital have been converted to create more than 70 non-critical care beds for COVID patients. And we will continue, and this is all under Judy's guidance and leadership, to pursue every possible avenue to expand our capacity. And again, I tip my hat to the extraordinary health care systems in this state and the creativity that they are exhibiting. Additionally, same church, different pew, our online portal is now open for people with experience in a variety of technological areas. And for those who wish to join our team at this time, please head to covid19.nj.gov/tech, covid19.nj.gov/tech. So for all of you COBOL programmers in particular, now is your chance. And we are also cognizant of the many reports of overcrowding on buses and other issues being reported by NJ Transit riders, and we mentioned this the other day. A direct link to NJ Transit's feedback form is now available on the covid19.nj.gov page. Get there by searching NJ Transit. By the way, speaking of covid19.nj.gov, just to give you a couple of data points of how useful this is turning out to be for so many users so far, this is as of yesterday, over 2.5 million. Sessions, over 4.5 million. Page views, 8.66 million. On the Business Information Hub, again as of yesterday, users, 429,000. Sessions, 644,000. Page views, over 1.5 million. Live chat conversations, almost 14,000. And finally, on the Jobs portal, users, 461,000. Sessions, 599,000. Page views, 1.2 million plus. Employers who have posted openings, 614. Jobs that are posted, folks, don't forget covid19.nj.gov, 49,018 jobs posted right now. Switching gears again, I want to shout out a couple of our corporate citizens who continue to step up to help out. First, I want to thank PSE&G, who's advised that they'll be making an additional donation of 200,000 gloves for use by our public health and safety responders. Page views, 1.2 million plus. Employers who have posted openings, 614. Jobs that are posted, folks, don't forget covid19.nj.gov, 49,018 jobs posted right now. Switching gears again, I want to shout out a couple of our corporate citizens who continue to step up to help out. First, I want to thank PSE&G, who's advised that they'll be making an additional donation of 200,000 gloves for use by our public health and safety responders. We remain grateful to them, so to Ralph Izzo and team, thank you. Second, I want to give a shout out to Wawa. They had heard about our need, with a heavy heart, for refrigerated trucks to help take the pressure off our morgues and funeral homes in protecting the bodies of those loved ones we have lost. Yesterday, Wawa sent a 53-foot refrigerated truck to Bergen County, which, as we know, has been so hard hit. The fact that we even have to prepare for the unthinkable is, on one level, extraordinary, but having a corporate citizen like Wawa ready to step in to help is invaluable. I want to say that Judy's going to hit this in more detail. I want to just say that we've said this, I think, almost every day for the past couple of weeks, long-term care facilities continue to be an area of high focus for us. And we didn't just get to this focus on the past couple of weeks. I remember coming back from a trip to Germany and Israel and going straight off the plane to Wanakue to talk about the tragedy there. That was October of 2018. And from that, a law that I signed was the Outbreak Response Plan, which is the first of its kind in the history of our state. And Judy will go through the broad elements of a state plan that is meant to take that, that outbreak response plan and add a lot more fuel to it. There was a directive, I know on March 6th that you put forward. We continue to focus laser-like on this. This is a particular area of concern, not just in this outbreak, but based on that experience of a year and a half ago, our concern then was preemptively of any outbreak. And our hearts go out to the folks who are losing loved ones everywhere, anywhere in the state, but in particular in long-term care facilities. I was just on with Bob Russo, my dear friend. He and Christine in Montclair. His mom, Florence, passed on Monday night. I think she was about to celebrate her 101st birthday. They're not even sure necessarily it was COVID-19 that ended her life, but she was in one of these facilities, and our hearts go out to everybody, not just the lives lost, but the folks who are trying to loved ones and family and employees, by the way, and everyone associated with these facilities. Before I hand, and again, Judy will have more on that, not just today, but in the coming days. Before I hand things over to you, may I refer to a couple of heroes in our midst, if that's okay? You all have been great sending us your stories and the stories of your communities by using the hashtag NJThanksYou, and we ask you to keep doing that. The spirit of community is what's going to get us through this. First, take a look at this picture. On the right, that's Zanyulin Red. She is an ICU nurse working the COVID floor at St. Peter's Hospital in New Brunswick. On the left is one of the respiratory therapists she's working alongside, who also happens to be her father, Valentine Red. So to the Red family, thank you for sharing Valentine and Zanyulin with us. We cannot be prouder, and we hope they both stay safe as they do their work to keep their patients safe. I know that they're friends of our colleague Lauren Lalacon, so God bless you, Reds. Next, I want to give a big shout out to Raritan Valley Community College. The college's advanced manufacturing and engineering programs, along with the arts and design department and Somerset County Vocational and Technical High School, have turned to producing 3D printed face shields that are heading to Robert Wood Johnson University Hospital, New Brunswick, and Somerset. So to Advanced Manufacturing Program Coordinator Conrad Mercurius and everyone involved, thank you from the bottom of our hearts. And finally, a shout out to the members of the Disabled American Veterans Chapter number 2 in Clifton. Look at that group, God bless them. The veterans there pooled their donations and were able to provide gas gift cards to 100 emergency room healthcare workers at St. Joseph's Regional Medical Center in Patterson and St. Mary's General Hospital in Passaic. So to Commander Malvin Frias and his team, thank you for your service on our nation's front lines in times of war, and thank you for stepping up to help the healthcare responders in this war. Again, folks, please continue to share your stories at that hashtag NJThanksYou. So all that said, I just want to thank everyone for all you are doing to help us get ahead of this pandemic and to stay ahead. It's neither easy nor fun, but social distancing is, whether we like it or not, the key to get us through this. Again, a particular shout out to the members of our Jewish community, our brothers and sisters. I wish you again a happy Passover, a blessed Passover. And I ask you, not urge you, I ask you again that tonight's Seder and any other gatherings must be small, with immediate family at most, in your household only, no more than that. Please, it breaks my heart to say this, but you cannot gather in any numbers. We want to make sure, as I said earlier, that next Passover, everyone in your family and your friends can gather as you did last year and in the years prior, and God willing, in the years ahead. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. As the Governor said, today we toured the second field medical station in Edison. These field medical stations will be vital to support our regional hospitals. And we need them for low acuity medical surgical patients who cannot yet be discharged to home and need some convalescence. These sites are designated for low intensity medical surgical patients, lower acuity. They're expected to have a length of stay from a couple of days to up to 5 days. The initial priority will be for non-COVID conditions and then expanded to those with COVID-19 illness as our resources permit. Some examples of individuals that will be in the field hospital are patients that need IV antibiotics or IV fluids and need to be monitored on an hour-by-hour basis, or patients that have had some operations. As you know, we've curtailed elective surgeries, but there are still patients who on an emergency basis may need operations and are needing operations in our facilities, our hospitals, and they still may need some further monitoring. Or maybe they need some symptom control for pain or nausea or vomiting, or individuals in need of regular physical exams, such as checking for non-healing wounds and some minor treatments. Patients who require critical care will remain in the acute care hospitals. Additionally, this site will not serve critical patients, and also pediatric patients and pregnant patients will not be appropriate for the medical field service, and any patient that requires a higher level of intensive care nursing. So as you know, this pandemic is unprecedented. These situations in our history show clearly the vulnerabilities of a healthcare system. And I think you would agree with me that the long-term care system right now is one of them. To address this challenge, we're working on a statewide plan to assist nursing homes experiencing large outbreaks and shortages of staff and equipment. Let me share with you some of the basics of the plan. The goal is to develop a statewide response to control the spread of COVID-19 in our long-term care facilities, to prevent the transmission of COVID-19 to those residents who have not been exposed, to provide safe and appropriate care for those that are suffering from COVID-19 disease, and to provide appropriate protective equipment for our staff. As you know, the activities to date, we have reviewed all of their outbreak plans that they were required to put together after the Wanacue situation. We've acquired them to assess all employees and vendors coming into the facilities for symptoms. We've curtailed visiting. We've distributed guidance on pandemic planning, and we've advised all facilities of their obligation, as you know, to report outbreaks. So going forward, our plan right now is surveying all long-term facilities in their ability to cohort patients on a separate wing or a separate floor, and their ability to place residents in private rooms with private bathrooms. We're taking an inventory of their PPE, which is a continuing issue. We're surveying their employee capacity and reviewing the facility's staffing plans. We're identifying employees that are available to work, those home on quarantine, those symptomatic and isolated, and those that are positive and hospitalized. We're requiring cohorting of residents according to the following classifications: asymptomatic, no exposure; asymptomatic with exposure at a facility with an outbreak; symptomatic, tests negative, could have a respiratory illness, not COVID-19; symptomatic and test positive; and positive transfers in or back from an acute care hospital. Determining the ability of the facility to cohort employees is also an important aspect of our plan to limit the movement of staff between negative and positive residents and to isolate residents exhibiting signs of respiratory illness. We're evaluating the compliance with the guidance for monitoring residents per shift for fever, respiratory, and other COVID-19 symptoms, such as malaise, change in mentation, diarrhea, vomiting, coughing, shortness of breath, and fever. Facilities that cannot conform to the CDC or Department of Health guidance will be prioritized for transfer of patients based on the prevalence of the disease in the facility. The transfer of patients will go to COVID-positive facilities. We're developing statewide contracts with 2 to 3 systems to accept transfer of these patients. We will regionalize the transfer of patients and develop an enhanced reimbursement plan with the Department of Human Services and an existing transport plan using existing transport EMS or developing regional contracts if we have to transport a significant number of individuals. We know that any movement of this population will be disruptive, so we're hoping that this planning can be implemented with the least amount of stress as possible for our elderly in these homes. Our goal is to keep those who haven't been exposed safe and to ensure that those who are exposed or those who have tested positive get the care they need. According to the data reported from our hospitals right now, there are 7,026 hospitalizations, which include COVID-19 positive patients and persons under investigation. 1,617 individuals who are in critical care and 1,576 of those individuals in critical care are on ventilators. That means that 97% of our patients who are in critical care require a ventilator. You may recall, I've been sharing for weeks that we felt in New Jersey it was going to be a 1-to-1 ratio. And as the governor has shared with you repeatedly, we need ventilators. Of the more than 7,000 individuals hospitalized, however, if you look at that full number, about 22% are on ventilation. Today we're reporting 3,088 new cases for a total of 47,437 cases in the state. And as the governor shared, sadly 275 new deaths. 48 of these new deaths were residents of long-term care facilities. There are now 231 long-term care facilities in the state that have reported at least one COVID-19 case. These case numbers include reports from 375 nursing facilities and approximately 200 assisted living facilities and other settings such as residential memory care housing. There are now 1,504 facilities in our state. 1,504 fatalities in our state. 3 of those deaths reported yesterday were removed from our count. They were found not to be residents of New Jersey. These numbers change occasionally because after further investigation, we find out more details. The families of all of the individuals, as you know, repeatedly, considerably are in our thoughts and our prayers. For all of you, one of the best ways we can honor those we have lost is to do our part to slow the spread of COVID-19 by staying home. By staying home, you can actually save lives. According to data from this morning, of the 7 laboratories sending us COVID-19 results, 94,525 tests have been performed, of which 41,550 are positive, with a positivity rate of 44%. That means that more than half of the results have been negative. But we remind those who test negative and have symptoms that they should continue staying home and be mindful of respiratory etiquette and social distancing. As always, the Department of Health encourages you to stay in touch with each other, call your neighbors, friends, and relatives. As the government has said, be in social solidarity. Thank you.
Judy, top 5 counties again total positives have remained the same. Bergen, Essex, Hudson, Union, and Passaic. That hasn't changed in probably 10 days at this point at least. Secondly, you may have said, and I apologize, of the fatalities, any more color in terms of age, race, gender, etc.?
Sure, thank you. I did not go over that. Of the total 1,504, at this point, 59% are male, 41% are female. The age range is as follows: 1% under 30 years, 4% 30 to 49 years of age, 17% 50 to 64 years of age, 33% 65 to 79, and 44% over 80 years. And we are still evaluating almost 1,000 of the cases. Of the deaths, the racial breakdown is as follows: 61% white, 22% black or African American, 6% Asian, and less than 1% is Native Hawaiian or other Pacific Islander. And we're still reviewing 112 or 11% of the cases. 44% of the cases at this point have documented underlying conditions. 2% or 28 of the cases have not documented an underlying condition, and 814 of the cases are still under investigation.
Thank you for that. We discussed this the past couple of days. I believe, just by example, this is on the front page of the New York Times today, as we discussed earlier, communities of color appear to be, and again, we can't draw complete conclusions yet with so many cases still under review, but New Jersey looks like it is in a similar reality as we had feared, that communities of color are sadly more disproportionately represented in the fatalities than in the community at large. So I think it was yesterday you had at 24, it's 22% African American today. By example, by the way, I'm not ignoring other communities of color, but that would be up against a 14 or 15%, I believe, percent of the general population. Thank you for all. Again, we have to keep reminding folks, again, fatalities are folks who got infected probably 2 to 3 weeks ago. Tests that we're announcing today could have been 10 to 14 days ago. A positivity rate of 44%, that's crept up, but it's crept up slowly, fair to say, over the past couple of weeks. Again, we're testing overwhelmingly, not exclusively, overwhelmingly symptomatic people. And so we have to keep reminding folks that's if we had the materials to do universal testing, would be all in for that. And as you've seen every day when I announce how many testing sites are available, the number goes up literally every day. And God willing, it'll continue to go up. And innovations will come to pass, whether it's from Rutgers or Abbott Labs or others. And we're bird dogging all of those. It's such that we'll be able eventually to have a much broader regime. Given the hand that we've been dealt, particularly in the federal piece of this, we have prioritized for moment one symptomatic folks. Pat Callahan, we're going to start over here in a second, Brendan, but Pat Callahan, anything on compliance, PPE, equipment, manpower, or other matters? Great to have you.
Thank you, Governor. Very briefly, with regards to compliance, overnight yesterday, troopers had to break up a funeral that had 40 to 50 attendees at a funeral that was in Millstone. Troopers from our Port Norris station responded to a motor vehicle accident, and the woman was charged with driving under the influence. She was threatening to spread COVID-19 on them. Newark issued 34 executive order violations, as well as closed 3 businesses. Pemberton Police charged a subject with executive order violation. He just refused to disperse and continued to disrupt the community. In Union, a subject in violation of the executive order was not at home and was observed burglarizing multiple vehicles. And in Patterson, a subject who was in violation of a final restraining order was arrested for that, in addition to try to avoid arrest by threatening to have corona. As far as overall operations, to the Commissioner's point about transportation, we're finalizing contracts with 50 basic life support ambulances, as well as 25 advanced life support ambulance services in order to facilitate the transportation and transfer of patients. And I would just end with, I know you referenced Ray Bolger and Jerry Lynch, and I know he was obviously famous for the scarecrow role, but I could not think of a more fitting line. The last line of that movie means more today than it did back in 1939, and that is, there's no place like home. Governor.
Well said, Pat. Well said. Thank you for that. And again, our compliance energies, our enforcement energies, and not only do we have to tip our hat to our heroic healthcare workers, but first responders who are going in harm's way and breaking up these gatherings and dealing with knuckleheads who are coughing and spitting and threatening that they've got corona. We can't thank them enough. We have to make sure we all have them up on a pedestal and remember what they've been doing here, right with our healthcare workers. And then, by the way, the circles that go from there, the essential retail workers who, with one of these executive orders today, we're trying to protect even more so. NJ Transit, longshoremen, supply chain warehouse workers, the folks who are keeping the show going during all this. So, Pat, thank you, Judy. Thank you. We're going to start with Elise. By the way, I want the record to show that as I watch occasionally Governor Cuomo, he walks out with people screaming questions at him. So I want to make sure we get some credit for the patience that we have with all these questions. But let's try to keep it south of a 3-act opera today and keep things moving. So Elise, with that, fire away.
Let's see. What is considered non-essential construction, and how many projects will be affected? How many patients are at the Meadowlands Pop-Up Hospital? And one of my colleagues has written about a nursing home in Elizabeth. You probably read about it in the Star Ledger today. A nursing home in Elizabeth with multiple coronavirus fatalities and potentially others as well. The mayor of Elizabeth is asking for an attorney general investigation into operations of that nursing home. Do you have any comment on that?
I would just say a non-essential I don't know how many projects are impacted. Paramount, do you know?
We don't have a number.
Yeah, I don't have a number. And the definition is literally, I'm not kidding you. This is, where is it? I'm sure I've got this. This is the, at least this is the bullet points. So I think it probably makes the most sense. I assume this is public or will be public.
It will be public later this afternoon.
Yeah, and then maybe if you could allow us to make it public and then follow up with Paramel or Mahan on questions specific to that would be, I mentioned some of the big categories in my remarks, but there are, as you can see, many. Judy, pop-up, you've got some customers coming in today, I believe, is that right?
Yeah, in Secaucus. We hope around 20 to 25. It may be lower than that. We have admission criteria that identify the specific types of patients that are appropriate to come in. So we hope between 20 and 25.
And just for the record, the three of us were in Edison today, and they said they would be sort of looking at a soft opening as early as Saturday. That assumes they get the manpower to actually run it. And Atlantic City, Pat, you had mentioned that day, the 14th. Are they still holding with that, or has it slipped a couple?
That's correct. Still on target for the 14th.
Okay, so again, the 14th is next Tuesday. That's the equivalent of what the three of us saw today. So not with patients, but with construction essentially completed. I read the article, Elise, awful. And again, I'm looking at the article as opposed to having the inside view that Judy will share with you. It appeared as though there was both COVID and non-COVID related fatalities based on the reporting. I've not spoken to the mayor, and if the attorney general is involved, I'm sure the advice I'm going to be given is to not comment on that. But obviously, it's something it's heartbreaking, understates it. It's heart-crushing to see something like that. Again, long-term care facilities, known from moment one, are going to be, for a whole variety of reasons, more at risk than perhaps even any other category of persons, or at least as much so. Judy, any comment you want to make on that particular case?
No, we're keeping all of the long-term care facilities on our radar screen. We actually have 3 facilities that have a death rate due to COVID that we think deserves more attention, and we're giving that attention to them. And the plan will go into effect as we're speaking. So we plan to we plan to address this as aggressively as we can.
Again, tragic. No other way to put it. God rest their souls. I'm going to go back to Nikita.
All right, so I'm just going to ask that you cut me off once I start asking too many questions.
I'll have no problem doing that.
All right. So first off, why choose July 7th, given that it's just 3 days after the 4th of July? Why not maybe pick a July 14th or some other day like that?
Didn't want to upset the French.
And then, given that pre-election days tend to be pretty hectic for election officials, do you expect to have to order county or state election officials to remain open on July 3rd? And will you require that counties that have weekend in-person pre-election voting be ordered to remain open on the 4th of July? Further, do you anticipate issues with polling locations or poll workers for the July election? And have you discussed the effects of the order with the judiciary, given that it gives them a month fewer or a month less to make certain determinations related to the general election? And finally, have you considered giving any state funding to enhanced county level vote by mail efforts?
Let me just quickly go through. The runway from July 7 to the Democratic Convention, which was always going to be the first of the two. And by the way, again, remember, this is a nonpartisan decision here. We posted and consulted with folks on both sides of the aisle. Is about the same runway as June 2nd had been to the what had been the July 13th convention. And keeping something that resembled that runway in terms of the amount of days was important. No real insight. I'm not trying to dodge it. We just don't have any insight on your questions of July 3rd, 4th, polling locations, workers. You probably heard me say in my remarks, we don't want to be in a Wisconsin situation yesterday where you've got people at the height of a, God, please God, we're not in this on July 7th, but we have to reserve the right. The decision on workers, locations, vote by mail or not is happily not a decision we need to make now. We've bought ourselves a significant number of weeks here. And so that is to be determined, all the above. I don't know on the question, do we consult the judiciary? I assume we did, Paramel, but
not that I'm aware of.
Not that I'm aware of. Okay, Paramel will correct me as usual. And again, on vote by mail, no monies that I'm aware of from the state, which by the way are as scarce as they've ever been right now. Nothing that we've designated to counties, but we haven't also made a decision about the breadth of vote by mail in this particular primary. Thank you. Real quick, yep.
Is all VBM still on the table?
One more time.
Is all VBM still on the table for?
It's still on the table, yes, but no decisions. And the good news is we don't have to make a decision on that for a number of weeks. My hope, by the way, let there be no doubt, my hope is that we are through this horror crisis, that we've begun to get back on our feet, and we can, with directions from the woman to my right, have social distancing guidelines that can work with polling stations. That would be a really hope for result here, and so we're going to play that out as long as we can. Thank you, Matt.
Hi, Governor. So we've been hearing about nurses and other medical professionals who've been disciplined and some even fired for bringing their own protective equipment and sharing it with coworkers. I'm curious, what do you say to hospitals that are doing this at this critical time? Will you get involved? And also, is there any indication, and maybe Commissioner, is there any indication that hospital admissions are leveling off with maybe fewer divert statuses on a given night? Real quick, Governor, I'm curious how you square telling everybody that it's not safe to go to the polls that first week of June, but we're still contemplating whether or not schools will be in session then, or even the rest of the year. I mean, Just curious where we stand on that. And just lastly, curious, Governor, what do you think about cities like Newark and Trenton exceeding your executive order for things like curfews in order to stem violence there?
Yeah, I'm going to leave certainly hospital admits and diverts and to a large extent nurses to Judy. I don't know. I read of the situation. I think it was at Shore Regional, to the best of my knowledge. And it was actually I may have the hospital wrong, so don't quote me. But I read of someone being disciplined. I think losing their job on some basis. I don't have any insight into the particular situation, so I have to put that aside. Although we stand on the side of working families always in this state. Let there be no doubt about it. But again, without any insights there, I can't comment on the specifics. But boy, I'll tell you something. I assume somebody has to be doing something really bad if you're a healthcare worker right now to be cut from the team, because we are literally diving on every loose ball we can find. So I'll leave it to greater minds. And again, that's not any comment about the specifics. Yeah, there's nothing. The primary we had to make a decision on that, Matt. And I was asked about schools. Senate President and I had a conversation about this yesterday afternoon or last night. In the schools, the good news is we just don't have to make that decision yet. We promised we'd give guidance by April 17, which is a week from this Friday, and we will do that. But we had to make a decision as it relates to the primary. And listen, I said this in my remarks, that there's one set of executive orders that hold, that matter, that overarch all others, and they're ours. We have to have one state. I can't say enough good things, and I'm not as familiar with Trenton, although I'm a big fan of the mayor's, but we've said a lot about the leadership that Mayor Baraka and, by the way, Director Ambrose and their colleagues have shown in compliance and enforcement. I think, as it turns out, most of these are recommendations as opposed to hard and fast executive orders. So there's no question which executive order has primacy, and that'll stay that way. So no more details on that. Judy, on either nurses